Good evening. My name is Doug Hanto, and I am the chair of the Surgical Ethics Working Group in the Center for Bioethics at Harvard Medical School. On behalf of the Surgical Ethics Working Group, I would like to welcome everyone to our third Harvard Surgical Ethics Conference, Ethical Considerations in Surgical Innovation. Over 1,000 individuals have registered for the conference from around the world, and we would like to thank you for getting up early, staying up late, and taking time off from work or leisure to join us this evening. I believe we have an exciting hour and a half ahead of us. I would like to review a few housekeeping items before introducing our moderator, Dr. Louise King, who will introduce our topic for this evening and our speakers. First, we would ask that you submit any questions that you have during the conference using the Q&A feature found in the meeting controls at the bottom of your screen. We would ask that you not use the chat room for asking questions. Selected questions will be discussed after all the presentations have been completed, or you may continue the conversation on Twitter using hashtag HMSBioethics. If you have any technical issues, please use the chat feature to send a message to all panelists, and a staff member will be available to help you. If you are interested in upcoming events, news, or education programs, you may subscribe to the Center for Bioethics email at bioethics.hms.harvard.edu/subscribe. And finally, just a reminder that following tonight's conference, the talks as well as the panel discussion will be available on the Center for Bioethics YouTube channel. Without any further ado, I'd like to get us started this evening. First, I would like to introduce Dr. Louise King, who has JD and MD degrees. She is currently an assistant professor of obstetrics, gynecology, and reproductive biology at Harvard Medical School. She is Director of Research, Minimally Invasive Gynecologic Surgery, Associate Program Director for the Fellowship in Minimally Invasive Gynecologic Surgery at the Brigham and Women's Hospital in Boston. She is also Director of Reproductive Bioethics in the Center for Bioethics and co-director of the Medical Ethics and Essentials of the Profession course for first-year Harvard Medical and Harvard Dental students. Her areas of interest in medical ethics are broad, but focus on questions of informed decision-making and assisted reproduction, as well as equitable access to advanced gynecologic surgery. We're honored to have Dr. King with us tonight to moderate this evening's session. Dr. King?
Thank you so much. That was such a kind introduction. I'm so grateful, and I'm so happy tonight to be here to talk about this topic. It's one that I'm deeply passionate about in my own area of gynecologic surgery, and I've been lucky enough to have sort of a preview of these talks as we've met to prepare for tonight. I think you're going to find them very, very interesting. I'll be moderating the chat as best I can. I have my own questions for the speakers, and I will weave in as many questions as I can from the questions that you submit. So it's my honor right now to introduce Richard White, who is the Vice Chair of Surgery at Beth Israel Deaconess Medical Center, Professor of Surgery at Harvard Medical School. He received his MD from the University of Pittsburgh and MBA from Wharton. He's interested in bioethical issues pertaining to the field of surgery, particularly cardiothoracics. He is on the ethics committee of two national surgical organizations, the Society for Thoracic Surgeons, and where he is the chair, and the American College of Surgeons. I'm also lucky enough to say that he was a mentor to me in my years at BIDMC. I was so grateful, and remains one today, but so grateful for the time he spent with me, inviting me to his office, talking about surgical ethics, providing me support and encouragement. He's an incredible person, and I'm looking forward to his talk.
Louise, thank you very much for the kind introduction. Let me just share my screen, just get this set up fairly quickly. There we go. Well, welcome everybody to the session this evening. I hope you find it interesting. As Dr. King mentioned, I'm a thoracic surgeon and vice chair of surgery at Beth Israel Deaconess, and have had a long interest in the ethics of surgical innovation. I will start out by saying that I have no disclosures. And I'll point out that this session on surgical innovation has three components. I'll be presenting a fairly high-level look at the ethics of surgical innovation, focusing on the ethical principles and more generalized areas of ethical debate. My colleagues, Dr. Teresa Williamson, Dr. John Meyer, and Dr. Martin McNeely will then focus on some specific examples. While the word cloud shown here presents a number of concepts associated with innovation, both the Oxford English Dictionary and the Merriam-Webster Dictionary define innovation as the introduction of new things, ideas, or ways of doing things. And in this spirit, I'd like to posit that as a surgeon, some level of innovation is commonplace and arguably essential. While I was tempted to start the presentation with a case, the introduction of minimally invasive surgery or robotic surgery as a replacement for open chest or abdominal surgery, or the use of extracorporeal membrane oxygenation as a bridge to lung transplant, or the introduction of aortic valve replacement by transcatheter devices rather than traditional open surgery using cardiopulmonary bypass. You're going to hear some of these things in the second and third portions of the talk. Furthermore, I think that you can use your own experiences in surgery to look at current surgical techniques, and I think you'd be hard-pressed to come up with many examples of things that were done exactly the same way that they were done 20 or 30 years ago. Now, while this shows the results of innovation on a macroscopic level, at the level of the individual surgeon, each of us have adapted our surgical techniques and decided what level of evidence is sufficient for us to make that change. While you may take the statement that innovation in surgery is essential as a postulate, there are a number of ethical frameworks that we can use to examine the statement. For example, if one chooses a consequentialist approach to ethics, meaning that what is right or wrong depends on the outcome or intended outcome of an action, the desired outcome of a surgical procedure is an improved state of health. Given that current surgical techniques are not perfect, nor are all surgical outcomes perfect, it would be a good thing to do to devise new and better ways of doing things. As the primary focus, if the primary focus is on the individual, the surgeon's obligation is to provide an optimal outcome for that patient. If one takes a more communitarian view, the obligation of the surgeon is to provide optimal surgical care to the community as a whole. Again, our current techniques are great for some conditions, but clearly wanting for others. In other words, there's clearly room for improvement, and it would be our obligation to pursue those opportunities, but more with the best interests of the community in mind, rather than those of a specific individual patient. If one chooses a deontological or duty-based approach to the analysis of ethical issues, we have obligations to provide our patients the best care possible. Our duties are codified in descriptions of the physician-patient relationship, which involves fidelity or loyalty, among other things, meaning that we have a fiduciary duty to put the patient's interests above our own. Again, since we know that surgical outcomes are currently not ideal, one could conclude that it's in the patient's best interest to improve upon our current armamentarium of techniques and devices. Interestingly, while a specific patient or clinical problem may stimulate the idea for a clinical innovation, the pursuit of that innovation is probably made more with the interests of future patients in mind. Also, while many of our obligations as physicians and surgeons are to our patients, we are all members of a profession, and professionals have certain obligations. While the obvious one is that which I've alluded to above, a fiduciary duty to our patients, it's been argued that these obligations include not only having and practicing a specialized body of knowledge and skill, but to apply that skill and knowledge to the betterment of society and to the advancement of the professional field. Finally, from a virtues ethics perspective, or what would a truly virtuous surgeon do, there would be an obligation to recognize the limitations of what we can currently offer our patients and to pursue better approaches to the diseases that we treat. Who would argue that the truly virtuous physician would be satisfied with the status quo? So whether one takes a consequentialist approach, a deontological approach, or a virtues ethics approach, as they say, all roads lead to Rome, and it's our obligation to improve upon the current state of the art of surgery. But we've omitted one of the common approaches, and that's the principalist view. And I think many students in the US are quite familiar with this text, Principles of Biomedical Ethics. I think that perhaps in other countries, it's not so widely used. But it uses the familiar Beecham and Childress quartet of autonomy, beneficence, non-maleficence or minimization of harm, and justice. The principle of beneficence obligates us to improve upon the current conditions. That said, as we cannot predict the future regarding new devices, techniques, or ideas, the potential for harm or that which we are trying to avoid through non-maleficence is lurking behind the veil of good intentions. Now, while I will come back to the principles of autonomy and justice, both of which are important in the discussion of innovation in surgery, I'll first focus on the balance of the goal to be beneficent with the risk of doing harm. Can the individual surgeon be trusted to balance opposing forces for the potential for good versus the potential for harm? Perhaps a truly virtuous surgeon could, but most of us are mere mortals and we have our own biases, agendas, and perspectives. If one has developed a new surgical device, for example, is it not natural to want it to work? Does that introduce bias in its assessment, particularly if the initial assessment is non-quantitative? While most of us get excited about doing new things, it's possible that such excitement can lead to looking at the innovative thing through rose-colored glasses, and either in foresight or retrospectively focus on the upsides rather than the downsides. Now, digressing slightly from the issue of the potential for benefit from the potential for harm is the issue of patient autonomy. While the concept of autonomy is multifaceted, one of the issues is that of informed consent, meaning that the patient has some understanding of the issue at hand, as well as the options for treatment and the relative risks and benefits of those options. In the context of standard operations, the risks and benefits of the procedures are well known, as are the rationale and intricacies, which are well characterized and can be presented to the patient at whatever level he or she desires. But in the context of innovative surgical care, the relative risks and benefits may be less well characterized. How would we pose the risks of the innovation to the patient, particularly since at the outset, these risks may be largely unknown? And for a new technique involving innovative and complex new technology, how do we even know what the patient wants or needs to know? Is it sufficient to simply ask the patient to trust the surgeon and to make the right decision? And while this may be applicable in the emergency situation, for instance, the case is going poorly and all normal avenues for salvaging things are exhausted and the patient may die, an innovative approach may be completely appropriate. But really, how often does this really happen? And aren't most opportunities for innovation known well in advance? Finally, there is the issue that if the surgeon has a vested interest in a new device or technique, might this cause him or her to downplay the potential for harm? So this leads to the discussion of the oversight of innovation. And some of the questions I've posed, the answers to them lie in the area of incremental innovation and with some level of oversight. Now, while none of us enjoy being under the microscope, I would say that some level of oversight of innovative surgical techniques is probably necessary. While some innovations are done really without patient consent, particularly those that are urgent in nature, or to the surgeon's perspective, rather minimal, I choose to use a new stapler or suture, for example, or I do my anastomosis a little bit differently. For many of these changes or innovations, there's been a body of predicate investigative work that makes my modification reasonable. In other words, I have expert knowledge that the patient doesn't have. But while expert knowledge is an essential characteristic of being a professional, along with it goes the responsibility to use the knowledge wisely, reasonably, and in the patient's best interests. While I probably shouldn't bring in a new instrument from my garage to try on a patient, it's probably completely reasonable to use a commercially available device, particularly if there is literature support in its use in a similar situation. But again, what about the first time it's used? Again, for commercially available devices, there's usually a regulatory process that justifies change. But again, it generally boils down to the potential for benefit versus the potential for harm. So I think that we see a distinction between trivial innovation and non-trivial and trivial innovation, as well as a distinction between planned innovation and an essential or urgent one. So if the innovation is both planned and not trivial, some element of oversight is arguably essential. An unbiased assessment done through the lens of peers or others with expert knowledge can be protective of both the surgeon and the patient. Who else besides the patient and the surgeon has a vested interest in the act of innovation? Well, at some level, the general public does have an interest, thus leading to a regulatory process. On the other hand, I don't think that we generally allow the general public to micromanage physician-patient interactions. The hospital where we practice also has a vested interest, as it is responsible for what occurs within its wall, and it has an interest in preventing unreasonable and perhaps even dangerous practices. Now, further along the lines of oversight of innovation, I'd like to point out what some institutions have done, and I have a picture here of Dr. Shav Kasavji from the Toronto General Hospital, who's made some remarkable innovations in the field of lung transplantation. Dr. Kasavji, a number of years ago, introduced a surgical innovations committee at Toronto General, whereby new procedures are vetted for appropriateness. The approach has the obvious attractive feature that proposed innovations are scrutinized by a body of peers, primarily surgeons, but also others in the operating room environment, those who are likely to share a common body of expert knowledge and to have a similar appreciation for the needs of innovation. On the other hand, a group of similarly minded individuals may be more prone to groupthink, and a lack of diverse input may lead to conclusions that, while they may seem right to a group of surgeons, may not be so well received by other physicians or the lay public. The concept of the Surgical Innovation Committee has apparently been adopted successfully by other institutions, some of which have come up with centers of innovation. Some of these are focused on peer review and support of innovation, and others seem more focused on research around innovative approaches to surgical technology and are designed to foster improved interactions with industry. In other institutions, including my own, new procedures need to be approved by the Medical Executive Committee, which is the medical staff committee spanning the breadth of the hospital's specialties. While this encompasses a broad-based or diverse set of perspectives, a shortcoming is that the actual surgical component may be quite small. Furthermore, as many people will either know or will experience, hospital committees can be rather inefficient. And at least in my institution, the line between a new procedure and a modification to an existing one can get quite unclear. While it might be reasonable to have every surgeon who wants to use a surgical robot trained in and credentialed in the use of the robot, does it really make sense to make a, quote, robotic lobectomy a new procedure when a thoracoscopic lobectomy has been done for 25 years? This being roughly the same operation, but with hand-operated instruments rather than robotically or remotely controlled instruments. Or what about when a new robot becomes available? If every time we change robots, we have to call it a new procedure, we'll spend our lives dealing with the Medical Executive Committee and not actually getting anything done. If one of our colorectal surgeons does a procedure with a new single port robot, when he normally does it with several ports and an older device, is this a new procedure? Some would have argued yes, others no. While these may seem like fairly straightforward questions with straightforward answers to surgeons, they are not so straightforward to non-surgeons, let alone lay people who often provide oversight to medical leadership. Finally, I'd like to point out that the National Academy of Science, what was the Institute of Medicine, has recently established a task force to examine how medical and surgical innovation is conducted in the US and how to define best practices. So while we have considered surgical innovation committees, medical executive committee, and hospital board committees, is there a role for human subjects research committees or IRBs to weigh in on surgical innovation? In the context of IRBs, we generally consider research to involve the generation of generalizable knowledge and to involve fairly rigid protocols. Not everything to do with human subjects is research, and not all research deals with human subjects, but the IRB typically deals with the interaction of research and human subjects. Now, while some surgeons at some institutions may want to study a new technique, i.e. research, others simply want to do what others have done and have been found to be beneficial. Now, certainly a systematic analysis of an innovative technique would require IRB approval, but innovation, like quality improvement, is often continuous and not taken in large steps. So one can easily argue that IRBs are probably not well suited to the processes involving continuous change. Finally, in terms of regulatory oversight, I would bring this example to the front. The recent transplant of a genetically modified pig heart to a human. This was done at the University of Maryland roughly 3 months ago. Now, this wasn't considered research. This was certainly innovative, and its approval involved the Food and Drug Administration, presumably in addition to some institutional approval. Now, why the FDA? Well, this is because by statute, the FDA has oversight of the administration of biological products, and certainly a genetically modified pig heart would be considered biological. In the case in question, the FDA provided emergency authorization under compassionate use criteria for the use of the pig heart. Now, the FDA also provides oversight for some other innovative devices, such as certain types of endografts, under their investigational device exemption pathway, or IDE pathway. And it's interesting to note that while early trials of many new devices are conducted in countries other than the US, one has to ask if this is solely because the regulatory burden is lower in other countries, and they're not all third world countries, I might add. It could also be that the risk-benefit ratio or availability of what we call standard treatment is different in other countries. Finally, I'd like to invoke the concept of justice. We've talked about autonomy, we talked about beneficence and non-maleficence. In terms of justice, who gets access to innovative approaches to surgical disease? And this is another fertile area for ethical discussion. While we have heard of and read about racial and socioeconomic healthcare disparities in this country, how does one ensure that the benefits of an innovative approaches to surgical care are distributed in an equitable and just fashion? Unfortunately, allocating the benefits equitably probably also means allocating the risks similarly, as it's obviously patently unfair to assign the benefits to one group and the risk to another. Given the uneven access to healthcare, unequal levels of trust in the medical establishment, differential reimbursement mechanisms often based on insurance, and the obvious fact that innovative techniques by their very nature are that they are new, low in volume, and geographically limited, makes it difficult to distribute, at least initially, an innovative technique on a wide level playing field. Yet these issues must clearly be considered by both the surgeon and the institution involved. So with that, and while there are many other questions, such as when is an innovative approach justified, there's just not enough time to do this now. I'll conclude my broad strokes and high-level discussion, and will now turn the podium over to my colleagues. And I thank you all for your attention.
Thank you so much for that excellent overview. And we're going to have questions at the end. I haven't seen any in the Q&A function of Zoom. Remember, that's where to put your questions. And it's labeled Q&A, I believe, at the very bottom of your screen. It's my honor right now to introduce Teresa Williamson. She is a neurosurgeon and surgical ethics researcher who cares for people with all types of spine disorders, as well as brain and spinal trauma. Dr. Williamson is a graduate of Yale College, where she played varsity soccer, I learned as I prepared this, and Yale Medical School. She came to MGH, one of our affiliate hospitals, from Duke University, where she completed her neurosurgery residency and then her orthopedic surgery complex spine fellowship. She also completed the University of Chicago McLean and American College of Surgeons Surgical Ethical Fellowship in 2021. Her research focus is neurosurgical decision-making and patient-doctor communication, and she also focuses on healthcare disparities. She's a member of the Center for Outcomes and Patient Safety in Surgery, which is abbreviated COMPASS, at MGH. And I'm just getting to know Dr. Williamson. It's such a pleasure to get to know her in some of our working groups, and I'm very much looking forward to her talk.
Thank you so much, Dr. King. I'm going to go ahead and share my screen. Okay, so thank you so much for that introduction. I'm Teresa Williamson. As Dr. King mentioned, I'm a neurosurgeon at Mass General and work at the Harvard Center for Bioethics. I'm going to talk a little bit today about implementation of new devices in the operating room, and I'm going to give you my perspective as a relatively new spine attending surgeon. So I'll start off with my disclosures because we're talking about new device implementation and what's appropriate and what's conflict. And so I do have a disclosure, and that's that I'm a consultant with DePuy Synthes, which is a spine technology company. And I think that's important for you to know because, in spine surgery, we have really close relationships with industry. We have, tables and tables of instrumentation every time we do a surgery, from screws to rods to, different devices to put in cages. And it's important for us from an educational standpoint, from an innovation standpoint, from a patient care standpoint, to have some type of a relationship with industry. The question is, when does that relationship go too far, and how do we best manage it in an ethically appropriate manner? So this is me in the OR, and I'll show where those relationships can be a bit challenging. So while I'm in the OR, I'm working here with a resident. We're actually working on a new technology, taking care of a patient using augmented reality to put in pedicle screws. And this is my email inbox that I'm going to come to when I get out of the operating room. And so I'll just read you a couple of the examples of things that, might be said from an industry representative about a surgery that, they may want me to do, or, a technique that they may want me to use. So your business is extremely important to me, and I want to build a relationship where you can trust us for all your needs from an instrumentation standpoint and technology front. I was curious if you had thought about our MIS screw system and if there's anything in particular holding you back from giving it a try. And then this is in reference to a new technology that they were interested in me trying. Here is the fill in the blank new technology surgery training certification quiz. Just start the exam. So there's a lot of reasons why, my inbox is flooded with new technologies and new ideas, and some of them are related to patient care and really innovating in the space of improving our care for spine patients. And then some are frankly financial. So spine surgery, a single spine surgery costs on average $75,000 to complete in the United States. And overall, it's a $90 billion industry and expenditures yearly in the US. So when we're thinking about balancing such a large financial gain field with a critical need to take care of patients with back pain being sort of the largest disabler worldwide for patients, we have to think of some really critical ethical questions. The first is, should there be a relationship with industry? If there is, which devices should I try? How much training as a surgeon am I obligated to pursue prior to implementing a new device? And then how do we go about monitoring that device for safety and ensuring that we're doing the right thing as we use it? So when I think about the relationships that I'm forming in the operating room with industry representatives, I put them into sort of categories, and I make sure to think about commercial relationships and what's appropriate there, as well as what is conflict of interest. And so I like this definition that comes from the ophthalmologist that talks about commercial relationships and basically the principle of beneficence and non-maleficence, that patient care must not be affected by economic interest in, commitment to, or benefit from professionally related commercial enterprises. And then further, a conflict of interest being where your professional judgment should not be influenced by other interests of the provider, whether that those be financial, publications, participation in trials, etc. And that's, can be challenging, because I'd like to point out that in a typical spine surgery, we use a lot of technology. And so how to manage those relationships is really important, rather than just sort of separating yourself from those relationships. And I'll show you on this picture why I can't separate myself. So this is a patient that had a large spine surgery. This patient in particular had prior surgery, had serious pain, weakness, and needed an extension of their fusion, meaning putting screws and rods in their back, as well as decompression to free up the nerves. So in order to set up this whole space, we have a CT scanner in the operating room that's operated by one company. We have augmented reality to navigate the screws. That's another company. We have a table or two of instrumentation of screws and rods, et cetera, and that's a third company. So those representatives are often present in the operating room, and we have to be forthcoming with our patients about that. And so knowing that we have a lot of technology to use, and that, in order to use it safely and efficiently, it's constantly changing. Not everyone is trained or familiar, particularly nursing staff, with all the different types of instrumentation. So we know that we have to have some type of relationship. The question is how. And so the things that I think are important are to be forthcoming with the patient. So, they're vulnerable, they're under anesthesia, and you want to make sure that you're not doing any harm to them. And so we actually put on our consent form that there's going to be industry representatives in the room with them. And I actually, beyond just reading letting them read the consent form, I will actually mention that fact to them and tell them which companies are going to be there, so that that's fully disclosed. I mentioned not being able to really rush that separation between industry and medicine, but that it's important to discuss the benefits of having an industry representative there with your patient. And then there's the other side of things, which is not letting things get too far. And so we don't want to rush to replace clinical judgment with industry judgment, particularly given the possibility for financial conflicts of interest. So this is an interesting article out of the Hastings Center that I would recommend to you, that talks about industry technicians being embedded in clinical teams, and times at which device salespeople are sort of taking over the case, in the sense that the surgeon is unclear on how to proceed without their help. And then we have to think about how actually that device got into our hands, and how it got into our operating room, and should it be there? Because when you're evaluating a new device, you want to make sure that it truly is doing something better for the patient. It's innovative in some way, that's adding something, and that it's sort of free from bias in how that process has been evaluated. And so this is an article from the Boston Globe that talked about how many Boston hospital CEOs sit on healthcare company boards. And there's nothing, special about Boston. There's certainly a role for surgeons and doctors to be part of companies, because without us, it's really hard to inform change in clinical care and to figure out what the needs are for new things and new devices. But it's important to remember, what type of bias may or may not be playing a role in the decision to, as Dr. White mentioned, use that new robot. That was a big capital expenditure, and there's a motivation for it to be used. Or as a junior surgeon, I often will have people come to me and say, try this device, and they may or may not be financially sort of have stockholders in that company or consultants for that company. And it's just something to keep in mind. It can be a place where getting multiple opinions, where hearing from your colleagues about a new technology can be really helpful to sort of mitigate that bias coming from one view to use a certain device. So in summary, as I think about using new techniques post-training, now that I'm a new attending, these are sort of some rules that I've thought of in my head. And thinking about them through an ethically guided framework. So a new technology should have a benefit. It should be better, or at least thought to be better than what you were using before. If you're getting ready to use something, you should be competent at using that, meaning you should be agile at troubleshooting and figuring out, exactly how things work. You shouldn't be fully dependent on a salesperson. And that a competence is actually comes from commitment to formal study of that device, not just from certification. So if you remember that email that I got about, just a 10-question quiz, that's not sufficient if you want to use a new device. And then it's really important as you go to use that device, and I'll use an example in a second, to think about patient selection and, thinking about the process of how you're going to select a patient who can be well informed and can understand what they're taking on in terms of a novel innovation, but also doing that in a way that you're making sure is equitable and you're getting good resources to all patients. When you're thinking about the process of informed consent with a new technology, especially we have lots of patients that come to us as surgeons, as spine surgeons, that are very vulnerable. They're in a lot of pain. They're really, really eager to get better. And so that vulnerability can beget eagerness to participate with a new device. And so you need to be cautious of that and also make sure that we're giving enough sort of informed information about the risks of a procedure. And then this concept that research is research. And so when you're bringing in a new device, really need to be sure that you're not doing research. And if you are, that it's gone through the appropriate IRB processes. Just to talk a little bit about that new device process. So currently in the US, we use the 510(k) pathway for devices with moderate risk that are considered to be just a small change from a prior device. But that process has come under a lot of scrutiny because it's a way that a significant, at least a third of the devices come into the US ORs. But it's not totally clear that that process does a good job of evaluating new technologies. And so the Institute of Medicine was actually tasked in 2010 and 2011 to look at our current process and look at what I've highlighted in red are some of the, what I think are really ethically from a individual patient and also public health ethics standpoint, very important. So how do we optimally protect patients, promote innovation, and support public health, doing the best for the common good? And if we're not doing that, what are the processes to do so? So they wrote a report on it and really said that this is not a new device process that we should be using, but rather we really have to be careful that this is just looking at devices that are very, very similar to those that were used before. And I think they overall called for some changes to that process. And there's a lot of people, probably a lot on this call even, that would be critical of this process and want us to make sure that we're thinking through guidelines as to how we're using new devices. And so I'll give you an example of a case that I had earlier in my practice that, where I used a new device and where it can go well and where it can not go well and how I mitigated that process. And so this was a patient with a degenerative spine disease who had 2 levels that needed to be treated, meaning 2 lumbar vertebrae were degenerated and causing his symptoms. Typically, when I do this surgery, you have to go through the front of the belly and sometimes the side and the back as well. And so there's a new procedure from a certain company that allows you to just go through sort of anterolaterally and potentially saves the patient positioning, operating room time, a smaller incision, a smaller surgical corridor. So there's some early evidence that this would be beneficial. I talked to the patient about, very frankly, in the consent conversation about the fact that I had never done one of these procedures before, that I had been trained and had done cadaver labs and was working with a surgeon who had done the exposures before, but that this would be my first case of this type of surgery. And even in this case, they had a video, the company had a video that I think was really helpful to share with the patient, and he watched it and he actually had some really great questions about anatomy and possible complications after that to make me feel very comfortable that he had a good idea of what was going on. Unfortunately, during his surgery, we got into a small bleeder, but it was really difficult to contain in a small sort of surgical corridor, and we ended up converting the surgery to open. So I think the question there, and I think that if we were open from the beginning, I think it's important to note that if, using this new technology probably made it more difficult to correct that problem. And made his surgery longer, his blood loss higher, certainly a surgical complication that we discussed with him afterwards. So I think the question is, should I do that surgery again? Does that mean that this new technology is not worthwhile? Does it need to be reported? And I'll be frank, as a new surgeon, I didn't really know. We obviously presented it in our internal conferences of morbidity and mortality, but who do you report it to, or where do you go? And so it was actually a process to learn, how to report a complication with a new device, and obviously reporting it to the company. They may or may not have the incentive to move forward with that information. And then I discussed it with my senior colleagues and those that I knew had done the case before, just to make sure that we were sharing our experiences and making sure that if there was a trend, we weren't, proceeding to just do this case if it potentially caused more harm than good. So learning from that experience and from the literature on implementation of new devices, these are some things that I think are really important. When you draft guidelines or when you propose a new device, it should be free of bias. And so including folks that are, not necessarily financially tied to the particular device in decision-making, seeking multiple opinions, as I mentioned in the last case, making sure there's adequate data prior to transitioning that into a full clinical practice or standard, and then making sure there is long-term oversight, both institutionally and on the sort of national or international level, to think about how we're going to log data to say, if there are sort of poor outcomes or complications from this particular intervention. There's several groups that have thought about this and published on it. So this is the Responsible Development and Application of Surgical Innovations position statement that talks about how to define a new innovation, which I think is part of that challenge when you think about like the 510(k) pathway, and then talks about setting up institutional committees and registries in order to track information when you bring in a new device. The IDEAL framework was recently published in JAMA, which similarly talks about how to look at the quality of evidence before using a new device, and how to implement a new device if you feel like it's appropriately innovative and safe. So in summary, as I look, as a surgeon who works in an industry that is very financially beneficial, but also really beneficial to patients in terms of the ability to treat and improve people's quality of life, there's a balance between the role of relationships with industry. And so that relationship, I believe, should be an ethically guided one with the patient first, thinking about how we can do the best for our patients. When we think about implementing new devices, which devices do I try? The answer is the better ones. So devices that have a potential for improved outcome or shorter lengths of stay, better patient experience. How much training is enough training? I think that's defined by competence. So making sure that you actually have the ability to understand how to use and how to navigate a device. And then how do we monitor device safety? We have data and registries and guidelines that involve multiple opinions and multiple sources without bias. So thanks so much, and I look forward to taking questions after all the talks.
Thank you so much. I just want to say, Dr. Williamson, thank you for sharing your experience in such an open and honest way. We all know that that's very hard to do. But it's exceptionally helpful for the people listening in and trying to learn about these topics to be able to hear your personal perspective of this in such a way. So I'm really grateful to you for sharing that. We have a few questions coming in that I'm going to be working to collate together for everyone towards the end. I'm about to introduce two people at once, just to give you context as I do these introductions, and then we'll have our final speakers together. John Meyer is a graduate of Yale Medical School, and he trained in general and cardiothoracic surgery at the University of Minnesota. He's a professor of surgery at Harvard Medical School and the first Tommy Kaplan Chair in Cardiovascular Studies at Boston Children's Hospital. He's interested in health policy and has served as a Society of Thoracic Surgeons representative to the AMA Relative Value Update Committee. And by the way, there was some questions in the chat about how these things get paid and how we determine how they get paid. And that's the committee the relative value update, or RVU committee that does make those types of determinations, as well as other very important committee work that guides our practice. He's the past president of the Society of Thoracic Surgeons and past chair of the finance committee of the same group, and does a lot of work with that group to help guide us again in policy decision-making. Has been such an important member of our working group, contributing wonderful comments about all of our work as we share together and move some of these projects that we're all working on forward. And I'd also like to introduce Martin McNeely. He served as the professor of, well, I have to preface, first of all, I don't think I can do justice to this introduction because the list of accolades is quite long. And Dr. McNeely has served as our leader of this group until very recently. And he's been an incredible mentor to me as I've explored areas of ethics and surgery. But I'll give you a snippet of some of his accomplishments. He served as professor of surgery and chief of the Division of Cardiothoracic Surgery at Albany Medical Center, and later as chair of the Division of Thoracic Surgery at University of Toronto and Toronto General Hospital, co-chair of the American College of Surgeons Committee on Emerging Surgical Technology, director of the American Board of Thoracic Surgery, president of the Thoracic Surgery Foundation for Research and Education, chairman of the Ethics Committee of the American Association for Thoracic Surgery, and ethics editor of the Journal of the same. He's working with colleagues from our Bioethics Center and the University of Global Health Equity in Butaro, Rwanda, to establish an intensive course in global ethics for the students at this new medical school, which was established by the late Paul Farmer and his colleagues at Partners in Health. That's only one of the many things that he contributes to our community here at the center. And I'm so grateful to him for all his guidance and mentorship. So without further ado, I'll turn it over to our speakers.
Can everyone see my slides, I hope? I'm John Meyer, and we're going to take a slightly different perspective, and that is the perspective of almost, if you will, an organizational ethics perspective, trying to understand the role of professional medical societies in the implementation and dissemination of innovative devices. And we'll use a case of the introduction of transcatheter aortic valve replacement, so-called TAVR, as a new way of replacing one of the heart's valves, the aortic valve, as sort of a case example. So I have no disclosures. And I'd like to start by just reminding everyone about what the roles and responsibilities are for a profession. So the professions are charged with maintaining, advancing, and disseminating a body of knowledge, and to advance that knowledge that is innovate. And in so doing, analyze critically and report the results. Professional societies are required to self-regulate, to place patients' interests above their own, and to place performance above personal reward. And finally, a responsibility to fairly distribute finite medical resources. So the case, as we are describing, is this introduction of transcatheter valves into the US market. And the promise of this technology was that a heart valve could be replaced with a much less invasive method and could actually be done during a heart catheterization rather than an open heart operation, which would mean the patients did not need to have an incision in their chest. There was no need for using a heart-lung machine and stopping the heart to carry out this procedure, and offered, because of the less invasive aspect of this to have a shorter hospital stay and be less morbid for the patients. The uncertainties at the outset, though, was how well these new devices were going to work. And this slide will just demonstrate to you what some of these devices look like. So this is a typical surgically implanted aortic valve over here in the upper left corner, which would require an open heart operation, as I said. This in the upper right-hand corner is the transcatheter valve, which can be sort of compressed down, as demonstrated in the illustration in the left lower quarter of your screen. And so it can be compressed down around a balloon catheter, and then passed through an artery, typically in the groin, up into the position in the aortic valve. The balloon expanded, as is shown both in this X-ray picture here in the middle, as well as this cartoon here in the lower right part of your screen. But basically to expand this valve into the aortic position, and then would be deployed without a problem. So our case involves what happened at the beginning, if you will, of the introduction of this device into the US market. There were actually at least two devices that were being pursued and marketed by two different US companies. The background is that these devices had already been approved in Europe. They've been given the CE mark, which is the equivalent of FDA approval. And although initially they had been treated as somewhat experimental and were placed initially in high-risk patients, but very quickly, when it appeared that they seemed to work at least reasonably well, they were disseminated throughout all patients needing this type of valve replacement, including much lower risk and much healthier patients at the start. And the early results actually indicated that the complication rates were higher for those patients than they were in a comparable surgical patient population. So applications had been placed by both of these companies for the FDA to approve and for Medicare to pay for this because this disease process, aortic valve disease, is more common in the Medicare age population in the United States, that is over 65. So there were a number of obvious potential conflicts. On the one hand, this would be a new procedure for the cardiologist, so there would be an opportunity to effectively increase one's practice and generate more revenue. And the cardiologists were frequently the ones who were identifying the disease to start with, and there's the whole issue of self-referral for monetary gain. At least that argument could be made. Conversely, for the surgeons who traditionally had owned this area, that is, it required an operation to replace a heart valve, this was a big threat because if all the patients were having procedures done by somebody else, that would mean there would be a loss of revenue. Both situations representing significant conflicts of interest between what was potentially good for the patient, although that was still in doubt, and versus what was good for the individual surgeon or cardiologist. The regulatory issues were a little bit muddy in the sense that multiple US entities, regulatory entities, are involved. So the FDA assesses devices for safety and efficacy, whereas Medicare has to make payment decisions, particularly for this patient population in this age group. And then the issue ultimately was this device was not inexpensive. In fact, was just for the device, forget the hospitalization and the professional fees and everything else. The device alone was at least $30,000 in costs. So there clearly were an abundance of potential conflicts of interest, as I've already outlined. There was the potential for adverse effects on patients. And as profession, the members of that profession have duties to patients, as you've already heard Dr. White talk about. There was a significant question about patient selection and how much the patients should be allowed to choose what form of treatment they got. There were clearly the obvious potential for turf wars between a medical specialty and a surgical specialty. And from a professional society perspective, there was a significant potential for legal liability in the sense that if this was not an entirely free trade, if you will, sort of process, then there was the potential for antitrust issues to be raised, as well as the obvious and ongoing issue about medical malpractice, particularly when you're doing something new. So given that I was in the leadership of the thoracic surgical group, so-called STS, when these issues were coming up, we were faced with several choices. We could do nothing and leave this decision up to the government agencies who, without being too pejorative, frequently don't have a lot of experience with clinical medical issues. We could leave it up to the payers, and that is both Medicare as well as private payers. There was obvious potential for turf protection by writing guidelines that would favor one or the other approach. Or the third option was whether or not these two potentially competitive societies, one representing the cardiologists, the ACC, and one representing cardiothoracic surgery, the STS, could actually collaborate and try to make sure that this technology was introduced in a rational fashion. But the professional societies have their own internal conflicts and ethical obligations, which included not only duties to their members, but also duties to patients and duties to society. And of course, most ethical controversies arise when the pursuit of one or the other of a duty actually puts an organization in internal conflict with itself. So what happened and what we did was we actually recognized, based on that European experience, the potential for significant adverse patient outcomes. And following my time in the leadership of the STS, Dr. Michael Mack became the president a year or two later. And he has an interesting background as both a cardiac surgeon, but also as a trained internal medicine physician prior to his surgical career. And his counterpart at the American College of Cardiology is Dr. David Holmes, who is an interventional cardiologist. So clearly, the leadership of these two professional groups were on opposite sides, if you will, of the procedure. And importantly, one of our surgeon members had actually taken a position for a year at Medicare, where he was actually had a major decision-making role in how the payment decisions in particular would be made by the agency. And his background you can see there, but he and I both had been through the Kennedy School course on government relations, executive course at the same time, sat next to each other. And so we had a close working relationship. So what emerged through this collaboration across potentially conflicting or competing societies was the following. There was an agreement to begin with a randomized trial, which would be the only way that any patients would get access to the new device here in the United States. And this was actually a comparison of surgical valve replacement versus the transcatheter valve replacement, appropriately named the PARTNER trial, which included informed consent that was uniform, required local IRB approval, but also the collaboration between the two professional societies established several requirements that the regulatory agencies, particularly the FDA as well as Medicare, actually bought into. And one of them was that there would be heart teams established, which would give equal footing to both the cardiologist and the surgeon in evaluating patients and also in actually carrying out these procedures. The number of sites where these procedures could be done were limited. And there were some criteria agreed on in order to qualify a given center for being able to participate in this trial. And an existing database that has been maintained by the Society of Thoracic Surgeons for quality improvement purposes was used to generate the risk model that would allow us to classify patients in particular for the initial phase, which was the high risk phase, so-called PARTNER 1, where patients who were thought to be at high surgical risk would then qualify for this trial. And then based on those initial results in that higher risk group, then subsequent trials involved gradually loosening the patient eligibility criteria. And as part of trying to generate new knowledge, a collaborative registry was established that followed all patients, was committed to publishing the results as they emerged from the trials. And remarkably enough, this registry actually was supported by the device manufacturers. So this example, which I think is probably somewhat unique, at least in American medicine, did achieve several of the professional societies' responsibilities. It certainly helped to maintain and advance knowledge, to introduce and evaluate innovation. It represented clear-cut self-regulation such that not every cardiologist or surgeon in the country could qualify as a participant. There were standards that were set. Ultimately, the collective belief was that we actually were serving the patient's interests because of the lack of certainty about many aspects of this device. We certainly were interested in performance above personal reward because not every one could go out and do these procedures and enhance their remuneration. And in a sense, this provided the basis for fairly distributing our finite medical resources, because the door was not thrown open wide with the rapid dissemination of this technology as had occurred in Europe. with potentially at least some compromise of the patient's best interests. So I would argue that we have demonstrated through this case that new technology can be rationally and ethically introduced at a nationwide level, accomplishing the goals of advancing knowledge and minimizing patient risk. And as evidence for that, the results from the transcatheter valve now are equivalent to those of the surgical valve, at least in the United States. There was an ability to demonstrate cost effectiveness, and I would argue this provides a template potentially for future innovations to be introduced. Professional society collaboration and leadership were essential. And I think it's actually, in retrospect, it was a remarkable public-private partnership between the potentially competing professional medical societies, federal government agencies, and even the device manufacturers. Now, there are a number of questions that we could always put on our rose-colored glasses and say, of course, this is exactly the way we should do things going forward. But I think I would pose the questions: was this an ethically appropriate role for the professional societies to take? Was the way that this was rolled out in the United States, particularly beginning with high-risk patients and a randomized controlled trial, actually equitable? Lower risk patients were initially denied access to the new technology. And conversely, one might argue that the high-risk patients were in some ways unfairly exploited. And finally, I leave you with this question about whether or not the audience feels that this represents a reproducible template that should be the basis for the introduction of other new technologies, particularly in this country. Thank you.
I'm Martin McNeely, John's partner on this short trip. I have no financial conflicts to disclose, but I must disclose that I've operated on uncountable numbers of patients using innovative technologies and procedures, often with fully informed consent, though many patients don't want to know the amount of detail that was disclosed in most of the talks that you've heard earlier. Next slide. Over 60 years ago, I chose the University of Minnesota for surgical training because of its reputation for innovation in surgical treatment. 68 years ago, Walt Lillehei and Richard Varco performed an innovative open heart operation to close a ventricular septal defect in a 1-year-old boy, Gregory Glidden. Gregory's father, Lyman, was connected to perfuse Gregory's body with oxygenated blood while his heart was repaired. You can see the two operating tables side by side. The heart-lung machine was not yet sufficiently developed. In the past 7 decades, we have advanced to the point where a minimal incision over an artery and a catheter enclosed valve can be placed in the beating heart without a chest incision or heart-lung bypass, as John Meyer has described. I've taken us back to Gregory's operation to remind us of the courage and persistence of the heroes of surgical innovation, particularly the patients and their parents, and the pioneering surgical teams Also, their overseers, all are part of a moral community. The issue of oversight of innovation is evolving, as outlined by Dr. White. Who should review and approve the interventions that depart from conventional standards of practice? For Dr. Lillehei in the 1950s, the chief of surgery, Dr. Owen Wangenstein, gave his permission with a note on Dr. Lillehei's door that said, "By all means, go ahead. Good luck." It's become more complicated since then. Approval of a surgical innovation committee, such as the one based on the Toronto model, provides the oversight in many departments. As Dr. White mentioned, the Surgical Executive Committee at our hospital, the Beth Israel Deaconess, serves this function. The Toronto Surgical Innovation Committee has been active for many years. It is described in the reference at the foot of this slide and will be available in the course materials. Many centers have asked their institutional ethics review boards to serve as surgical oversight. As surgical treatment becomes more complex, specialized committees working in concert with the IRB are evolving. In the United States, the Federal Food and Drug Administration and recently the National Academy of Medicine are providing oversight. Two closing thoughts about innovation. We're currently celebrating the development of an mRNA vaccine against a lethal pandemic disease, a seemingly near miraculous innovation. While we celebrate this accomplishment, we need to improve it beyond disposable sterile needles distributed throughout the world and sterile syringes and an electrically powered cold chain. It is a communitarian, we celebrate this accomplishment, but we realize that we must improve it to the level of applying a stable oral vaccine, which would overcome the geographic and socioeconomic hurdles still before us. The COVID vaccine, the TAVR that Dr. Meyer described, and open heart surgery in general are examples of collaboration of the government, industry, and clinical care. It is a communitarian, not an individualistic approach to innovation for the common good that provides a framework for the heroes of innovation to succeed. In this menacing time in our history, it has been inspiring for us preparing this course, and for you participants. It is hopeful for all of us to gather together in the Surgical Innovation Conference and celebrate these accomplishments. Thank you for your attention.
Thank you so much for all these wonderful presentations. As I've been monitoring the Q&A and thinking through what you've presented, you've given us an overview of the ethical constructs and frameworks that we should consider as we think about surgical innovation. And you've identified the stakeholders, patients, ourselves as surgeons, and industry who may be pushing forward for these innovative techniques. And within those stakeholders and probably others we can all identify, there will be certain conflicts. So you can imagine that our questions are all centering around these conflicts of interest that arise and how each of you might resolve those conflicts. And the questions are nuanced and try to come at various ways in which these conflicts do arise. So let's lead off with a question for Dr. Williamson. As you're talking about the new technology that you'll be incorporating into your work, two questions come up. How do you decide, and you addressed this briefly, you said you try to pick things that have good outcomes, but then how do you decide if something is, and I'll quote the question, a new innovation, truly with promise, and not a fad? And then building upon that, as you're bringing that forward, how do you decide when you're competent enough to undertake your first non-mentored procedure? You talked about the consent process, but how do you personally figure that out? And those are the different conflicts that can arise in this area.
Yeah, thanks for those questions. They're really tough ones that I think, especially as a new surgeon, I think really have been relevant. I think when I was in training, I didn't really have to make those decisions. I got to do the cool stuff, but I didn't have to make those decisions. And so that's something that's very new. I think in terms of the question of whether or not it's a fad, I think this is really a critical question. So, because there are a lot of fads. There's like, a new device for everything. Why don't you try this screw? Of course, when you're in an industry that's making this much money, a lot of people are going to want to develop something there. I look for things that actually there's a need. So the example that I use of the lateral surgery, we spend 45 minutes in the operating room flipping the patient from one position to another position. So that's something that slows down the operating room. It makes the patient have more anesthesia time. It's, positioning, there are positioning injuries. So when I see that there's a need and then there's an actual solution to a need, I think that that's where I feel like it's not a fad and it's more of an innovation. That doesn't mean it's always going to work or be better. And I think you do have to be willing to accept that you picked something that may have been a fad, even though you thought it was an innovation, and get rid of it. Don't stick with that technology. I remember doing some cases in training where we had, multiple x-ray machines coming in, all to use this like one piece of new technology. And it turned out that it actually wasn't helpful. And so I think if you're not conflicted, it makes it a lot easier to just move forward. That didn't really work. And then I think my other way to tell the difference is I ask a ton of questions of the reps, and they probably get a little bit annoyed by me. But I think if you're an annoying surgeon to a rep, it's probably a good thing, because you're asking so many questions to really interrogate whether or not it's helpful. Similarly, with being competent, I actually like to know how to use it myself. I like to know how to load a pedicle screw, how to, when I started using the O-arm, they were just like, oh, it's just a CT scanner. It works like all the other CT scanners. And I was like, no. If I'm there at 3 o'clock in the morning, so I have like physically drove the machine myself, figured out like, okay, if this gets stuck, how are we going to get the patient out? And so I think that at the end of the day, you're responsible for everything that happens in the OR. And so you have to feel comfortable that you can take accountability and have the skills to deal with that technology. It doesn't mean that you can't have help to make things more efficient, but you certainly are the last line of defense. And so I use that sort of as my marker as to whether or not I would feel comfortable doing a procedure.
Thank you so much. So building upon that, we've had a series of 4 questions that sort of build on the conflicts as they arise, both in the OR with industry reps present in the room, and then further forward into the fact that we're essentially working with, or maybe even for companies, these industry companies that are deriving significant financial benefit. And sometimes we're as consultants, but sometimes just purely in terms of the surgeries that we perform. And then another layer on top of that, raised by one other commenter, was how do you keep balance in corporate hospitals and the sustainability of hospitals, the pressure to use certain technology from the hospital itself. So I would love to hear anybody. I'm summarizing questions that were put into the chat just in the interest of time, but thinking about those different layers of interpersonal relationships or relationships with industry or relationships with corporate hospitals, and how do we navigate all those conflicts as they arise? And that's for anybody who would like to join
in. I'll give a quick general answer. John illustrated a collaborative approach that was very attractive to me. And I'll take the somewhat controversial position that we need more industry working with us as surgery is getting more complex, care is getting more complex, and we shouldn't be worrying about industry as some kind of alien presence that's dangerous for patients. The more we work with them and teach them how to deal with the fiduciary issues, the better off everybody will be.
And
I think
just-
I'd,
No, go ahead,
sorry,
Dr.
I totally agree. And those relationships can be really complex. And that's why I brought up like the emails in the beginning, because it is pressure, right? To have that relationship with industry. And I think, someone asked about that, how do you balance that being in the OR? And I think that there is a real role, and I hope that I, kind of said that in my talk, to have people there. And so I do feel like in the ideal world, it's a pretty professional relationship. I think often reps will try to make it a little bit more of a personal relationship so that you do feel a little bit more guilt when you are or are not using something that they want you to use. And I feel like in my short time as an attending, I've learned to not let those relationships be anything more than professional, so that, you don't feel guilty when you're thinking like, oh my goodness, I know they're have a new kid on the way, maybe I should use their company, or I don't want them to go out of business. Maybe I should, and so that you can really evaluate things. But I think they should absolutely be there.
Dr. Meyer.
Yeah, I would just add that although it may not be quite as apparent, but clearly there are even industry relationships at the professional society level. There are initiatives at the sort of professional society wide level that are supported by industry. There has been a role for professional societies to conduct educational sessions that primarily are, directed at maybe learning how to use new techniques and new technologies, such as the ones that we described. I can tell you that the device makers for that transcatheter aortic valve were not very happy with the professional societies when it was to be not a free open market rollout, but rather it would be done in a controlled fashion. And yet ultimately they came around and actually, as I indicated, helped support the registry because they actually needed the data as well to demonstrate safety and efficacy for further FDA level approvals. So it became a nice confluence of interests and a great partnership, which, beginning at the, when it was first, these discussions were first being held, it was not so apparent that the interests would actually all be aligned. And ultimately, at the end of the day, I think what sort of carried the day was, we're all obligated to do what's best for the patients. And that really became the sort of unifying theme for guiding how it was that we would go forward.
Thank you, Dr. Meyer. I think you've answered a pretty direct question in the chat, which was, essentially, is industry ever truly patient first aligned, in the sense that they have such a strong financial incentive to proceed forward with continually moving more and more technology forward and more expensive options. But as you noted in your case presentation and in your discussion just now, at the end of the day, with the type of collaboration that you've described, you were able to ensure at least that industry that may already have had good intentions for the patient population was truly patient aligned and ethically focused on the patient first. Is that correct?
I would say that's a good summary. Yes, thank you.
And so someone had proposed that perhaps, so thinking again about this relationship with industry, these are multi-billion-dollar companies. Is there a role, though, in these relationships that we have with industry to not engage with them in any financial way whatsoever? So there's been some people who've proposed, one person proposed in the chat, that we just certainly can't have any financial relationship with industry whatsoever. And at first blush, I'm thinking of consultation fees, but of course we're paid to do the surgeries. We have incentives to do these surgeries that are financial as well. You could get quite into the weeds trying to define where that relationship could even end. Does anybody have a comment about that? Perhaps Dr. McNeely, because I know that you're very much in favor of having continued relationships with industry, and I do see the benefit from that.
Well, I was inspired from those early closure of ventricular septal defects, which when patched, occasionally the conduction system was injured, requiring the invention of the pacemaker. And so the whole pacemaker industry grew out of collaboration between the Medtronic company and the surgeons at the University of Minnesota. That kind of collaboration was inspiring to me to watch, and it can go on, as I'm sure Teresa experiences with the spine companies. If it's a thoroughly patient-oriented, patient-motivated collaboration, then it's a winner for all of us.
Any other comments on that point?
So I think, Louise, it's important to realize that the companies are there to make a profit, to make money for their shareholders. If they didn't do that, they would go out of business. So their business is to generate, in some cases, new and innovative surgical products. And if they fail at that, they'll go out of business and there won't be any new innovative surgical products. So I think that they may have a bias to the success of their various products, but in no way are they interested in just pushing failing devices on people, because in the long run, it's going to come back to bite them. So I don't think that they're sort of the evil empire. And I think that many of these innovative technologies would not exist were it not for industry, which supports them, which funds them, that pays the bills for these long regulatory processes. And obviously they need to get something back in the end. They're not charities. But I think along a similar line, one of the questions here had to do with corporate hospitals. And I think it's important to realize that corporate hospitals are there that have to make money, but not-for-profit hospitals are definitely not there to make a loss. Because if they make a loss year after year, they go out of business too. So everybody has to do things that to some extent are in the patient's interest and some extent are in their own best interest in terms simply of existence. That's where some of the controversies, but from the individual physician standpoint, it's probably important to keep your eye on the ball and put your effort toward your patients. And if you think that something innovative is going to help them, then it's fine to do.
I think that's a great summary. Dr. Meyer?
Yeah, I would just point out the other role that industry has served, certainly in the cardiovascular realm, and I think in a lot of other realms, and that is, one of us might get a good idea or think of a new way to do things, but to actually carry that forward through the regulatory processes that Dr. White was describing and through actually making sure that the device is reliably manufactured and comes out sterile and comes, for insertion and all of those sorts of things that, us physician surgeon types don't have any experience or expertise with. It does require a real collaborative relationship and a real partnership, if you will, almost in order to bring some of these good ideas to clinical application widely.
Yeah, that's an excellent point. The complexities are not things that we can address easily outside of this current system and relationship with industry that we have, both from a regulatory standpoint and passing those hurdles, but just in designing things that are so complex as well. We've come up against the time. I'm a little bit over, and I apologize for that. I guess there was one question we didn't address that it naturally flows from our conversation, so I'll send you off with it to ponder. which was how can we find a balance between continuously advancing surgical technologies, which we've all said we really want to do, while also improving the availability of more basic surgical resources to areas in need. And so, building upon our commitment to understanding disparities in access, we've talked about all these high cost and pushing the boundaries there, but also we always need to keep our eye on the prize, or eye on the ball, as Dr. White was saying, and be sure that we are putting our patients first. And that means ensuring access to surgery in the first instance, even the less technologically advanced. I would just want to thank all of our presenters tonight, and I'll turn it over to Dr. Hanto. I'm so grateful to have been part of this conversation with each of you.
Thank you very much, Dr. King. I would like to reiterate and thank our presenters tonight, Drs. White, Williamson, Meyer, and McNeely, for their outstanding and provocative discussion of the ethical considerations in surgical innovation. I would also like to thank all of you who listened tonight and asked questions of our expert panel. I would also like to thank Dr. King for moderating an excellent discussion with our panelists and covering the questions from the Q&A. I would also like to take an opportunity to thank Christine Mitchell, who's the Executive Director of the Center for Bioethics, for her involvement and support of this Harvard Surgical Ethics Conference, and also Dr. Robert Trug, who is the Director of the Center for Bioethics, for his support. Finally, I'd like to thank Ms. Troutman, Ms. Stefanides, and Mr. Amato for their technical, graphic, and organizational support of this conference. We couldn't have done it without their help. On behalf of the Surgical Ethics Working Group, we thank you for attending and hope you will join us next week on Monday, June 27th, for our final installment, Disparities in Surgery and
Today's video is going to be all about summer essentials. Specifically, we're going to be talking about how to style your summer essentials and take them from basic and boring to banging and bougie. New here, my name is Chi-Chi, and on this channel we cover fashion, beauty, and lifestyle. So if you love hauls, lookbooks, vlogs, sis, you found your tribe. All you have to do now is subscribe. Sometimes just adding an additional piece can make all the difference. If you've been looking for ideas for styling pieces you already own, this video is for you. Keep on watching. Make sure to stick around all the way to the end so you don't miss any gems. So we're going to be styling 4 basics. They are as follows: a white tank, a summer must-have; white jeans, another summer essential; shorts, and a summer dress. So without further ado, let's get into it. So we're going to start off with this white tank. My favorite one comes from Target, and I always recommend that you buy multiples of your summer essentials. I have about 3 or 4 of these white tanks. I not only have this tank in white, I also have in a plethora of colors, just because I feel like the high neck really kind of works for my shape. So I decided to pair the white tanks with some shorts. This is a very quintessentially summer look. This is the kind of look I would wear to run errands on the weekend. To kind of take this look up a notch, I decided I would layer on some necklaces just to add a little bit of, je ne sais quoi, something to the look, right? And then finish things off with a light layer in the form of this oversized white shirt. Oversized white shirts are a must-have during the spring and summertime. If you don't have one, sis, run, don't walk. I will link some of my favorites down in the description box. I actually have a couple. I have like 2 more in my current cart right now because I wore my oversized white shirts to death. I would wear them as a layer on top of my outfits. I would wear them as cover-ups. Some of them I actually wear as dresses. So you can do a lot with this. So if you don't have one, get one now. Now for the next look with this white tank, I decided to pair the look with a bias cut maxi skirt. I actually have this maxi skirt in 2 other colors because I really feel like this style and cut is super flattering. Now to finish off the look, I'm gonna throw on a pair of slides. You can keep this look just like it is right now. It looks pretty good to me. However, I feel like, the look it needs something. So here's what I'm gonna do. I'm gonna swap out those slides for these gold flat form. So what I really like about the flat forms is that the gold in the flat forms tie into the gold accents in the bags. And something about the metallic really helps to elevate this look. I would totally wear this look to brunch. I feel like the other look I would probably just wear to run to like Target or something. Because of the additional height that I got from the platform and the addition of the gold, I really feel like it does a good job elevating the look. So let me know your thoughts, right? Do you prefer the original look or do you prefer the updated look? So next essential we're going to be styling is going to be the summer dress. This is another must-have and essential for the season. I love wearing dresses in the summer because they're flirty, they're girly, they're perfect for like brunches and bridal showers and date night, etc., right? And I always look out for dresses that are easy for me to dress up from day to night. And one of the things that I love to do with my flirty and frilly summer dresses is to juxtapose and pair them with things that are a little bit more masculine, a little bit more grungy, kind of tough. During the winter, I would totally pair a summer dress with combat boots, but it's too hot for that, so we're gonna opt for some dad sandals. They don't have to be dance sandals. You could go for something just a little bit more grungy and kind of tough. I have a pair of Doc Marten sandals that I picked up last year. That's another example of a tough looking shoe that you can use to kind of add a little bit of interest to your more frilly dresses. And to finish off the look, let's not forget a bag, and voila, you have a look. Now again, this look is perfectly fine just as it is, but I feel like we can tweak it slightly to make it even better. What do you think? I agree. So I went ahead and threw on this straw hat. I always get questions about like how to, accessorize and dress up an outfit during the summer because it's hot. It may just be, the weather may just be too hot for you to do any kind of layering, for you to add a third piece. Well, never forget a hat, sis. A hat will do that for you. If you have an arsenal of like straw fedoras, baseball caps, not only do they add some interest to your outfit, but they also help to protect your scalp from the sun. So I've had this hat for years. They bring it back every single year. It's kind of like a cult favorite. So I'm going to link it down below. And what I like about this hat is that it comes in sizes. So if you have a bigger head and you struggle with finding hats in your head size, I promise you, you will find one in your head size. Well, I hope so. I'm wearing this hat here in a size extra large and it goes up to a size 2XL. And I will link it for you in the description box down below. So let me know, which look do you prefer? The before look or the after look? Did the hat make the look better? I'd love to know your thoughts in the comments down below. Now, remember when I said I love to go for summer dresses I can pair that I can dress up or dress down and take from day to night? Here is the perfect examples. We're gonna ditch our sandals and then we're gonna opt for a pair of heels. I'm personally partial to mules because they don't have any buckles, they don't have any ties, you just slide your feet in and go. And then I opted for a pouch bag, and I really love these pouch bags because they can fit everything, okay? Everything, right? From your slides to your makeup, your phone, your everything, a whole change of clothes if you need, you can fit into these pouch bags. That's why I always opt for them because I feel like I can fit all my crap in there. So this outfit is pretty good on its own. I think so anyway. But I'm thinking like, I think we can make this look better. I think we can make this look better. And so how are we gonna make it better? I think we could swap out these mules for something a little bit more fun, right? What do you guys think? Yep, I agree too. All right, so I decided to swap out my mules for a pop of color. Don't forget, you can have fun with your footwear, with your bag. Once you have a nice collection of like neutral color accessories, don't be afraid to invest in some color because just the addition of that pop of color can really take your outfit from boring, okay, to banging. All right, so what y'all thinking? Do you prefer the look before or do you prefer the look after? Let me know in the comment down below. So now on to shorts. Okay, shorts are already a quintessential staple for the summer season. They are a must-have. So how many ways can you style a pair of shorts? I should make a video on that, like maybe 10 ways that I style shorts. Anyways, I digress. So I have these brown paperback shorts, which I believe I featured in my how to find the perfect pair of shorts video. If you haven't seen that video and you're struggling with finding shorts that fit your curves, sis, that video is a must watch. Okay, I will be sure to link it for you in the description box below. Fingers crossed that I remember So with these shorts, I decided to go for this tan colored top. The shorts are brown, the shirt is brown, kind of like a monochrome look. You can't go wrong with that. And continuing on with like my tan and brown family, I finished off the look with some brown nude sides. This is a super easy outfit that you can wear to brunch, you can wear to run errands. I love the fact that the shorts are tailored, so it really helps to elevate the look. You totally catch me in this outfit. But on the days where I feel like adding a little sauce, to my look, I feel like this outfit could be better. So I'm thinking we're gonna ditch the brown or cream colored shirt because it's cute and I'm digging the ombre look, but I think we can have a little bit of fun by adding a print. That's where this shirt comes in. So as soon as I saw this shirt, it was an instant add to cart. It was giving me 70s vibes. I loved how billowy the sleeves were. It's a brown color, but even though the colors are kind of muted, I loved how billowy the sleeves were. I loved the print on it, the pops of orange. And I really think it helps to bring out the orange in the brown of these shorts. Now, I typically don't go for shirts like this that are super billowy around the chest because, when you have a fuller chest, these type of tops tend to emphasize that. But how I was able to combat with this top was that I opened up some of the buttons to help create that deep V and elongate the neck. Okay, that was one of the tips I shared in my big bust styling video. So if you haven't seen that video, sis, make sure to check it out, especially if you have a bigger bust and a fuller bust. All right, I'm really digging this shirt and how it just added a little bit of something to the look. I personally think that it really took this look from the original look from basic to, hanging. I think so. But let me know your thoughts in the comments down below. Do you prefer the original look or do you prefer updated look? If you're enjoying the video so far, sis, hit that like button. Also, this is a great time to share the video. Not only does it pay it forward, but you may know someone who's been searching for this video. So the next basic we're styling are white jeans. So we're gonna start off styling these white jeans with my tan t-shirt. I think we're gonna go for these clear sandals, my cream colored crossbody bag to kind of keep things all in the same color family. And this is like a super easy look that I would wear again to run errands, to have a casual meal, etc., etc. Although there's absolutely nothing wrong with this outfit, I would totally wear this look. I feel like we can make it better. I think we can make it better. So instead of our tan t-shirt, let's have a little fun. Let's add a little texture with this H&M mesh sweater. What I really like about this sweater is that it has holes all over it. So you can pretty much wear it now up until I would say mid to late June. I felt like the other look was very tonal, very bland, and the addition of this texture to the look, does something. What do you think? Let me know. So let me know in the comments below which look you like better, the original look or the updated look. So we're gonna ditch the sweater. Okay, so if you're wondering about how you can wear white jeans, there we go. The lightweight chiffon shirt. This is actually the top from a two-piece that I picked up last year from Pretty Little Thing. It's super lightweight, like it's almost non-existent. So if you're wondering about how you can layer in the summertime, chiffon tops are your best friend, especially if you're someone who is new to wearing crop top, isn't quite comfortable showing maybe all of your belly or maybe even your arms. This is a look that always works and it just makes your outfit look like you thought about it, but really all you did was added a shirt. That's it. And again, what I like about this shirt is that when you get to the beach, you can totally ditch the rest of your outfit and that shirt would act as a really cute cover up that you can pair with your bathing suit. So let me know your thoughts with this look. Do you like the before look or do you like the after look? Let me know in the comments down below. So this is just a fraction of the summer essentials and basics that you will need. I actually have a summer wardrobe checklist. There will be a link in the description down below. All you have to do is sign up for our newsletter and you will get an email from us with a link that you can download the checklist, right? I know I've made at least one video where I talk just about summer essentials. So if you're interested in more summer essential talk, I will also link that video for you in the description down below. And if you're curious about this gorgeous pink overshirt that I have on, or this tank top, I always link all of my outfits in the description box of this video. It's going to be under the shop my outfits link, and that's going to take you over to my LTK. If you're wondering what LTK is, it's basically an app where I link all of the items that I feature, all the stuff that I have my eye on, that I'm looking to buy. I not only link my fashion stuff, I also link my beauty stuff. So my favorite foundations, lip gloss, I link everything on that app. While you're there, just go ahead and just download the app and follow your girl, okay? I promise you, you won't regret it. If you enjoyed this video just like this, all you have to do is subscribe now. Check out this video and this video. Don't forget.
This is Rob Johnson, President of the Institute for New Economic Thinking. I'm here with Jeffrey Sachs. He, how would I say, I always smile, and every time we talk, I'm paying homage to the Rommel family. George and Affie Rommel, where we both grew up in Detroit, and our parents were good friends with the respective Rommels, and perhaps that inspired my curiosity, even as an undergraduate at MIT, to learn more about Jeffrey Sachs, and it's been like a North Star beacon for me in thinking about what's important through my entire career. So, Jeff, thanks for being here. I'll describe just briefly. You've done a tremendous amount of work. You're at Columbia University, the highest ranking professor. You ran the Earth Institute for many years. Currently the president of U.S. Sustainable Development Solutions Network. And I would say, just as a signature, I see you always have, there's a gift that I perceive and that I admire and I try to turn people onto about your career. You always seem to choose important questions. People can do all kinds of dances with technique, but how they say they might be fiddling while Rome burns. And you seem to zoom in over and over on things that matter, not just to your country or not just to prestige, but to humankind. And I greatly admire that. I just want to refer, you've written many, many books. We've talked about the age of globalization in one of our previous episodes together. But sustainable development, the two I underscored today, because the questions related to the Ukraine that I've seen you writing about in Project Syndicate and other places recently, to move the world, JFK's quest for peace in 2013, and a new foreign policy beyond American exceptionalism. What I see there, first book 2013, second book 2018, is a prescience. You're seeing ahead of the challenges that we're going to have to address. So I'm very excited today that you're with me and we can talk about what you see, what scares you, and what's the way out.
Well, thanks so much. Great. It's great to be with you, and thank you for focusing on those two books. The book about JFK, which I wrote in 2013, was to commemorate an incredible speech and initiative of President Kennedy in 1963, which was just months after the Cuban Missile Crisis. Now, here we are, Rob, the 60th anniversary of the Cuban Missile Crisis, with another kind of showdown between the United States and Russia. And so I'm going back to that speech, to the Cuban Missile Crisis, to the lessons that I drew in that book just about every day in my thinking about what events are telling us right now. The 2019 book, A New Foreign Policy Beyond American Exceptionalism, is also directly core to my thinking right now. I do think the United States doesn't get or accept its realistic, constructive place in the world right now, and that this is at least a part of our problem in a world that is increasingly destabilized. I think that both books focus on one fundamental idea, which is that peace is better than war, and peace comes through a constructive engagement with the other side. President Kennedy said in his remarkable speech given at an American University commencement on June 10, 1963, that peace isn't some magic solution. It's not an event. Peace is a process, a way of solving problems. It is a constructive engagement with the other side. It is what I've learned in 21 years of advising the UN leadership. It is diplomacy at its finest. It's not guessing what the other side will do. It's not playing a game theory where you take as given the other party's move, which can have disastrous consequences, but rather you engage. And I think that this has been my central theme, partly from my own life experience of working in cultures all over the world, very different communities, different religions, races, ethnicities, nationalities, geographies. It taught me something about the common fate of humanity, I think. And it also taught me about the wonders of dialogue, communication, and diplomacy. Well, here we are with war, with incredible tensions with China, with the inability to solve major global problems like the increasing derangement of the Earth's climate system. And I believe that in all of these, what we're seeing is a failure of statecraft, a failure of concepts of cooperation, really an application of crude ideas that are like the game theoretic ideas that assume the worst of the other side, for example, and assume you know what's in Putin's mind, assume you know what is in President Xi's mind. And when we behave that way, we get very bad outcomes. So this, I thank you for focusing on those works. And for me, they do reflect my underlying feeling that there's a different way for us to approach global problems, different from what we're doing right now. And it would be much, much safer, more prudent, and more constructive to follow a different approach.
I find it fascinating, just putting like what I'll call pattern recognition. You're talking about what John Kennedy did. I remember the old, what I'll call the Bismarck playbook. I took a bunch of courses in arms control and disarmament, and they said that one of the big dangers is when you're failing at home, there's discord. The Bismarck playbook is a metaphor. Find an external enemy so everybody can agree and focus on that. But sitting behind the Bismarck playbook, in the first appendix to that playbook, is the need to cooperate on climate change. So we're not in a place where, forget mutual assured destruction for a moment. We got to cooperate.
Well,
there's another way we can exterminate Earth if we don't collaborate. And then the last thing I'll throw into this mix is a wonderful book by the scholar Orville Schell and his colleague John Delury called Wealth and Power. And what Orville, who's a good friend of mine, said, he said, Rob, we've got a situation where the Chinese went through centuries of humiliation, Opium War, Japanese invasion, etc. America thinks it runs the world and wants everybody to fall in line behind it. To use the Big Brzezinski's metaphor, we have tectonic plates crashing between two philosophical systems at the head table of the G7, or excuse me, of the G20 that used to be the G7. We are in a situation where you can't even play game theory with different philosophical systems because you're projecting things onto your counterpart that may never have been in their imagination or in their training. So you've got this instability, what I'll call the Bismarck playbook. You've got the end game of climate, and then you have this tension that centers on U.S. China. But we could bring, why didn't Russia, after the de-escalation, the end of the Soviet Union, and I know you've worked a lot there, so I don't know the answer to this at all, but why didn't Russia get the equivalent of a aid program to integrate them into the EU, regain prosperity, dignity through that? And I'll ask you a question. Is the political economy of the military industrial complex a little bit of the evil that hides inside this dilemma of danger?
So there's a lot of intertwined issues there. And let me start with the very specific issue of climate change and the energy transformation that we know we need. We need to move to a zero carbon energy system. Excuse me. And that requires actually a lot of long-term thinking and a lot of international cooperation. So every day in the context of the Ukraine war, I'm asked by somebody, and it happened again this morning, what's the implication of the war for climate change? In other words, you see Russia cutting off or threatening to cut off natural gas to Europe, or Europe putting on sanctions on oil and gas imports from Russia. Will this accelerate the energy transition? And the answer is basically no, because it may change the calculus in the very short term. It's actually opening up more coal mines again, or pumping more gas and oil to make up for what has been lost from Russian supplies. Maybe by raising the price of oil and gas on world markets, it's making some new solar projects more economical and financeable. But all of that misses the main point, which is that the real changes we need are long-term strategic changes in the energy system. And that requires a stable, peaceful, cooperative environment. Even renewable energy, to be efficient and effective, needs to cross borders. It needs to be regional, even globally connected in some ways, maybe in the new hydrogen economy. We can't do this if we're in conflict. We won't do this if we're in conflict. So this is the first point, that almost everything of real value for development, and what we now call and should call sustainable development, meaning economic development that is also socially just and environmentally sustainable, requires a long perspective. If you have a short perspective because of huge uncertainties, because of war, because of conflict, then you can't accomplish anything real of the transformations that we need. You can improvise, you can maybe keep your footing in the short term, perhaps, but the truth of the matter is real development of any kind requires years, even decades of hard, continuous work, educating children, building infrastructure, cooperating across riversheds, building power transmission grids that are, again, transnational. And that is a long-term cooperative effort that depends on peace. And we're not getting there right now, partly because our mindsets really are wrong. And unfortunately, what I have inveighed against in the US context is the idea, which is very popular, it's in every speech of US leaders, that the world is safe when the United States leads the world. So primacy, or what the political scientists call hegemony, is really built into the American thinking. I think Henry Luce did an unfortunate thing to America when he, in 1941, christened this as the American century. It was a great turn of phrase, by the way, so inspiring and so ennobling. But it actually basically went to the heads of the permanent state that they took it literally. This is our century. You know, in the past, it was Britain's century. In the industrial age of the 19th century, or it was the Mongol century, or it was the Roman centuries. Now it's our century. Oh, what a dangerous way to think about things, because you get way overstretched. You act provocatively without even attempting to understand the other side. And that, unfortunately, is so much of what happened in Europe after the 1990 remarkable transformation. And as you know, I was there. I was physically present in the Kremlin in December 1991. You couldn't even believe, I mean, I could not believe, and especially you'd appreciate it, you know, a kid from Detroit sitting in the Kremlin in this huge office, and who walks in the far door? Boris Yeltsin. And he walks across the room, and he sat down right in front of me because I was leading the delegation. And he said, "Gentlemen," because it was all men, he said, "Gentlemen, in the next room is the leaders of the Soviet military, and I have just agreed with them to the dissolution of the Soviet Union." I heard literally those words.
Wow.
Yeah, wow is wow is exactly right. It was weird.
Huge turning.
No, so
Yeah.
I thought, and I had been working in the Soviet Union before that. I was told, I don't know if it's true, that I was the first person to brief the Gosplan leadership in its entirety on the top floor of Gosplan, just outside of Red Square, in 1990, to the Politburo leader who headed Gosplan on the transformation to a market economy. And they were taking notes, 50 Soviet leaders on the other side, all with notebooks open, taking copious notes about market economics. But the fact of the matter is, Gorbachev and Yeltsin wanted a common home. Gorbachev, who I regard as the greatest statesman of our age, and who's reviled in Russia for having lost the Soviet Union and for inflation and everything else, he's the greatest statesman of our age because he understood that what we needed was peace rather than a cold or hot wars. And he was ready to even let the system fall rather than shoot people to, quote, save the old system. But his idea, which I know, was a common home from Rotterdam to Vladivostok, that we have a common European home. I believed it. I went to work for his team in 1991, promoting what we called the Grand Bargain, working with Graham Allison, who was then head of the Kennedy School at Harvard, and Stanley Fischer and others. And we recommended a significant financial assistance program to the Soviet Union to support its economic and political reforms. What was the White House response? Complete niet, nothing, nichevo, not anything. We're not doing this. Okay, that was a disaster for, the failure of Western support definitely undermined Gorbachev. Yeltsin emerged after the attempted putsch against Gorbachev, which was in the summer of August 1991. And then I was contacted by Yeltsin's economic leader, Yegor Gaidar, and I came to Moscow. And Yeltsin said to me and said to others, "I want a normal country. I want a democratic country with the market economy, and I want normal relations with the world." I said, absolutely wonderful. This is exactly what we want. And, Gaidar, who was then the acting premier of Russia, which was about to become the sovereign country, was meeting with the G7 finance deputies in November 1991. And Russia was running out of foreign exchange reserves. This was a fulminant financial crisis. So I knew a lot about financial crises and their history and their resolution, and worked with Poland a couple of years before. And I suggested to Gaidar, well, look, tell the US and the other 6 deputy finance ministers, you need a standstill on the debt payments because you're running out of reserves. And Russia's about to become an independent country and we can't have a financial collapse. And he came out of the meeting just absolutely ashen-faced. He said they wouldn't even consider it. They said, you have to pay to the penny. We will not allow anything right now. We're not authorized to allow anything. We will not allow anything. You continue to pay. Russia ran out of reserves at the beginning of 1992 as Yeltsin came to power. In other words, a fulminant financial crisis. I couldn't believe it. I spent 2 unbelievably frustrating years trying to get the US and the IMF to do something. And they wouldn't do anything. And Larry Eagleburger, who was acting Secretary of State, explained to me at one point, said, Mr. Sachs, it's not even about what you're advising. Even if I agreed with it, it's not going to happen. And he said, this is an election year. It's not going to happen. And the truth is, this didn't determine all the future, but God, did it show an attitude of obtuseness in the United States. And I didn't appreciate then that Cheney and Wolfowitz were working on their great neocon illusions that now we're the sole superpower. Now we get to do what we want. And they really were working on the next wars because they were going to take away every Soviet ally or Russian ally in the Middle East, knock out Libya, Syria, Iraq. This was a plan already from the early 1990s, according to Wesley Smith. And I didn't know it at the time. I just couldn't believe here we are, this historic moment, a chance to cooperate. No, we're not going to cooperate. We're going to be the sole superpower. And I just found that obtuseness year after year from the US. And by the end of the 1990s, I basically had it because I had seen the US now from all sides. I had seen it from the Latin American perspective. I had seen it from the Central European perspective. I'd seen it from the Russian perspective. I'd seen it from the Indonesian perspective in 1997. We just were not a cooperative country that aimed to work with other countries to solve problems. We were the unipolar great power of the world. We were arrogant, and we were not paying attention to what other countries said. And this manifested itself in a number of financial debacles of these countries that had big effects on the world. It also manifested in what brings us to the war in Ukraine today. Though this is a very unpopular view, it's right, and that is NATO enlargement. What John Mearsheimer has said is right. Kissinger said it, and so many other wise people. George Kennan said it in 1997. Don't do this NATO enlargement. It'll lead to a new Cold War. Now we have a hot war. The Secretary of Defense under Clinton was deciding whether to resign or not when he learned that Clinton indeed would go ahead with NATO enlargement, because Bill Perry, who was the Secretary of Defense, said, look, we're starting to improve relations with Russia. Do we really need to risk that right now by peremptory moves of NATO enlargement, especially since unequivocally both the Germans and the Americans had promised Gorbachev and then Yeltsin no enlargement in return for German reunification. Then we lied about it. Well, it's not in writing. We brought out all our lawyers, but good historians know that those commitments were made, and we just want to deny that. And given, the predominance of U.S. government in our media, you can tell any story you want. This is absolutely true. But the long and the short of it, Rob, is that NATO enlargement started. We weren't giving any financial help. We were plotting wars against Saddam Hussein, Muammar Gaddafi, Assad, all the allies of the former Soviet Union or of the Soviet Union and then of Russia. Russia has military naval base in Syria, so Assad would be our target, and so forth. No cooperation other than superficial. And in the 1990s, the NATO enlargement started. And then during George W. Bush, well, actually, Clinton did something that, in retrospect, we didn't even see the significance of, but it was hugely significant and misguided. And that was the war against Serbia in 1999 to force Serbia to give up Kosovo. So there was a rebellion of Kosovar Albanians, or Albanian Kosovars, I should say, in Serbia. And the U.S. took sides and said, let them break away. And when Serbia said, no, they're part of Serbia, which is the normal way that diplomacy works, the U.S. bombed Belgrade for several weeks. And we set up the precedent that if you want a breakaway state or you want to weaken the other side, you just go bomb them. And then when Russia says, well, when we do this, we're called the crime of humanity. But when NATO does it, that passes as defending freedom fighters. So isn't there no standard or a double standard? But just to carry on to the current day, in the early 2000s, after the Belgrade bombing, and then after 9/11, of course, Bush pushed the enlargement of NATO to, I think, 7 countries under his watch, an extraordinary increase of the number of countries. The Baltic states, to begin with, Romania, Bulgaria, Slovakia, Slovenia, if I remember correctly, all during Bush's watch. And then to the shock of the Europeans in NATO in 2008, he said Ukraine and Georgia will become members of NATO. And just take a look at a map, and I encourage everybody to take a look at the map of the Black Sea. What was NATO's idea? What was the U.S. strategic idea? The U.S. strategic idea was basically to own the Black Sea for NATO, because you'd have Turkey, Romania, Bulgaria, Ukraine, and where's Georgia? All the way over on the eastern side of the Black Sea suddenly is going to be a NATO country, whereas NATO was originally to defend against an invasion by a now defunct, non-existent country in Western Europe. So suddenly it is an expansionary force moving straight across the Black Sea. It reminds me a lot of the Crimean War of the 19th century. Who controls the Black Sea? And, well, one thing has led to another, and we have the war in Ukraine. And if in our media you say, the United States played a provocative war, you're immediately targeted. Oh, you're just purveying Putin's propaganda. Well, this is really nonsense. We need a serious discussion, some context, some history, and we should not have pushed NATO right up against Russia's edge and right around the encirclement of the Black Sea. But we did so, and now we're also paying consequences for this, but especially Ukraine is paying consequences for this.
Yeah, I remember some of my teachers at MIT in that arms control disarmament. This was years after I was a student, but I ran into Bill Kaufman and I said, this doesn't feel like game theory to me. It feels like the chain store paradox, which is you never should engage in each of these things, but you act like you got to do it to show you're tough to the next 3 episodes. But with consequences being so dangerous, first with regard to nuclear war and now with regard to climate, this is madness. And this is not leadership. Why are our leaders so afraid of our population at this juncture that they have to put on this ritual of toughness as opposed to doing what needs to be done?
Did you play the game of Risk the board game Risk? Okay, so the board game Risk really is a marvelous model of how Washington thinking is. You have the map of the world, and the aim of the game is to have your piece on every space of the world. And as you move forward, if you're successful and your armies are advancing into new territory, every new territory you have has borders with the enemy. And suddenly, every new border becomes the conflict zone. Every new border becomes vital for your national security. And so you have to have every space on the board, or suddenly you're at risk. Now, American strategists get this or behave this way. I think it's mind-boggling, because we shouldn't be playing a game of Risk where you're trying to conquer the world. But this is the American strategist approach. And a good example of it is the Solomon Islands. Tiny islands, 3,200 kilometers off the coast of Australia, that had the audacity to sign a security pact with China. And suddenly the United States and Australia are in a tizzy. How dare they? This is a threat to security. And you hear the voices in the U.S. Congress, completely unacceptable that there's a security pact because you give China 1 inch, they'll take the world. But when the United States says, NATO should enlarge to Georgia and Ukraine, and Russia says, no, that's a security concern, we laugh. We say, why is it a security concern? We're peace-loving. We're wonderful. And that's their choice. That's not our choice. We didn't say, well, that's the Solomon Islands choice. We dispatched the deputy of the National Security Council to Asia on an urgent mission to express the U.S. displeasure at the Solomon Islands' decision to enter this pact with China. So much, Rob, comes from the unwillingness to really have rules that apply to yourself as well as to others, or to think empathetically, what is the other side thinking? And it comes back, by the way, to the Cuban Missile Crisis, and I think we should talk about that because it's absolutely relevant. Yeah. When Khrushchev put the nuclear or the atomic weapons in Cuba, all of Kennedy's advisors, except Adlai Stevenson, said from the start, you must attack and take them out. We need a military operation. Many things can be said about that, but I think the bottom line is it would have started World War III because the CIA had every fact wrong. It thought that the missiles were not yet operational. It completely underestimated, roughly by a factor of 7, how many Soviet troops were actually in Cuba, how many would be killed in a military operation, and so forth. Kennedy did a remarkable thing. He kept asking one question: what is in Khrushchev's mind? What is he thinking? In other words, Kennedy behaved empathetically. It didn't mean he sympathized with Khrushchev. He was thinking, what is Khrushchev thinking? What is his point of view? Does he want war? What is he trying to prove? Kennedy had to learn, actually, the details that there were U.S. missiles in Turkey. What are they? Why are they there? Who put them there? And so on. But by the second week of the crisis, Kennedy realized Khrushchev didn't want war, but he did want to put America's face in it, because the U.S. had its Turkish missiles, or its missiles in Turkey pointed right on the border of the Soviet Union. The U.S. had invaded Cuba in the Bay of Pigs operation and so forth.
Right.
Kennedy realized, you know what? We got to get out of this by a compromise. You remove your missiles, we remove our missiles. We commit never to invade Cuba again. And that's how the crisis was resolved. It wasn't, we demand victory because Khrushchev has done the most dastardly deed, so we must defeat that man, which is the rhetoric that we have today. Must defeat Putin with his 1,600 active nuclear warheads. We must defeat Putin. This is mind-boggling that even on an anniversary like this, 60 years anniversary of the Cuban Missile Crisis, we're not taking care to learn the real lessons of how you diffuse a crisis. And you start with empathy. You say, if we care about the Solomon Islands, maybe Russia cares about Ukraine and Georgia in the same way. Maybe we shouldn't be quite so provocative. Maybe we shouldn't be talking about humiliating defeat and so forth. Or maybe we shouldn't be saying this is the worst crime in modern history when the United States is engaged in so many wars of choice. And maybe we should find a way for both sides to stand down.
Yeah. Well, I remember reading Daniel Ellsberg's book, The Doomsday Machine.
Absolutely.
About that there were many nuclear weapons inside of submarines off the coast of Cuba. And we started dropping depth charges on them. But for, I can't remember the gentleman's name, who overruled firing the missiles, they were terrified. They were underwater and the depth charges are going off trying to essentially kill them all and drown them all.
Absolutely right.
And this guy wouldn't allow the missiles to be shot, but it's that close. It's that close to extermination.
So reading list for everybody listening, Daniel Ellsberg, The Doomsday Machine, and Martin Sherwin, Gambling with Armageddon, which is the finest book ever written about the Cuban Missile Crisis. And Martin Sherwin tells this story that you're so importantly referring to, Rob. And I think it has many lessons. But what happened is, even after Kennedy and Khrushchev had agreed on the way out, a disabled Soviet submarine in the Caribbean that was out of radio contact, so it had no news, was disabled. It was overheating. It needed to surface just to breathe. Sailors were fainting, and it started to surface, and a jackass in the U.S. Air Force, instead of dropping depth charges, dropped live hand grenades on the submarine as a joke. And he's, we'll scare the hell out of them. So the commander of the vessel ordered a nuclear-tipped submarine to be put into the a nuclear-tipped torpedo to be put into the torpedo bay and called for its launch. And it happened by coincidence that a Soviet party official, a Communist Party official, was on that vessel named Antipov, and he had the ability to override the order of the skipper of the submarine. And he said, no, we're going to surface. We're not going to fire this. And under U.S. military doctrine, described by Ellsberg and by Sherwin, if the U.S. was attacked by a nuclear weapon, even a nuclear-tipped submarine, our military doctrine said we would unleash the full-scale response of a complete attack on the Soviet Union, China, and all of the other countries of the Soviet system. And the estimate was 700 million dead. But what they didn't know was about nuclear winter, because such an attack could have ended human life on the planet. We came within seconds of this. We're stupid if we think that things can't get out of hand. Today, I read about a U.S. general saying, well, we may need to break the Soviet blockade of the port of Odessa to let Ukrainian grain supplies. I'm sick of these generals telling us about things that are so unbelievably risky without a proper public debate and understanding, because we could end up in nuclear war. And this is mind-boggling that we are having generals opine on these kinds of military operations, which would be tantamount to direct U.S. war with Russia in this kind of way.
And you're talking about the extermination of life on Earth. I mean, these are not rumors. I've seen in Nature and Science magazine studies of what happens to the upper atmosphere if there's a nuclear exchange. And I encourage many people now. I've been doing a little bit of work with a group called the Quincy Institute, Andrew Bacevich.
Excellent. Yep.
Hartung in this group, and exploring some of the ramifications for how our military decisions are being made. And it's really quite haunting to try to understand this dynamic as having anything to do with representing the well-being of America or mankind. And
I learned in thinking about American history and politics, which I've been doing pretty much nonstop for 50 years now. It turns out the president's main job in the world is to keep a foot on the brake of the U.S. military machine. Because it's like those old cars that are poorly tuned, that though they're in neutral, they're always revving forward and they're always jumping. You take your foot off the brake, the car jumps forward. And good presidents, great presidents, have been the ones to have the foot on the brake, like Kennedy had the foot on the brake in October 1962. Johnson did not have the foot on the brake, and we escalated in Vietnam. We know that Bush, I don't even know if he was in the driver's seat, much less having a foot on the brake, but we went to so many wars. Obama was no good at this either. So this is a real question.
It's a systemic process.
It is like the game of Risk. You're always looking, we're, in Romania and Bulgaria, we're at risk unless we're also in Ukraine. So we better expand. Well, then there could be losses in the eastern Black Sea and the Caucasus. So we better expand to Georgia, et cetera, or the Solomon Islands, or what we're doing in East Asia, and just so much chit chat about war with Taiwan and U.S. war with China and Biden piping off and so forth. All of it is provocative. All of it requires actually our good luck that a president says, no, we're not going farther. Korean War, again, had MacArthur had his way, he would have invaded China. We would have used nuclear weapons at the time. Truman, his right decision, no, stop. He had to fire his top general. This is really the job of the American president, because the underlying revving machine doesn't have a natural stopping point.
Yeah, I remember I had the late Charles Johnson was a good friend of mine, and I was doing a lot of work in Japan at the time, but he was working on the books like Blowback. He wrote that trilogy about the dangers that foreshadowed the attack of 9/11. Saying
exactly.
if you're aggressive, you are going to have these consequences, putting the American people at risk. But let me shift, Jeff, as we're coming down the home stretch, to the relation of all of this to budget and the well-being of America. What concerns me is at the level of medical care, The OECD data shows that America per capita spends more than twice the average in the OECD to have some healthcare system that is ranked 38th in the world by the WHO. The second dimension is we have a baby boom creating a demographic bulge where elder care is going to be a priority. We are going through technological transformation that requires transforming the education system towards knowledge-intensive things. What was his name? Sir Ken Robinson, the most famous TED Talk of all time. How schools kill creativity. We got to change that. That involves investment. Now, we've got this military urge and climate transformation. I guess I worked on the Senate Budget Committee under Pete Domenici, and I'm thinking, how are we going to get all this stuff done if we keep playing these aggressive military games? And how are we going to harness the political economy? I always laughed. Domenici said to me one time, well, you're an economist. You know that thing called Say's Law? I said, yeah. He said, how supply creates its own demand? I said, yes, Senator. He says, well, you watch. Every year when we put up the budget, about the time that the military budgets come up, you're going to see all kinds of news about how dangerous the world is. They're using fear to create their own demand. And Adam Curtis, the BBC documentary, he created a series, a 3-part series that you can watch for free on thoughtmaybe.com. And it's called The Power of Nightmares. And so, Jeff, I'm loading you all up, but you can't sit there and be, how would I say, self-righteous budget hawk, tolerate a military industrial complex that's spending 22 times what any other country is, neglecting older people, neglecting young people, and letting our healthcare system cost twice what it should. And with all the discord of not reconciling those things, the Bismarck playbook comes back into center stage.
Well, one of the expressions of Joe Biden that I really like, though I haven't heard it from him recently for an obvious reason, he said, don't talk to me about your values, show me your budget, and I'll tell you your values. And what he means by that is where you put your money, that's what counts in the system. Yeah. And the United States has really messed up the budget. It spends far too little on many areas, like education, like well-being of children. It spends far too much on other areas, like the so-called modernization of our nuclear fleet, arsenal, when we should be negotiating long-term nuclear disarmament. And in general, our budget is a mess. As you say, also, the way we organize key parts of the economy, like healthcare, is to give private monopolies to a crucial sector, ending up overpaying roughly by a factor 2 for our healthcare. We spend almost 20% of GDP on healthcare compared to roughly 10% of GDP in our peer countries. So I've written a number of books, The Price of Civilization being one of my favorites, about what a budget would look like for a civilized country. And interestingly, and one of the better parts of a speech that Secretary of State Antony Blinken just gave about U.S. Approaches to China, he said the real approach is we need to invest in ourselves. We need to strengthen our capacities in science, education, our well-being at home, because that's what makes us the competitive model vis-a-vis the rest of the world, including vis-a-vis China. And that's true, but we're not doing it. And we have lost the budget debate and the budget narrative in the last 2 years. Biden came in with the idea of a package to build back better. It did not appear. What happens in the United States is essentially key sectors are in the hands of powerful lobbies. And military industrial complex is one of them. Big oil is another, or fossil fuel industry is another. The healthcare, private healthcare sector is a third. Those are favored by the budget. They are favored by regulation. And areas that don't have such powerful lobbies don't see the light of day. And in general, the United States under taxes, even though we're told all the time that we're being crushed by taxes, the total government revenues in the United States for federal, state, and local are about 30% of GDP, of national income. But in Northern Europe, which ranks much better in healthcare and longevity, in many quality of life indicators, about 45% of GDP. So the fact of the matter is the budget's a mess. And what foundered for Biden in the end, why didn't his package go through? Because nobody wanted to pay for it with taxation. And it all unraveled when Senator Sinema said, I don't want to have a rise of the corporate tax rate. And Manchin said, I don't like that billionaire tax. And we ended up with nothing. Biden ended up empty-handed, ineffective politics, by the way. So I think a president ought to be able to keep a couple senators in the fold, and he failed to do so. And that's part of his job also, is to know how to twist arms or cajole or give whatever side payments for new projects in West Virginia. You get something done, you make a deal, but he could not make a deal. He failed on that. So we have nothing. So we have a budget mess. And by the way, a budget mess also with a mountain of debt, now 100% of GDP of public debt. That's actually consequential. With interest rates going up, the burden of that debt is also going to be quite significant. We need to raise some taxes and we need to restructure what we spend, but we're a blocked political system. So we are not showing a way forward on this, and I'm not holding my breath. Nothing's going to happen. Probably the Democrats are going to lose one or both houses of Congress in the fall. If that happens, I would guess there would be no significant budgetary reform or action until 2025.
Yeah. Well, Jeff, I mentioned at the outset that you and I grew up in Detroit. And I remember one of my father's friends said to me, Detroit is the place that America divorced because they wanted to believe in the American dream. And when we had our stresses in the 60s, 70s, things like Tom Sugrew's book, The Origins of the Urban Crisis in Detroit, he said they'd had the Voting Rights Act and the Civil Rights Act, and all the Democrats in the South were afraid to vote to support the transformation of a black majority, black governed, meaning Coleman Young as mayor. So we got divorced we were no longer America. We were a bad example. And you and I have done work together in Detroit and been at numerous meetings. And I often think of the kind of pressures that I remember in 1990, there was this headline in CNN, Detroit is the shadow that looms over the future of America. In other words, it's an indicator. It's an early warning, like the canary in the coal mine, of toxic political economy. And so when I thought about talking with you today, I often go back to my musical origins. There was a guy that actually played my senior prom named Bob Seger.
Oh my God.
And as
well
I
done.
followed you,
I missed that prom.
I followed you for many, many years as a younger person from Detroit, but with family, mutual friends who were guiding me to look at your example. Bob Seger wrote a song that made me think of you. It's called Traveling Man. And at the end of the song, as he's reflected on all of this, he says, sometimes at night, I see their faces. I feel the traces they've left on my soul. Those are the memories that make me a wealthy soul.
Wow.
Jeff, you give me that kind of inspiration, curiosity. I follow your work. I have since I was, I guess, a senior in high school. And I think it's amazing how you, after the, what we might call the woundedness of Detroit, all the things you've described today and all your international involvement remain so constructive. And I'm very grateful for that.
Well, Rob,
Thank
I'm
you.
grateful that we do it together, and thank you for those lovely words. But we've been on a journey together, and your leadership of INET and constructive new approaches to these issues is essential. So I really thank you, and how great to be together with you today.
Yeah, thank you. And we'll, how would I say, pause now and wait for the next turn of events in the next chapter. But I look forward to working with you in the days ahead. And once again, I'm very grateful.
What do you mean, don't shout? Who's shouting? I am not shouting, but I cannot tolerate the way you people behave, right? All of you have no consideration for me. I'm such an important person. 10 o'clock, I've got a board meeting, I've got to be there on time. And here you people raise up such petty things. And then you say, don't shout. What do you mean, don't shout? Who's shouting? Understand the way that you provoke me, and you don't have any consideration for me. What do you think I should behave as?
What is this, yeah? All the time telling me don't cry, don't cry. Obviously, I'll cry, right? Look at the way you behave. Look at this. Even I have to go for work. I'm getting delayed. Oh my God, this unreasonable behavior. It's too much. I'm not able to deal with it. I don't know what to do about it.
Okay. Taken you a little by surprise, but this is reality. There was this very famous book by John Gray, which says, Why Men Shout and Women Cry. It's one of a lot of books written by him, which are very, very useful at a practical level. And I have read it more than once. I have quoted from it. I have used it for helping, counselees and all that I've done. So at one point, when I was talking to somebody like this, it just struck me that I should also, try and see if I can convey that message in a more of an interactive manner, knowing how many of us nowadays read books. So I thought, let me put it in a more interactive and a more visual form. So that's why I took up this topic. Now, if you observed these two quick clips that you saw, first it was me, the man. Then it was Seema, the woman. What do you think happened? What do you think are the emotions? Dissatisfaction, irritation, being let down, feeling unwanted. The emotions were exactly the same to the man and to the woman. But did you see the outburst? Did you see the typical reaction, a male reaction and a female reaction? So what happens is that the women say, why do these men shout all the time? Can't they control their emotions? Why do they have to be so loud and brash and angry all the time? And surprisingly, I have so many men who come and say, I can't even carry out a decent argument with my wife. Anything I say and she breaks down and starts crying. That is her weapon. Now she starts crying, what am I supposed to do? I have to leave the place and go away. I have to stop the argument. Wonderful, isn't it? See how she uses crying as a tool to get the way that she wants. I can't even raise my voice. I can't say anything because she's got this wonderful tool, no? Breaking down, crying, whining. Now, this is what I want to discuss today. Right. Firstly, let us understand that a lot of women feel men do not have emotions. I want to clear that myth. Men have as much emotions as women. This has been proven by research and surveys and whatever it is. You don't have to take my word for it. A fact like the soldier who sacrifices his life for the sake of his country. It is a purely emotional act. I will go to the extreme of giving up my life for my country. A man who slogs away to glory, works in a horrible job for years and years because he feels only then he will be able to give a good education to his children. He is governed by his emotions. A person who wants to achieve, by achieving career-wise, even a person who wants to win over the love of his girlfriend, it is purely an emotional act which makes him go out of the way, promise her the moon, do anything for her. These are all emotions, right? So, let us understand that men have as much emotions as women do. The only thing is the expression of those emotions comes out in a different way. I would not even say wrong way, I would say a different way. So there are innumerable instances, for example, where a man is so busy with his work, 24/7, he is at work, in office, or even when he comes home, he's on the laptop or he's on the mobile. And the family, particularly the wife, feels this person is so indifferent. This person doesn't love his family members. This person only thinks of his work. Now you ask the man, and like I mentioned a minute back, he says, I do it because I love my family. If I did not have a wife and children, I could stay in a one room or rough it out somewhere, and whatever I earn, I would have been very happy. But I've got this responsibility. I have to provide, I have to get a good house, I have to provide basic amenities, I have to give a good education to my children, I have to give them so many things, no? I love them so much that the only way to be able to fulfill what I want to do with them is to work harder and harder and harder. It's a highly competitive world out there, dude. You don't know. Unless you are on your toes and perpetually struggling, you will be left out. So that is what I do. So what I was saying is that the expression of love is in a different manner. And that is what they don't understand. Similarly, men who claim that my wife is perpetually nagging me, she's always correcting me, she's always making demands on me. She breaks down and she cries, she sulks. She points out so many fingers at me and she says, you're not doing this, you're not doing that. Doesn't she understand what I am going through? But now if you look at it from the feminine perspective, why is she doing it? Because she loves him. If she did not care, she would have said, okay, he's the provider. He goes to office, he works, he earns money and he gets the money and I enjoy myself. I will spend my time with my parents, my friends, my children. She could have given up, isn't it? Why is it that she doesn't give up? Because that is her way of expressing love. You are my life partner. I love you. I want to have a good, harmonious life with you. And that is why I am constantly behind you, telling you. Even a simple thing like, a wife telling the husband, don't smoke or don't eat rich food. Or, doctor was saying that your sugar levels are high, so don't eat sugar. To the man, it may appear as though she's perpetually nagging me and she's behind my back and she hates me so much that she doesn't let me live in peace. I come back home and all the time, this is what she is behind me. But to the woman, it is her way of expressing her love. The other factor, which I've spoken of earlier, but I want to reiterate the same point, is generally men are left-brained and women are right-brained. Mostly, not all. Now, a left-brained person is a person who is logical, sequential, analytical, mathematical, critical. These are the traits of a left-brained person. A right-brained person is emotional, intuitive, interpersonal, creative, literary. Now, when a person is right-brained, the habits, the behavior, the interests, the talents are different from a person who is left-brained. Nature has made, probably with some wisdom, that men should be left-brained and women should be right-brained, because only then they complement each other. Now it is up to us whether to use this complement. When you have a North Pole and you have a South Pole, they attract each other. Imagine if both were North Poles. Imagine if a man gets married to a man or a woman gets married to a woman. Of course, now it is accepted and permissible and all that, but there's a very, very interesting thing. I know a lot of same-sex couples, right? Inevitably, one of them plays the male role and one of them plays the female role. Starting from the way their demeanor, their dressing, their expressions, their way of talking, the profession that they choose are typically male and female. So even though physically they belong to the same gender, they again attract each other and they live with each other and they love each other because they complement each other. This is what I want you to understand. There is a beauty in that, difference. The French always say that, men and women are different. Long live the difference. Life would have been very boring if men started behaving the way women do, and if women started behaving the way men do. And that is what John Gray points out to us and says that women expect their men to behave, to react, to respond the way they would have done in that situation. And the man expects his woman to react, respond, behave in the way he would have done it. And when that does not happen, men shout and women cry. And there is no winner or loser in this game. Just because a man generally ends up shouting, it does not mean that he wins the argument or he gets the upper hand. Sometimes the person who's crying gets the upper hand. Anyway, this is not a ding-dong battle. This is not a court of law where we are trying to prove one is right, the other is wrong or something. But this is what we have to accept in order to have more harmony between the, the genders, right? Okay. Now, why are men left brain and why are women right brain? This is another very interesting aspect. It is partly because of genetics, maybe, I don't know, I'm not a geneticist, but it is a lot to do with the learned phenomenon. Men have been cavemen from prehistoric days. The hunter, the gatherer, and the protector. Women, right from the beginning of history, have been the nurturer, the caregiver, the lover. It is so ingrained through generations and generations of our ancestors that we cannot give it up. Even in a world today, in the 21st century, in metropolitan cities, women are playing as great a role as men professionally. You'll have women CEOs, you'll have women engineers, you'll have women surgeons, you'll have women playing all sorts of roles which traditionally were restricted to men just a couple of generations back. But has that changed the demeanor? Has that changed the approach or attitude or the emoting and the relationship? No. A woman who is a highly qualified person, holding a very, very strong career position and whatever it is, when it comes down to family, when it comes down to personal level, she still behaves the same way as her grandmother or great-grandmother did. And the same thing with the man. Let's say here is this man, who has a partner who is not only doing as well as him, maybe doing better. Maybe she is the main breadwinner. She's the one in the limelight. He acknowledges that. But because he's relegated to playing this role, there are men, for example, who are nowadays I come across who are doing a lot of cooking or taking care of children, which traditionally men never did. So you have this man who says, okay, you are busy, I'll take care of the baby. Or you are tied down with something else, I'll cook the food. So they are taking on feminine roles, right? But their demeanor, their expression, their behavior is not changing. When it comes to behavior which involves emotions, they still behave the way. Now this is not going to change in the near future. If it has not changed in thousands of years, please don't have hope that it will change overnight or within this generation or even within the next generation. What we can do is, as far as the next generation is concerned, teach them a little more. teach them to understand. I have a small little incident ingrained in my mind that I must have been 5 or 6 years old. I was running and playing. I fell down. And I saw small red spots on my knee. Some thing had grazed my knee and little blood was coming out. The moment I saw that, I thought I'm dying. And I let out a big shriek and I started bawling, crying. My father came running out and said, "What happened? What happened?" I pointed my knees. He went down and looked at my knees. He took his hand and brushed it aside so those red spots disappeared. And he said, "What's wrong with you? Why are you crying away to glory? Nothing has happened to you." I said, "No, I'm dying." He said, no, you're not dying at all. Nothing is happening to you. Go wash your knees and this and that, and then go and play do whatever you want. And he said, "Don't cry like a girl," he said. At that age, daddy is the ultimate. He is the end all and be all. Whatever he says is the absolute truth, right? So this great daddy told this little 5-year-old fellow, that is me, "Don't cry like a girl." But daddy never told me how to cry like a boy. So what did I do after that? Anytime I had something disturbing me, I would make sure that I don't cry. And because of that, what happened? Emotions started getting suppressed, suffocated, stifled, till I came to adolescence. And when I realized that I'm a big boy, I have power, I have control, I have strength, I used to bring out my irritation, my disappointments by shouting. And daddy never said, "Don't shout like a boy." In fact, I vaguely even remember if mommy would complain saying, "Look at your son, how he is behaving. Why is he so uncouth? Why does he shout?" Daddy would probably laugh and say, "Oh, he is a boy, forget it. He'll get over it." So directly or indirectly, that thing was propagated, that it is okay for you to shout, but it is not okay for you to cry. Now, all the girls sitting out there who are listening to this program, go back into your childhood. When you were a small child, and if somebody did something to you, and if you picked up your fist and started boxing that person, what would your parents say? "You're a girl. Don't behave like this. What's wrong with you?" Even if you shouted, they would have said the same thing to you. That is how that indoctrination came in. But when you cried, what happened? "Oh, my poor baby, come here, sit in my lap. Don't worry, Mama is here. No, we'll take care of you." So time and again, it was reinforced to the boys that you shout, and it was reinforced to the girls that you cry. Now, when you are 20 or 40 or 60, can you change so easily your entire basic demeanor? No, you can't. In fact, as I was mentioning to you about a girl, protecting herself or hitting or whatever it is, boys and men are made to believe that they are physically stronger than women. In many cases, it is true. A woman is built in a slightly smaller frame and a little more delicate demeanor and all that, but it is not always the case. I think yesterday or day before, what's that girl's name? Nikat, from a small town in Nizamabad, is now on the way to becoming the world boxing champion. So do you still think that girls are weaker than boys? If any roadside Romeo wants to tease her and she gives one box and that fellow will go flying 10 feet into the air. Okay, now you may say, no, she is one exceptional girl. But if you read her interviews, there's something very significant. She said that my parents, though my father was also a sportsman, and though he encouraged his daughter for sports, but he said not boxing. Both father and mother said, if you do boxing and somebody hits your face, and if there is a mark on your face or your face gets disfigured, then nobody will marry you. Imagine telling that to a little girl who's aspiring to become a great sportswoman. Have you ever heard a parent or a coach telling a boy, don't get into boxing because if somebody hits you and your face gets disfigured, then no girl will marry you? See the irony of the situation. I'm very proud of the fact that here is an Indian girl who, went against what was indoctrinated into her and has achieved something. Now, she's a good role model. Before her, Mary Kom was also a great role model. So many of them. But like I said, they are exceptions because the others succumb. And once you succumb and once you're made to believe that you're not physically strong and you cannot protect yourself and you should not protect yourself, the only way that it comes out is in the form of frustration, crying, whatever it is. It goes right up to the, extent where the girl grows up, becomes a mother. And now she is supposed to be all the time that great sacrificial mother. Whatever else she may do, she has to give first priority to children. One excellent example is this great lady called Indra Nooyi. She was the CEO and even the chairman of PepsiCo. PepsiCo is one of the maybe top 50 organizations in the whole world. Indra Nooyi, a girl born and brought up in India and in Chennai, migrated to USA. Her parents didn't go. She went over there and went up the corporate ladder. And eventually, as I said, she became the CEO of PepsiCo. At the same time, she married and she had 2 daughters. While she was going up the ladder in the corporate world, she was also bringing up 2 little girls who eventually became 2 teenagers. How did she balance? How she balanced is one thing, but the pressures that she was under, not only from others, but even from her own self. Am I justifying my role as a mother? She has a very understanding and a very supportive husband. Despite that, she was always made to feel doubt and question that whatever I am doing, am I justifying my role as a mother or not? In fact, her mother gave her a very interesting piece of advice. She said, you go to office, do your work, come back home, and when you park your car in the garage, leave your crown in the garage. What is that crown? The crown is CEO, chairman, whatever she was. She said, leave that crown in the garage and then come inside as a wife and mother. Have you ever come across an upwardly mobile or a successful man being given that advice by his elders? Leave your crown in the garage and come back to being a husband and a father. This is where we need to work on. We need to work with children. There's a lot that can be done. The children who have not yet come to that stage where the gender differences become very obvious. the 4-year-olds, the 6-year-olds, the 10-year-olds, both boys and girls, can we help them to understand that while you belong to one gender, and you should be proud of your gender, you should be proud that you are a boy or you're a girl, nothing wrong with that. At the same time, you need to understand the other genders. And that includes more so particularly the boys. I remember, I think it was the first Independence Day message that Prime Minister Narendra Modi gave from Red Fort. And he raised a very interesting point. He said, we are so protective, so possessive about our daughters. We keep asking our daughters, "Tum kahan gayi thi? Kiske saath gayi thi? Where were you? Why did you come late?" But he said, we never ask our sons, "Tum kahan gaye the? Kiske saath gaye the? Kyun gaye the? Kyun late aaya?" When we are encouraging the boys to start feeling that way, what do you expect will happen when they grow up? We have been doing this one generation after another. At least now, can we put a break to it? You cannot change grown-up men, you cannot change grown-up women. Men will continue to shout. Women will continue to cry and say, "Kya karun? Maa hu na." Typical Bollywood dialogue. So there's not much we can do about it. But there's a lot that we can do with regard to the next generation. This men crying and women, men shouting and women crying, as I said, is not genetic. It is an inbuilt thing which comes out of indoctrination. It is based on the upbringing. It is based on the lessons and examples that are taught. It is based on the role modeling that we do with our children. Children growing up, particularly boys, watch their father shouting and their mother crying. And nobody seems to be bothered. Nobody points out and says, "This is wrong. Why can't mommy shout and daddy cry?" So what happens? He grows up thinking this is what life is all about. This is one strong message which I would like each one of you to please spread this little message after today to whichever adults who are concerned about the next generation. Please start changing that outlook, the demeanor, the attitude of both boys and girls. Don't tell a girl that you cannot do boxing because somebody will hit you and your face will get disfigured and then nobody will marry you. You're pulling down the self-esteem of the child. Don't tell a boy that, yeah, boys will be boys, it's okay, he will get all right, let him shout, let him get into brawls or whatever. That's not fair. So please take this message with you, and I need that 1 minute break as always. Seema has got something very interesting to share with you today. I'll be back in a minute.
Hi, today you can see all of us wearing, I don't know if you can see it, yeah, Banjara Right Forever t-shirts when you walk into Banjara. All of us, including Ali, to each one of us here in the staff. And why we are doing this is because today we are all going to Manthan. So it's picnic time, it's team bonding time, team building time for us. And yeah, we are going there only with open minds. We don't know what Ali has planned for us there. But yeah, the whole idea is to be together, eat together, and we'll stay the night over there. And yeah, we will do certain activities and stuff to know each other better. We work here together, but yeah, those nice moments, the personal journeys. So it will be nice sharing with each other. And yes, really looking forward and really, really excited. So we'll be shutting down Banjara at 3 o'clock today. We'll be closing office. and we'll all be going there. And yeah, that's the plan. And we'll stay the night. Tomorrow, our friend Asra, she's opening a kennel called Off Leash in Manthan. So tomorrow is the inaugural. She's invited everybody, all the dog parents and dog lovers, to come and spend the day there. So that's another thing we're looking forward to. So that's what's happening here. And of course, as usual, the place is bustling. Banjara is bustling with our new babies coming in, DCS 23. We had a very nice program last Saturday, and they were here and we interacted. It was nice. And every day we have, many of you coming here for inquiring about the program as well as for admission. So yes, admissions are going on at full speed. So do come. 25th June is when we officially start. But don't even wait till then if you're planning to take this up or you have somebody in mind who wants to take it up, because we've already started the entire process of rapport building and meeting up. So do reach out for DCS 23, and all other programs as usual are there on the website. So all right, that's what's going on in Banjara. Thought we'll keep you posted.
Manish just showed you a poster of an interesting program that I'm doing. Can't really call it a program because it involves 5 minutes of your time every day for the next 3 weeks. But if you're interested in something like that, do get in touch with Anis or any of our people in the office. It's a very simple thing of how to enrich your life through the thought and the experience of death. Don't get scared. I'm not going to ask you to do something like PUBG or something that you jump over the roof or something like that. It's just at the thought process. And as I said, 5 minutes of your day. These are the little unusual things that we keep doing all the time, just to keep ourselves occupied and to do. So we've got this break in between the DCS 22, which ended, and DCS 23, which is going to start next month. So I thought, let me use that time. Okay, so now Anis is going to show me which are the comments and questions that have come up. So Vidya says, why is it so tough to make the men express his emotions? It is not at all tough, Vidya. Men express their emotions immediately. You say something and he gets provoked and he starts shouting. That is expression of emotions. What we need to do is not to make the men express emotions, but to express it in a different manner. There's a lot on that. I don't want to take the time of all the viewers today, but in a very simple form, I will tell you, do not get into arguments. If he's shouting, you don't start shouting. Be assertive, accept his behavior for the moment, keep quiet. He will calm down. He cannot be angry all the time. He cannot be shouting all the time. When he is back to a good mood, that is the time you bring up this question of, next time when you're angry, next time when you're upset, next time when you're irritated, can you tell me in a different manner? You will get results and I will respond much better to you. Start with that. Sheila says, tough to understand what men are thinking. Sheila, take a survey of men. 9 out of 10 will tell you it is tough to understand what women are thinking. I can never understand. And even if they understand other women, they generally don't understand their own wife. So it is a ping pong battle. Both of them can keep on complaining. Now my question is, when you say tough to understand what men are thinking, it is tough. It is not impossible. So what efforts have you made to understand what men are thinking? Have you spoken to men of different ages? I mentioned to you, you go younger and younger. If you are a grown-up adult and your partner and your peers are people of your age, go lower down. Maybe talk to a man who's 25, 20, 15, 10. You will get an idea about what the male person thinks when he's 10, when he's 15, when he's 20, when he's 25. And from there, a pattern evolves. And then work with the men who are important to you. Vidya says, why is it that certain men don't understand that these are wife's way of expressing love? Rather, they just complain that you talk to me only when you need some household products, and they doubt that we are in relationship with somebody else. That is a very, very sad situation. Be it a man or be it a woman, if you doubt without any concrete evidence, yes, there are people who get into relationships and that has to be dealt with by the spouse. I'm not talking, those are very rare, and whatever happens, that's a very serious situation which has to be dealt with. But if there is a man, as you gave this example, who perpetually thinks that his wife is in relationship, you know what, it has nothing to do with his wife, it has nothing to do with his relationship with his wife. It is his own feeling of insecurity. It is his low self-esteem. It is his loneliness. It is his feeling of being isolated. And he doesn't know how to handle it. So he hits out by making some accusations and saying this is what it is. Okay. The same way as you said that, okay, you said that why is that how much Yes, we are back again. So sorry for the rukawat. Technology sometimes also behaves like human beings, throws tantrums. At least it doesn't shout or cry, but it makes life miserable for us. I was answering Vidya's question. Why is that however much a man shouts, it is expected that the woman should keep quiet? Now, when you say expected, who brought in that expectation? Please go back and reflect. It was your mother, your grandmother, your teachers. So many people told you that you are a girl and you should not shout. If they themselves have indoctrinated this into you in your innocent and vulnerable years, obviously it becomes part of your personality. And that was never done to your husband or your brother or any other male member of the family or in the class, right? Now, that is what I want us to understand that we are doing. And that's the reason why I said before we closed for the break that please work with the smaller men before the men become men, when they're still boys, when they still listen to you, when they look up to you, then they have this great regard and respect for women and for mothers and for elder sisters and all that. That is a time to help them to understand. If we start now, maybe 5, 10, 15, 20 years from now, we will be creating a generation of equality. Saraf Sahib says, women's bearing capacity is inherently more than that of men. That's why men are in a hard condition to digest something done by women, whether she be his wife, daughter, friend. Yes, same thing I will tell to all of you, including Mr. Saraf, that when you say bearing capacity, where has this bearing capacity come from? Why is it that a soldier's capacity to bear physical pain, even when he is shot, and he's got a bullet in his leg, he still moves forward and he still continues to fight? If you or I were to have a bullet in our leg, we'll just collapse. Now, this bearing capacity of the soldier is not genetic. It is not inborn. He was trained in that manner. He was indoctrinated into that manner. He was motivated into that. Both body and mind was told that you are a soldier, you have to defend the nation, you have to do this and that. And that is what made him a hero when he has to face adversity. The same thing applies. Women shout and cry, Sheila says, while men only shout largely. It is a fact. That's the reason why I brought up this topic. But it is how you shout and how you cry which is important. In fact, since men hardly cry and definitely not, in front of their spouse or somebody, I have also come across, unfortunately, one odd, in a rare instance here and there, she tolerates, she accepts, she somehow, carries on, she gets fed up. And she says, more, I am going to take things in my control. And the moment she announces that, this man breaks down, starts crying. And the woman is so overwhelmed that she feels that nothing can be sweeter than this, that my man is crying and asking for forgiveness. And everything gets deleted and she goes back to be what she was. Please be aware of that. Roshan says, very lucky to get a life partner who never ever shouted at me and never did I cry. Fantastic. Congratulations to Roshan. And I also feel that while the partner may have had a good upbringing, hats off to his parents and elders, at the same time, it is also how the wife behaves with the man which makes a difference. What is needed in these circumstances is assertiveness. neither being aggressive nor being possessive. Giving away easily and becoming submissive. Assertiveness wins the day against people who unnecessarily lose their temper and who shout. Surekha says, how can we help our counselees help them behave in ways that their love and care reaches the partner? Here, one thing is very important, Surekha. You have to deal with in two different ways when it comes to a male and when it comes to a female. By the time this counselee has come to you, the person has grown up in a lot of indoctrination, behaviors and attitudes, and is also experiencing certain things, right? So we have to deal with the men differently and the women differently. With the men, if it can be made to understand that I understand your anger, I understand that you are very frustrated and you are pushed to a corner and that is why you shout or that is why you get so angry, but do you get results? If you do not get results, would you like to try out a different way instead of shouting at your partner or creating that ruckus? Would you like to try? With a female, you have to tell her that whatever the person is doing to you, do not get provoked either way. Don't break down and cry and show your vulnerability, and do not start countering and shouting and arguing. Be assertive. We have to teach women assertiveness. And that assertiveness, believe me, is directly connected to self-esteem. Innumerable Indian women suffer from low self-esteem because of the way they have been brought up. I am not capable. I am a girl, my own dreams. And I have to listen first to my father, then to my husband, and then to my son. We have to break that. Any girl who has good self-esteem and who is assertive can easily handle a father, a husband, a brother, a son who tends to get angry and shout. Over a period of time, the change can be brought in. Conclusion is seeking help or counseling. Don't wait till it comes to that exhaustion stage, and where you get so frustrated that you may actually do something which is very impulsive. Do it while you feel that things are a little better. This is another thing which I have experienced with so many people. Let's say you have this man who keeps shouting all the time, and the wife is very submissive. You know what she thinks? No, if I am nice to him, then he will stop shouting. If I don't argue, if I don't present my viewpoint, and if I accept his anger and do as he tells me to do, even though I don't want to do that, slowly he will realize what a good partner I am, and he will start being nice to me. Sorry, it doesn't happen that way. You have to take it as early as possible. And this includes what Surekha has asked, handle unresolved feelings from the past. This is something which, as you know, you will recall that I have been constantly striving on. Take this man-woman situation where the man shouts, the woman cries, whatever it is. Somebody has also mentioned the man always doubts his wife whether she is having other relationships. All this is based from the past. It starts in early childhood. And a lot of things from our childhood need to be resolved. Even if it is not currently an issue of shouting or crying or whatever it is, but a lot needs to be resolved. Our education system does nothing to help us learn life skills, to build up our emotional intelligence. But it's never too late. Even now it works. And this is something very, very heartening when Sheila says, being politely assertive has been working for me. I think we should give an applause to Sheila for not only believing in it, but practicing it. She's used a very nice phrase, politely assertive. Yes, I know you're angry. I know you've got meetings and you're very stressed out and you're a very important person. At the same time, I think we need to resolve this. I don't feel that I am going to give in at this stage. I need to do this. In whatever manner, whatever words, whatever expressions, but politely assertive can really go a very long way to help people. So these are some of the very, very important things. As I said, number one, we need to keep feeling frustrated because the woman cries all the time, or the woman is feeling frustrated because the man shouts all the time. It is not impossible, but it is tough to handle it, to deal with it, to try to slowly bring about a change to the extent that it is possible. Don't expect miracles. Don't expect overnight change from the person. But I can assure you that 10%, 20%, 30% more harmonious relationship goes a long way in making you feel contented. And it sets the ball rolling for better and better and better relationship. At the same time, look at the younger generation and see what we can do. Let us not be so selfish that we work only for our needs. We owe it to the next generation that we have to leave a good world behind them. There's so much talk going on about global warming, about wars and whatever we have been doing, the way we are destroying the world in so many ways. I am equally concerned about the way we are destroying the younger generation at an emotional level. I have told this a number of times, and I repeat again that emotional intelligence can be built up at any time. And what are the first two pillars of emotional intelligence? Self-awareness. Yes, right now I am getting angry, I'm getting irritated, I'm feeling very disappointed, cheated. Awareness. The second pillar is managing the emotions. Now that I know that I am provoked, I am angry, I am feeling very restless. How do I manage? Which is the best way to manage my emotion? Roshan says, keep giving love and one is bound to get back love. No shouting and crying will happen. You're very lucky if you keep giving love and you do get back love. It doesn't happen all the time. I'm sure all of you have heard that little proverb that, you pick up a street dog and you nurture it, feed it, take care of it. Take care of all his needs. He looks up to you and says, you're taking such good care of me. You must be God. You pick up a little kitten and take care of it, feed it, groom it, protect it, do everything. The kitten looks at you and says, you are taking such good care of me. I must be God. Remember that some of us are dogs, some of us are cats. So you have to take that chance. Sureka says, how can we work towards better emotional autonomy, which prevents us from developing dependency? Yes, Sureka. Since we live in families, since we have to interact with people, I would suggest that we don't work towards developing or, working from, the dependency, work towards what I always call as interdependency. It's the same way as there may be a family where the man goes out to work and earns the salary and the livelihood, and the woman takes care of the house and the kitchen and the children. They are not dependent on each other. They are interdependent. They are complementing each other, and men and women complement each other in 100 different ways. So learn to enjoy that aspect of it. That is what is needed It can be done. It requires some time and effort. And it can be done if you decide on the next Saturday's topic, that is, don't grow old. I'll be seeing you next Saturday, where we will be talking about how, while the numbers pile up, you ensure that you remain young till the last day of your life. So have a nice, wonderful week. I shall see you next Saturday. Bye-bye.
Hi, my name is Sonia Santiago, and this past January I did a research field period project on emotional intelligence in law enforcement. My main purpose of this project was to research what emotional intelligence was and how it could be applied to law enforcement, as well as the characteristics of officers with high emotional intelligence versus low emotional intelligence. And I also looked into the training and perceptions of law enforcement to see how, if an increase in EQ training, if it's needed, could benefit the other officers. Now, emotional intelligence has also been referred to as EQ and EI. It's the ability to recognize your emotions and being able to tell them apart and use that ability to guide your actions and behavior in an appropriate manner. It's also the ability to understand others' emotions, where they may be coming from, and how to understand how your actions can affect other people. And it's the ability to keep control of your emotions, to not let them control you in a situation. Now, a brief history on emotional intelligence. The earliest explanation was in the 1920s. It was defined as a way to act wisely in human relations. And in 1948, it was thought to be emotional thought, the concept emotional thought, and it was kind of an addition to logical thought, where people would add that to your cognitive intelligence and how you were able to function as a person, basically. The official term, however, wasn't created until 1990 by John Mayer and Peter Salovey in an academic article with the same title, Emotional Intelligence. And they were two psychologists and researchers who looked into the foundation of human intelligence, I believe. But the term wasn't popularized until 1995 by Daniel Goleman in his book with the same title. And the book would later become a highly influential piece of identifying human intelligence as a whole. Now, this slide is to kind of, some people believe that these are interconnected. You can tell one from the other. You can tell how smart someone is based on their personality. You might be able to tell how they can react to a situation based on their personality or their level of IQ, and that's really there's not a link, at least one that's found and academically or scientifically proven between any of these. EQ is something that's you can develop over time, even if you're not born or in a situation where you have a high emotional intelligence. You might be on the lower spectrum. As you grow and you learn, you can practice those skills and abilities to grow into a highly emotional, intelligent person later on in your life. And it's not, some people believe it's the pushover, the person who's very emotional, they're very nice, they let people push them around. That's not it at all. It's the ability to use those emotions and not create a scene kind of way. Like it's one thing where you can be angry, but you can show that calm anger and not escalate a situation even more unless someone else escalates it. Now, IQ, your cognitive intelligence, it was a long time assumed to be the only way to measure human intelligence. And around the 90s, when people were discovering what emotional intelligence was, it was discovered that's not the case. And it's your ability to learn information. It doesn't change from the moment you're born to the moment that you're an adult. It's the same about this. If you can learn more, you can obviously, like, you can go and you can learn more and you become a smart and a more intelligent person or a better person because of it, but your ability to learn, the pace at which you learn, that doesn't change at all. And your personality is just learned behavior and sometimes instilled preferences that you pick up as you grow up. Like, you learn your mannerisms from your family, or one of the examples I found was being able to be an introvert or an extrovert. Someone can be extremely introverted and people believe that they might not be the best at emotions, when in reality they understand better than most people. And on the other end of the spectrum, someone who appears very, very smart is more emotionally intelligent because they have a way with people. But in terms of academics, they might not be the smartest one, they might not be the best, and that's okay. And it's not like any of this is not okay, it's just there's a big difference between them, and I thought that would be good to include. Also, personality is consistent in the manner that it varies by person by person. Now, this is the characteristics and the dimensions that make up emotional intelligence. It's your self-awareness, your ability to identify emotions and your mood and how it can affect other people, your self-regulation, self-management, the ability to control your impulses and express emotion in a way that's not bad. Sorry, lack of better wording. There's also your motivation, the ability to set goals and your drive to meet those goals. Your empathy / social awareness, it's your ability to sense emotions of others and understand why they might feel that way. Even if you don't understand the cause of it, you can understand that they feel that way now. And even if you don't understand why, you can empathize and you can be aware of how to handle their emotions at that time, such as if your coworker comes in and they look sad or they look depressed and they don't want to tell you why they feel that way, you can understand that they might need a bit more help than usual, or they might need a more gentle explanation, something of that nature. And there's also your social skills and your relationship management. And that's where the ability to use your awareness, your self-awareness, and your empathy to navigate social interactions. It's your ability to more or less survive social interactions. Now, people with a good self-awareness, they have a high confidence, such a high self-regard. And what I'll get into later is that with officers with low self-awareness or low confidence, a lot of the time it plays into their low emotional intelligence, and that can affect how they work. Your self-management, your self-regulation, that's your self-control, that's your ability to change, and that's the way to find a solution to a problem. And your motivation is the commitment and the optimism. And empathy is empathy and social awareness, they can be defined as two separate things, but I think the basis of both of those is being able to understand where a person's perspective is coming from. And one of the articles I found, it included political awareness, your leveraging diversity, and service orientation. That basically means that you understand a political opinion even though you don't agree with it, and you're not the Facebook people screaming at each other, no, your opinion is wrong, no, yours is wrong. It's like, I understand where you're coming from, I don't agree with it, but I won't attack you as a person. And the diversity is, even if you don't understand where someone comes from because they have a different culture or a different background that you have, such as the biggest one in terms of law enforcement is race. A lot of race does play a big factor, and sometimes being able to understand that someone might not respect the police or have a lot of faith in the police due to a past experience or marginalization, or they may have come here from a country that where police are not the best people. And as sad as that is to say. And service orientation is, I think it's more or less related to the thing I said earlier where you're in a service, like you're, let's say, a McDonald's worker or a JCPenney worker, is your ability to more or less keep your anger in check with the difficult customers and being able to say, I'm sorry with a smile, even if they're cursing you out. Now, your social skills, those are things that are used daily because, well, maybe not now because we're in a pandemic, but it's basically how you navigate any social interaction, whether it's bumping into a stranger, having a small talk conversation, talking with your friends, something like that, or your coworkers. And it's the ability to work together as a team. It's your collaboration skills and your cooperation skills. So even if you don't like someone and you have to work with them, you kind of being able to control those frustrated emotions and try to work with them in a positive way. And the big one, which I'll get into later, is conflict management. Because during conflicts, I know personally my emotions tend to run high. And when my anger gets out of control, or I let it get out of control because my emotional intelligence I'm still working on, it's logic goes out the window. And in terms of law enforcement, that can't really happen because we've all seen the situation of police firing because they were scared, or they were a little too rough with someone because they were angry, or at least from what the perspective is, because that is what causes the most damage, and ultimately what I found this presentation to be most effective for. Later, I'm going to get into methods of improving emotional intelligence as officers, and the reason why I did that is because I've had talk with friends and family where they believe that if you can't be able to do any of these skills as an officer, or if your training doesn't account for them, you should not be an officer. And I agree with that statement because I know that I'm not the best at some of these, but I've been working to improve them. Whereas some officers, they go straight out of high school and they don't learn much in terms of emotional intelligence and how to build those skills. And we see those interactions, the negative interactions. And this project is not to vilify anyone. The police are just as human as we are. I know that once I put on my badge, if I'm lucky enough to get a badge in this environment, that I would want to be the best that I can be and to work on these skills to not end up on TMZ. Sorry. And to not end up on a news network being the cop that punched someone because they were resisting and I lost my temper. And this is basically what all of these are to be, and I'll get into how they're going to apply to law enforcement in a little bit. This is what I was getting into more on the other slide. I kind of went off on my own little tangent here. The importance of emotional intelligence is, as I said, it's the ability to keep your emotions in check under pressure or a stressful situation, because when they run high, logic is out of the building. It is gone. It is you're doing what is instinct, and what is instinct may not be the best in that situation. And if it's an instinct that is instilled in you as a child, and that instinct is to lash out and be aggressive, that might not be the best if you're a retail worker or a law enforcement officer dealing with another person. That's not going to be the best. You're going to end up on Instagram or TikTok as a viral video, and people are going to be in the comments arguing whether or not what you did was right or not. That's a whole different thing. And it's also the ability to meet tight deadlines. I know in law enforcement, sometimes they get tighter deadlines than they would like, especially in high-profile cases. And it's kind of the ability to not let the stress go to your head, which is hard. A lot of this is what I'm saying. It's hard to do, but the point of it is the more you practice at it, the better you get. And sometimes when you can't, if you have a friend who's emotionally intelligent or someone else who can kind of help you with that, and which it goes back to the collaborative thing, because a lot of this is what I found is that it's a good mechanism to use when you go through a traumatic experience or your mental health is not the best. And I'll get into that later, because some of that's more of how to develop a higher emotional intelligence, which I'm going to get to later. And it's also how you deal with challenges, whether in your social life, your work life, or the situation. It's being able to have that uncomfortable conversation when you get overwhelmed, it's not shutting down and just blocking out everything, because sometimes, especially in law enforcement, you can't do that. You have to, or in life, you can't just shut down whenever you feel like it, unless you have a mental condition that makes it hard to do that. Sorry. And it's also how you improve relationships. In this point, in this presentation, I'm going to get into later of relationships with the police, because I believe that's where you're going to see, that's where you see more emotional intelligence with officers, because in reality, a lot of this is how you deal with people, and that's a lot of law enforcement work. And it's also how you deal with conflicts. Now, we've seen 101 videos of conflicts with police officers. Some of them end okay, some of them they do the right, some of them they are able to use their skills to bring down a situation. Other times, a situation escalates to the point that no one can control it. And like I said, the whole point of this isn't to vilify anyone. It's more to point out that I believe that some of those cases were simply due to a low emotional intelligence. And whether or not that was due to the training, which I'll get into later on, like I said, or just them as a person not being able to develop those skills, it says a lot, because like I said, I've gotten into conversations, and these are skills I believe that are very, very important when you're in law enforcement, because it can be extremely harmful or even fatal to not just the officers, but to the people that we're supposed to be protecting. And it's also the persistence in failure and setbacks. That happens a lot, I know, especially in detective work. And it's the ability to motivate yourself and others. Some of the articles I found mention that emotional intelligence training and being able to develop a higher emotional intelligence can actually lead to less burnout among police officers, because they're able to pick themselves up, give whatever time they need. Obviously, the situations are going to be different, but it's the ability to be able to pick themselves up and go through another day, knowing that they can't, even though if they can't control the situation that they're in, they can control how they react to it. Now, emotional intelligence in the terms of law enforcement is usually the officer's ability to manage their emotions in a way that has a positive outcome or is in a constructive way, and it's the ability for them to manage a healthy relationship within the department, among their fellow officers and people who work there, along with the other agencies in the system. Now, the functionally high IQ is references to the ability to create a healthy workplace. And usually in these workplaces, there are lower reports of stress and healthier off-duty events. And what I mean by this is that it's usually, from what I understand, it's the ability to create a workspace where even if you don't like each other or if you don't agree with the way someone handles something within reason, you still respect one another and you're able to work with one another. And it's just all around better for everyone, because you're not stressing, oh, is this person going to do this to get back at me? And this happens in law enforcement. When I get into later, I'm going to reference officers who they broke the blue code in a way. They reported officers for unethical conduct or something like that. And it had very harmful consequences for the officer and sometimes for the people, for the civilians that got caught up in it. And this is going to tie into why the whole purpose behind some of this, at least from what I understand. And emotional intelligence in law enforcement is also, when you have a higher emotional intelligence, it's one of the big reasons for a stronger job satisfaction rating and building relationships in the department. It's usually the positive, someone with a higher emotional intelligence or high EQ has a positive approach to conflict. They're not, I think, as I said before, the officers that are aggressive, or no, I'm going to say in a minute, officers who are aggressive instead of assertive, they have the kind of fight me thing, which is not a healthy work environment, whereas someone with a high emotional intelligence is more of the, okay, let's talk about this in a civil manner to make a way that's good for everybody, or at the very least calms down the situation. Now, these are the characteristics that you're going to see in an officer with high EQ versus one with low EQ. Someone with high EQ, they're assertive, they're ambitious, they're decisive, they're sociable or they're friendly, they have a friendly demeanor, they're influential with the people around them, they're patient, and they're a good listener. Now, someone with low EQ is going to be aggressive, they're going to be demanding, confrontational, impulsive. They're going to resist any change that you're going to make, or any changes made and go with what they know, which might not be the best. And they're more temperamental or moody. They're the more cynical, not in a good way, officers. And what I mean by that is a lot of people in law enforcement, sometimes they have a darker sense of humor because that's kind of how you survive the job. But they're the ones that kind of stew in those emotions, and they don't know how to handle those emotions. Now, the difference between assertive and aggressive is the obvious one, where it's usually, from what I understand, is that someone who might be assertive can be perceived as aggressive, and vice versa with the other one. And that's what can be hard to measure. But as you can see, with the high emotional intelligence in officers, it's the ones that you want. That you want someone who's going to be able to listen. They're going to be patient and try to understand the situation as best as they can. Obviously, in high stress situations, you have to make decisions quick. But the thing is that when you're impulsive, and such as the one in a low EQ, and you're confrontational, those high stress situations can become even worse. And later on, I'm going to get into perceptions of law enforcement and how these are going to tie in. So when I was looking into the training, I was already familiar with the paramilitary type style that was used in police departments. It's the one that's referenced a lot when people think of police training in America. And most of the time, this is, as it sounds, the military-esque type style, where people go in, they expect to be yelled at, they expect to have a lot of physical activity and be yelled at, or even screamed in their face. And the point of most of these tactics is to kind of build that mental endurance, but it also can teach the wrong message and can attract the wrong kind of officers. And what I mean by this, it's usually the people who see the recruitment videos. One of the articles I found mentioned a recruitment video for SWAT, and it was criticized for its use of heavy metal music in the background. It opened with the code of SWAT is take down the enemy at any means necessary. And what this does is that this type of training trains officers to have a warrior mindset, an us versus them mindset. And this can be problematic when they believe that the people that they're supposed to be protecting, even from themselves, are a threat. And there has been a link between paramilitary training and abusive behavior. As I said before, the screaming in the face, it's usually used to teach stoicism, so that way they don't show emotion during stressful situations. But what this effect can also have is that it puts in their mind that if they can scream and belittle someone who has less authority than they do, i.e. the civilians. The warrior cop mentality has also been heavily criticized for the use of kind of more or less endorsing the blue line, the us versus them mentality, and that itself can be harmful to the police because there is a process or a time where their mindset stops going from protect and serve to make it home alive, even if it is in the most action-based place that they live in. Sometimes they do have that kind of mindset. And because there is no standard of training, it's much shorter compared to other countries, and even shorter than other departments within the U.S. Some of them are as short as 10 weeks, others as much as 36 weeks. I know in the FBI for Quantico, it's an intense 20 weeks living there, but even then, that might not be enough to get everything ready. And in terms of education, the basis for most police departments is having a high school diploma. High schoolers nowadays, I know that when I left high school and if I joined straight out of high school, I would not be okay. I mean this in the sense that when you're 18, you don't know anything. You're learning how to be an adult, and if you're in this type of and you gain that type of mentality, it's going to be the officer that's viral for using excessive force, or at the very least what seems like excessive force. And there is no standard in terms of hours, too. It can be anywhere from 360 hours to 900 hours, depending on the state. And the minimum, most places do go over the minimum, and they do have a time where the recruits have to be, or the rookies have to be, with a senior officer, a training officer, for about 6 months to a year before they're considered full-time police officers, in the sense that they know what they're doing. But this can also be harmful when the training officer is not teaching them the right things. I'm going to be getting into some bad situations and bad conflicts with that people have had with the police over the years. And the most recent one has been George Floyd. It was actually the training officer who was the one who was leaning on George Floyd's neck with his knee. And it was the rookies that were standing there not knowing what to do because they had only been on the force for a short time, or two of them at the very least. And what this does is that when the training, and the whole point of what I'm trying to make here, that when the training officer is teaching has low emotional intelligence himself, because that's what that was. That was, I don't know what that guy was thinking when he was doing that. And that's where this kind of, where the question came from, is how much do they teach people what not to do? Because it should be basic knowledge. Do not lean on someone's neck for 9 minutes. But that's not what happened, and obviously not every officer is like that, but that's what I mean by attracting the wrong kind of officers, because if you have an us versus them mentality and you go and the training does not meet up with the standard that most people have, it's going to be very bad. And because of the short amount of time that officers have to train and to learn everything, it has been heavily criticized when I compared it to the Norwegian police and the Finland police, who have a 2 to 3 year training requirement. And the studies have shown that the population trusts the police much more than they do in the United States, because by the time that they're getting to use the force and getting to learning about it, and the officers in that scenario were getting their badge and their gun, which was about a 4 months time period. And the whole point of this spiel, I guess what it is that the skills of emotional intelligence are not as emphasized as they should be. Most of the time, it's them learning how to use their weapon, learning the law, other things like that, and then kind of just it's more or less than when they get to it, it doesn't always stick in their heads, and they don't practice it as much as they should be, because this is not something you can learn in a few weeks. This is something that takes months to years of practice to get these skills. And that's why when I get to the improvement section, I'll divulge into more as to what I mean by that. Training in mind, I looked into other quote-unquote damaging interactions with police, because these are where I believe you see the officers of showing a low emotional intelligence most of the time. Because as I said before, they're more confrontational, they're a lot more aggressive. They tend to be, I should say. And the most famous ones in terms of this is the Rodney King incident in LA back in the 90s, where he was beaten by 4 officers. When I looked into these, I went in with the mindset, is this police brutality, or is this someone having a low EQ who could potentially be approved? Now, obviously in situations such as that, the officer is going to need to face a serious punishment if needed, like the Eric Gardner case or George Floyd. Those were not emotionally, though they may have been emotionally intelligent on the lower spectrum, but in those interactions where someone is seriously harmed or died, those situations should be held more accountable for those actions, if it includes them being off the force, and so be it. And I bring these up because these are more the extreme situations where that could be used in training if they aren't already. I didn't see any evidence that they were, but I believe that they are, of showing officers this is what not to do. You need to work on these skills. And another one I looked into was one that happened back in December of an 18-year-old named Zeke Rayford, who had run a stop sign or had run a red light, and he fled from the police basically because he had weed on him. He ran home, and when he got home, he was banging on the door asking for his father. And when the officers showed up, they immediately tackled him, and you could see them kicking and punching him on his stoop. Now, looking at this from an objective perspective, yes, he was in the wrong because he had weed with him, and he ran from the police. But in terms of emotional intelligence, someone with a higher level would probably emphasize, okay, this is a black teenager living in a time who has probably seen his entire life of black Americans being shot by police, either accidentally or because the police thought they had a weapon. So he was probably scared for his life, and I believe he said he was scared for his life at the time. But these officers only saw someone who was running and assumed he was wrong, at least from what you could see from the video. And it's a heartbreaking video to see, and the reason I bring it up is because this is what I mean by implementing emotional intelligence training more into police training and potentially making the police training longer to account for this. Because a lot of the time, in situations like this, especially when it concerns race, this is where empathy becomes a lot more pronounced, because it was the stereotypical white officers versus the black citizen, and everyone is going to automatically assume, oh, they're racist, oh, they weren't doing their jobs right, and that may or may not be the case, but that's not what this point is. It's the fact that they were aggressive, they were confrontational, one would argue, and they were impulsive. They followed it appeared that they followed their emotions, and they went way too far with this kid. It's a heartbreaking video, honestly. And there was another one I saw in my relations to law enforcement class that I brought up. I don't have a picture of a teen assaulted in a New York City subway by a cop. It was a very messy situation. It was a very stressful situation where there were teenagers who were alleged to be involved in a brawl that happened, who ran into the subway, and when the officers tried to make an arrest, they resisted, and one officer, you can see him walk up and just flat out punch a kid in the face. He was maybe 18, and that itself started a whole nother mess, because now everyone on the train tracks that saw this are screaming, "Let them go," and trying to help them get away. And the reason I bring this up is because this is another situation where the use of force by the book, because they were resisting arrest, they had the right to use an excessive force, to use force to make those arrests. But an emotionally intelligent person probably would, or even a sane person would have thought, maybe not punching someone on a New York City subway. And the reason why I bring this one up, because not only does it kind of back my point up of bringing emotional intelligence into more training, or even after they graduate the police academy and bring it up more and more as they're in the department, because the New York City subways do not have a railing to prevent people from going into the subway, and they were very close to the tracks. So because of that one officer's actions, if the situation had escalated even more, there is a possibility that someone could have been pushed or fell into those tracks. And that's more or less my point, is that the officers with higher emotional intelligence would know how to handle those situations as best as they could. And I'm sorry, but a punch to the face is not handling that situation. And I also brought in the Black Lives Matter protests in the summer of 2020, because this is what kind of inspired this project. Because from what I saw, all the videos I saw on social media, again, social media is a very influential part of perceptions of police. You would see police officers seemingly attack people who were not doing anything, and everyone tried to justify it as riots, even though research showed that 90% of the protests were peaceful. There were very few that broke out in the riots, and yet all the officers there had tear gas, they had riot gear, there were assaults on protesters, seemingly unprovoked. There was one video of a officer who was seen shoving a woman who was 20 back onto the sidewalk, because it was in New York City at the time and they were allegedly out past curfew. Only she hit her head on the sidewalk, and she had a very severe brain injury because of it. And there was another one of what I call a prime example of low intelligence officer versus high intelligence officer, or in terms of emotional, because there was one of a man on his knees with his hands up, and you could see the officer shove him in the chest. Obviously unprovoked attack, and you could see it was a female officer, the one that had low intelligence. It was a male officer, female high intelligence, going and screaming at him, basically. That is not what you do in this situation. You walk away. And that is what the point I'm trying to make in terms of training, if there needs to be improvements, is that it's more or less teaching them how to control those emotions and not do things like that, such as the officers who drove into a crowd in New York City. I saw that video too. It was not very good, and they were not showing a good level of emotional intelligence. And another reason why I bring this up is because during this time, you also see that officers who may have been showing a high emotional intelligence were not able to do what they could have done, such as the woman screaming at her coworker for doing that. She was praised by social media, but there was another one of an older man in Buffalo or Rochester. I'm sorry, I can't remember the city, being shoved by an officer, and he fell and hit his head. And then you can see another one going to try and help him, only to be shoved away from him, and someone called for assistance. And the reason I bring this one up, because this is another one of them trying to help someone and possibly showing a higher level of emotional intelligence, only to be punished. And the reason why I bring that up is because later on I'm going to talk about other situations of an officer showing a higher level of emotional intelligence, trying to get the combatant officer away from a civilian, and instead they were punished for it. Now, when I get into perceptions of law enforcement, this is again to kind of reference this is how the public is going to see the police, and this is where emotional intelligence has the promise to be able to see the progress that people make, and how to potentially see a high intelligence officer versus a low intelligence officer. And like I said, when I mention this, I also mean that this is where their level is at that moment. Whether or not it can be improved or not is really up to the job and how they handle that situation. And the whole point is that because it is such a flexible skill, it's something that should be honed as they keep going on in the job, because the nature of the job is extremely scrutinized to meet expectations by the department and the public. They have to handle multiple groups that are challenging their authority, whether it be a teenager who doesn't want to listen or a drug dealer who doesn't want to get caught. And a modern officer is going to need more tactical capabilities and the blend of skills that practicing emotional intelligence can bring, because they're not just learning how to do physical action such as a takedown of someone who's resisting arrest. They're learning how to manage their emotions, not just on the job but within themselves, because this is a very mentally taxing job. It's one of the few careers that has an intense need for vigilance constantly, having a good mood and demeanor, at the very least like a proper mood at the time, and having the mental and physical endurance to do the job day in and day out, because this is a very emotional job. In some of my classes with Dr. Martin, he mentioned that he would be going from a shootout in Rochester to going to someone complaining that a kid is on their lawn. So it's a very it can be very high and low in terms of what you do, because you can go from a very stressful situation to a very relatively mundane situation very, very quick. And I also included race and political party, because this is also where emotional intelligence some of the skills can be incorporated more. As I said before, in terms of empathy with race, empathy is not being able to is not completely being able to understand where they're coming from, but why they feel the way they do. Because in a survey that I have found, a national survey, Black Americans were 5 times more likely to claim that they were victimized due to their race and ethnicity, because they were suspected of doing criminal activity. And the little symbols, if you look in the little notes in the notes thing, that's the survey that I had gotten them from, because there was about 3 of them. And by political party, I include this one because this is how the Democrats and Republicans view police treatment, and ultimately whether or not laws can be passed or legislation can be passed. Because of these views on police, Democrats are more likely to see a bigger problem when it comes to police use of force against minorities, and more likely to believe that it's a bigger problem because of the history of that minorities have had with police brutality in the past, versus Republicans who, when compared, are much, much lower, and to believe that they're the bigger problem. And because of this, there's also the confidence gaps within races. Black Americans have been marginalized for decades, if not a good century. Ever since slavery, they've had arguably the most hardships of any other race or ethnicity in this country. And even with that, there is no group that is completely anti-cop, because obviously, like, it's racist to assume that Black Americans are going to distrust the police all just as much as white Americans are going to trust the police, because this is not really the reason I bring in race at all is because this is where these skills can be utilized the most. They can, because in a situation where it's especially a white officer and a Black civilian, they have to be aware of how it's going to look in the media because of what happened in the past, especially with Eric Gardner, George Floyd, Tamir Rice, Sandra Bland. And Sandra Bland was the woman who was found dead in police custody and believed to have been murdered by the officers there. And it's because it also has a big impact on how they perceive the conduct of police, and it varies a lot. In terms of police tactics, courteousness, racial imparity, and competency, minority groups, especially Black Americans, are more likely to say the police do not have any of this and were more rude to them and use harsher tactics on them than white, and to say that they're competent at all in their jobs versus white Americans. And Hispanics, I found that tend to be more in the middle. And as a Hispanic myself, I can kind of understand, because Hispanics do not come in one color. We vary a lot, and that in and of itself can show the difference in perception of police. Because if I was to get stopped by a cop, from what I understand, from what my research and from my experiences tell me, I have a good chance of being treated much more courteous and much less forceful than my brother, who is much darker than me, and he basically looks like Ice-T back in the 90s. And the reason I bring this is because, like I said, perception is where people social occurrences are how people get their perceptions of police. And because this is where you are going to see emotional intelligence a lot. Because someone who has a high level of emotional intelligence is going to be aware of the different factors that are going to be in. A white American will never be able to understand what a Black American has gone to, but they can empathize why sympathize is what I'm trying to say, why they may be more hesitant to call police. And I'm going to talk more about that in the next slide. But the whole point of this is that because this is such a big part of the job, working with civilians, and because perception is such a heavy impact on how police can do their jobs, because it's how much people trust police. If you have officers with a higher emotional intelligence are more likely to be much less combative, as I said before, and much more sociable. And just by having a good interaction with police can help raise someone's trust in police itself. And that's why I believe it should be implemented in the training much more. Now, I've mentioned little things of ways to improve over the course of this presentation, and this is kind of to go in depth of what I meant by some of these. One of the things I found was by the Department of Justice, by recognizing the challenges in the community, such as the history of injustice among minorities, by race, sexuality, gender, not to disregard those experiences, because they do play a big role in how people perceive police, even among generations, and to try and reduce bias by improving cultural competency. And this is where emotional intelligence, empathy especially, and social awareness can come in. Because even if you don't fully understand someone's cultural competency, you can understand why it makes them act the way they act, especially in terms of the injustice among minorities. Because if someone knows someone especially who had a very bad experience with police, they are more likely not to trust police because of that experience. And this is where you're going to see emotional intelligence, the benefits of it, because this is the job basically. And another one is to develop emotional intelligence. And I had the belief that it should be implemented in training much more than it is. And how to develop it is usually to manage the negative emotions by not letting them take over, basically. By not letting the fear take over in a situation, or your anger, because there is a time and a place to do that. And especially in law enforcement, it can be, as we've seen, it can be very harmful or very deadly. It's also very good to be mindful of vocabulary, because you can't scream at somebody because you want to or because you're angry. That's how situations escalate. Another one is practice empathy, which ties in again to the other ones I saw. Even if you don't understand why someone's acting the way they do, you can understand the situation that led up to people acting the way they do. You can understand. You can you can be able to control your own reaction to that situation, especially the example of a civilian being very unruly. You can control how you react to what they say and what they do. And another one that I saw was know what stresses you or what triggers you. And I think the article mentioned try to avoid those situations. In law enforcement, it's harder to avoid a situation that stresses you out because it can be a high stress job. But the big one was being able to bounce back, and this one is very important, especially after after officers go through a very stressful situation. In most of the departments, they go get mental health. They go check on their mental health. I'm sorry about that. And the point of that is to being able to process those emotions, being able to understand those emotions, and then find methods how to manage those emotions so that you're able to look at life on a different outlook. And sometimes this can actually help reduce police burnout, because the more that they understand their own mental health and especially their emotions, the more likely they are to be able to actually bounce back and do the job as they did before. Maybe not exactly as before, but it's still much more beneficial to the officer to be able to manage their emotions, not just in their job, but for themselves, so they don't burn out within the next 5 years. And the big one is to alter the paramilitary training of officers, also known as demilitarizing the police. And this involves getting rid of the warrior cop mindset and switching to the guardian mindset. So instead of us versus them having that blue line because a lot of officers, because the job is so much different than a lot of professions, a lot of police officers don't they do develop that us versus them mentality because no one else is going to understand the job like they do. A lot of the public doesn't see the things that they see on a daily basis. And going from warrior to guardian is designed to try and get rid of that mindset and turn and promote officers to make friends outside of the department or to do things outside of the department, or at the very least understand so that way they don't have the warrior going into battle mentality and instead have the guardian protect and serve as it should be. And not, like I said, not saying it isn't, but I wouldn't be doing this project if it didn't happen. Another one is to have equal focus on emotional intelligence skills than weapons and self-defense tactics. Now, obviously, all of these are important, but there should not be more emphasis on one than the other because they all coincide with each other. You can learn how to use a weapon and you can learn how to defend yourself, but if you let your emotions get the better of you, it can cause a situation to go from bad to worse, such as an officer going on a routine stop and being so scared of what he's going to see that he has his hand on his gun, or she or they, and instead reaching the moment that they get scared. And we've seen that of someone going to get their registration and the officer doesn't see what they have and immediately believes it's a gun and they start shooting. And I've seen videos such as that. And while there are instances where a routine stop can turn deadly, the whole point of this is not to develop for the worst, it's how to manage the situation that you're in now. Another one is to require longer training and higher expectations in education. This is a big one. I'm a big believer in this because there should be longer training for officers. Even with the 6 months training officer, that all depends if that training officer had a high emotional intelligence themselves. Like going back to George Floyd, the training officer was the one who had the low emotional intelligence and had his knee on his neck. And the two rookies were just kind of caught in the middle. Now, that whole situation, that's something completely different. But the point of this there needs to be much more training available to hopefully reduce these kind of interactions. And this kind of ties into another problem of Americans not being able to afford college or going to debt because college is so expensive in America. And they could always use the military, not the military, the money that goes into police work and put more of that into the training itself instead of having high grade weapons, military grade weapons, and riot gear. I mean, they're gonna need riot gear at some point, but they should not. Like I said, the whole point of this is not to villainize anybody. It's more or less how to handle these situations better for the future. And lastly, there was one of implement a duty to intervene, and I put in quotations Carryall's law. It was a law passed in Buffalo after a woman named Carryall, I hope I'm saying that name right, was fired because she got into an altercation with a fellow officer who had his arm around a man's neck while he was handcuffed. And she believed that he was doing more harm than good at the time, so when she went to pull him off, he struck her in the face, she lost a few teeth, and she got fired. And the news article that came out shortly after that said that she was making a dangerous situation worse. And I also saw this during the Black Lives Matter protests of the man when he was shoved and hit his head against the concrete in Buffalo. One officer went to go step in, only to be pulled away. And this is what I mean by duty of intervention, because if an officer believes that another officer is doing far more harm than good, they should have the ability to step in without fearing retribution, also known as the blue line, because it is well known in the cop world in the cop world, it is well known that people who go against what people believe to be acceptable in the department are ostracized, and sometimes other officers don't respond to backup calls, or they don't rush to help if they're in danger, and this can be dangerous to the officer who intervened in the beginning. And the whole point I'm trying to make is that the emotional intelligence training, if it's implemented more, especially during the department, these situations might decrease. And the duty to intervene is not going to be as ostracized in police departments, because the whole point of it would be they would not intervene in the first place if they believed the other officer was doing the right thing or doing more harm than good. At the very least, I hope so. And these are hopefully the benefits that you're going to see with higher emotional intelligence training or better emotional intelligence training in the police department. And this is usually better behavior among the officers. They improve their self-confidence and job performance. They focus on the issues, not department politics. Again, officers not focusing on the issue itself versus the blue line, oh, you have to protect me because I'm another cop kind of mentality, which still exists. Some people will deny it, but it does exist. And it also has better performance in a team/group setting, because even if you don't like another officer, you still know how to work with them. And you can also understand other viewpoints much more easily, or you should be able to, as well as have a positive influence on others, stay optimistic, as well as staying calm and have effective problem solving, especially in a very high stress situation. And I also included how to reduce stress / increase these benefits. This is more or less how to also develop your emotional intelligence as it is. Don't be a perfectionist. Lead by example. Stop negative thinking. Control what's possible and set attainable goals. And I added keep the dreams. And by this I mean most of the time that when recruits come in, they have these big dreams, and they have that is sometimes crushed by the reality of the job. And what they can do is set a goal that is attainable at the time and work towards making that dream a reality, such as working to get the promotion, working to resolve a conflict, working to have a healthier environment and healthier relationship with your fellow officers, as well as staying optimistic during the job as much as they can, because like I said, it is a very high stakes, very emotional, taxing job. So if you need time to get better mentally, then the department should be able to do that. And also lead by example, to be the officer with the high emotional intelligence and to show the recruits and the trainees what an officer should look like. And don't be a perfectionist and control what's possible is mostly because there are uncontrollable situations where you cannot control the outcome or you can't foresee an outcome. And the whole point of it is to not be the ideal, not be this guardian angel, even though you are supposed to have a guardian mentality. You still are only human. There's only so much that anyone can do in a situation. And the whole point of this is to learn how to control what you can control. You can control how you react, you can control what you say, you can control what you do. And that's the whole point of including emotional intelligence in law enforcement, to teach officers much more control, and hopefully these outcomes won't happen as much as they have. And that concludes my presentation. The next few slides are just resources. I did try to cut this down as much as I could. I didn't realize it would be this long, but I hope you enjoyed it.
This episode was pre-recorded as part of a live continuing education webinar. On-demand CEUs are still available for this presentation through All CEUs. Register at allceus.com/counselor toolbox. I'd like to welcome everybody to today's class, 50 Mindful Steps to Self-Esteem. The book was written by Janetti Marotta, and obviously I am just presenting information found in the book. What we're going to really look at here, we're not going to go through the book in depth, step by step, because obviously if this is something that sounds like it's a really good fit for you, you're going to want to read the book. But I am going to hit the highlights and talk about how self-esteem is developed and how mindfulness activities can really be used to help enhance self-esteem. One of the things in this book that I didn't like as much was the fact that that connection really wasn't made between why are we doing this particular activity and how does it build self-esteem. So that's really going to be my goal throughout this presentation, is to connect the dots for us. We'll explore how physical sensations give clues to what's important and whether you're living in harmony with your values, whether it's your head saying this is good, your gut saying and your heart, and whether that's telling you that it feels like it's something you should do. So we're going to talk about head, heart, and gut honesty. We'll identify and address thinking errors that may keep you stuck. We'll evaluate how emotions and the heart contribute to the development of self-esteem. And we'll examine how the environment impacts your self-esteem. So with the nature of self-esteem, what is it? How you feel about yourself is in contrast to who you think you should be, is really what we talk about when we're talking about self-esteem. So it's sort of a loosey-goosey concept, if you will. It's not something you're going to find in the DSM. It's just a concept or a construct that we are trying to help people understand more about themselves. The more rejecting you are of yourself, the more distress you experience. So if somebody is constantly telling themselves they're not good enough, or they're stupid, or they're fat, or they're ugly, or they're lazy, well, yeah, they're not going to feel too good about themselves. Imagine how you would feel if somebody was constantly telling you that. So whether the rejection is coming from within your own head or from someone else, it's still creating a negative impact on the self-esteem. And the more rejecting a person is of themselves, they're telling themselves they're not good enough, then they seek other people to tell them they are okay and say, no, honey, you're fine. So it's important that people have their own self-esteem and their own ability to tell themselves, I'm good enough, I'm smart enough, and gosh darn it, people like me. In order to develop healthy relationships, you need to feel good about yourself. Self-esteem is basically your relationship with yourself. It's you telling yourself you're okay. It's you being your own best friend. So before you can have a healthy relationship that's based on mutual respect and not just forming relationships to find somebody to validate you, you have to have good self-esteem. In order to develop healthy relationships, you also need to get in touch with yourself and your true values. When you're forming relationships with someone, you don't have to agree on everything. You may only agree on one or two things, but if those one or two things are very salient in your life, then you may end up being fast friends. So understanding what's important to you, because, like attracts like. We're not like magnets. We like to be around people who share similar values and similar interests. And we also need to choose actions that are in harmony with our true self. So if we're doing things that really don't fit our personality, maybe if I think back when I was in college, for a little while, I was in a sorority, and that just isn't who I am. I'm not somebody who goes out to parties 4 nights a week. I am not somebody who is exceedingly social all the time. That's just not my temperament. That's not who I am. So choosing actions that are in harmony with myself ended up meaning leaving the sorority. Not because it was a bad thing, it just wasn't for me. But if I should have stayed in that, or if I would have stayed in that situation, then I would have been kind of going against my own internal tendencies, and I would have always been sort of fighting myself. And self-esteem means feeling okay about who you are, the way you are, without having to fight yourself. So where does mindfulness fit in here? Mindfulness teaches people to live in the moment, so they're not stuck in guilt or resentment of the past. Things have happened in the past, and a lot of my clients will, when they present for treatment, whether it's for depression or anxiety or anger or addiction, I can't remember a client, and I'm sure it may have happened at some point or another, but I can't remember a client who's ever gotten to the point of presenting for treatment who had just a rockin' self-esteem. Generally there were some self-esteem issues going on there, whether they had developed over time or whether the person really had never had a strong self-esteem. It didn't really matter. When they were in my office, their self-esteem was pretty low. So helping them focus on the fact that you felt that way back then. That's how you felt, not going to take that away from you. Let's talk about how you're feeling right now. Not being paralyzed by fear of the future. People who have low self-esteem often have a lot of anxiety because they fear rejection, they fear failure, they fear isolation. So anything that changes may cause them to have a lot of high anxiety. So mindfulness helps them learn to put one foot in front of the other, focus on how they're feeling at the moment, and realize that they can tolerate a little bit of ambiguity. They can tolerate forward movement. The cornerstone of mindfulness is acceptance. So when we're teaching people to be mindful, we're teaching them to accept how they feel non-judgmentally, letting it be, not saying I shouldn't feel this way, and being patient with themselves and with the situation. So when we think about self-esteem, again, if we're experiencing a situation, we experience it non-judgmentally. It's just it is. You went to work, you got your evaluation, it wasn't what you had hoped it was. It is. It doesn't mean you're a bad employee. It doesn't mean that the world is going to come to an end. It is. Letting the feelings of frustration or guilt or resentment or anger or disappointment be. That's just where you are at that point, and not judging yourself harshly, because self-esteem is something that's always evolving. We aren't perfect. Oh my gosh, none of us is perfect. So even if you think of yourself as a relatively intelligent person, occasionally you're going to do some things that are really kind of silly. Are you going to let that negatively impact your self-esteem? Or are you just going to accept that, you know what, sometimes I goof? Hopefully we can get to that point with our clients where they can accept lack of perfection. They can just be non-judgmental about it and see it as it is, and maybe find some positives in it eventually. Mindfulness teaches that when you trust yourself and act with awareness and purpose, you become more self-reliant. When some of my clients are in early recovery, they've spent so much time minimizing, denying, blaming, justifying, rationalizing, that when they start getting honest and doing the next right thing, it's really scary. And they know what they're supposed to do, but their addicted mind says, nah, you really don't want to do that, or that's going to be hard, or you're going to fail. But they trust themselves and they do the next right thing, the acting with awareness and purpose, because they want to start living that recovery lifestyle. And lo and behold, they realize that they were able to do it. So they increased their sense of self-reliance. And sometimes that'll happen, and whatever they did, they acted with awareness and purpose, and it fell flat. Well, they can realize from that they can also tolerate failure. They don't need somebody else to pick them up. They can exist even if it's imperfect. So let's switch gears a little bit to mindlessness and talk about how that impacts self-esteem. When we ignore or invalidate how we feel, we're telling ourselves that our feelings are not important. Think about how that would make you feel if your significant other or your best friend came up to you and said, you know what, I don't really care how you feel, and went on about their business. It would impact your self-esteem a little bit. It would hurt. It would say, really? You don't care about me enough to pay attention to how I feel. Now, as a therapist, I'm going to say, if your best friend came up and said that to you, that probably means there's something going on with him or her. But when you're saying that to yourself, you got to say, all right, if I'm constantly ignoring and invalidating how I feel, then I'm telling myself I'm wrong or I'm not justified. So moving from that, how can I start paying attention and validating how I feel? One of the things that we talk about in mindfulness is just accepting that you feel the way you feel. It's not good or not bad, but once you acknowledge it, then you can do something about it. Mindlessness also encourages us to fail to integrate feelings, thoughts, sensations, and urges. How many times, and I think we're all guilty of it, have you had a feeling and you didn't even really notice the feeling? You just went to a drop back behavior to sort of numb it. I'm guilty of stress eating. And occasionally I will, be wandering around in the kitchen and just randomly eating. And my husband will be like, what's wrong? You're stress eating. You need to go out into the garden or do something because you're going to be miserable later. And he knows. I mean, after 20 years, he knows. But it's important to be mindful of how you're feeling. So when we talk about mindful eating, for example, we talk about paying attention to why you're eating. Before you eat, say, okay, am I hungry or am I stressed? But mindlessness causes us to just basically stuff our feelings or ignore them. When we're running on autopilot and not making time for things that are important, which is getting us closer to where we want to be, how does that impact our self-esteem? After, a day or two, it's not probably a huge big deal. But at the end of a week or a month, when you look back and go, well, I really wanted to get all this other stuff accomplished that was important to me, but I never found time for it. I just kind of got up, went to work, came home, took a shower, went to bed, repeat. So when we're running on autopilot, we're forgetting the things that are important, that we are assigning meaning to. Another impact of mindlessness on self-esteem is blindly adopting mainstream messages of who we are and what we should be, which may not be in harmony of who we really want to be. If we think back into the 70s, I think it was, when I was little, and they wanted to have everything gender neutral, because they didn't want to communicate messages to children about what they should like or what they should play with. Today, there is so much mainstream media between Snapchat and Instagram and Facebook and Google and television, and I could go on and on. We are bombarded by messages telling us what we should wear, what we should look like, what our thoughts should be, what our opinions should be. And if we follow those blindly without checking in and going, is this something that's important to me? And or is this how I really feel about it? We can get caught up and then look back later and not feel so good about some of our choices. We can also adopt mainstream messages that are not achievable or realistic. One of the things that always flabbergasts me is the models that are used in some of the fitness magazines that are stick thin. I mean, the camera adds some weight and they look stick thin in there. I'm like, there is no way she is running 25 miles a day because she's just so thin. She doesn't have the musculature to sort of support that. But if that message is coming from the advertiser, coming from the media saying, you need to look like this. If you are going to be considered fit, you need to have this body type. That may not be achievable or realistic for the majority of people. So what does that do to their self-esteem if they keep trying to achieve that goal and not meeting it? Mindfulness will encourage us to look at how we feel and validate ourselves, telling us it's okay to feel this way. Integrate feelings, thoughts, sensations, and urges so we don't act just randomly. We're actually paying attention to what is motivating or supporting our feelings, thoughts, sensations, and urges. And we're adopting messages and values that are consistent with who we want to be. Breathing in the body. Breathing is one of the first techniques in mindfulness that we can teach to just about anybody. And it's can be challenging with certain groups, but depending on how you present it, it can be, a relatively easy activity to do. By developing mindfulness and self-awareness, you can quiet your thoughts. Our constant noise in our head, I've got to do this, I've got to do that, oh, I shouldn't forget this, I need to remember to call that person. It often prohibits us from addressing the underlying issues of any emotional turmoil. There's just constantly chatter. So life becomes focused on just treading water. You're not dealing with any of the underlying issues. You're just trying not to drown in the day-to-day activities. So forward goals are exchanged for just surviving. Then when you look back over, like I said, when you look back over 2 months, 3 months, a year, and you had all these goals that you wanted to accomplish and you accomplished none of them, what happens to the self-esteem? By making contact with the present moment, you can find your strength, learn to grow, and choose how you wish to respond. So what does breathing have to do with all this? Well, the first thing you do when you're born is breathe and then cry. But it's one of our most primal basic instincts. When we breathe slowly, our heart rate slows down. When we breathe rapidly, our heart rate speeds up. When we breathe slowly, not only are we slowing down our heart rate, but we're also sending out the relaxation response to the body, which helps quiet the chatter. One of the activities is just taking a deep, full breath. Abdominal breathing signals the brain to slow down and relax. She calls it the rest and digest. By simply paying attention to your breath, you can often cause it to slow down. If I'm running or right after I finish running, I intentionally pay attention to slowing my breath down. When you go on a diet and you start paying attention and completing a food diary, and you're paying attention to how much you're eating, for most people, they automatically cut down on how much they're eating. When we start paying attention, things kind of slow down. Another activity she has in there is called feeling the loving touch, which is the breath. Life begins and ends with breath. Breathing helps relax the body and move the chi around. And it wasn't really discussed a lot in the book as far as moving chi, but remembering that our energy comes from getting this oxygen throughout our body to the organs, to the muscles, to everything else. As we breathe, when we breathe deeply, it gets more oxygen in there. It helps us relax and helps the oxygen gets to where it needs to be. In order to encourage people to stay in touch with their breathing, a lot of Americans tend to breathe poorly. We breathe shallowly and through our chest because we're stressed. We're clenching our teeth, we're tightening our back muscles, we're just like little stress balls. So if you put visual and auditory breathing reminders around, it will help you stop and take a breath and get that relaxation response periodically throughout the day. I have a activity monitor, and it goes off periodically reminding me that I haven't moved often enough. But I also use that activity reminder to remind me to take a deep breath or 3 before I get up and start moving around, and then I usually take another couple when I'm sitting back down again. That's an auditory reminder for me because I tend to habituate to visual reminders. I'll see it for the first 2 or 3 days, and then I'll just totally not even notice it's there anymore. In and out. Inhale and take in positive affirmations. Exhale and let go of the stress and negativity. Now, this sounds pretty easy to do. When you're working with adolescents or you're working with people with cognitive disabilities, you may need to break it down a little bit less abstractly. Have them list a bunch of different positive affirmations. One of my favorite is Hakuna Matata. So we'll put that up on the board and we'll start listing different positive affirmations. And it's amazing how many of them actually come from Disney movies, but I digress. As people figure out a positive affirmation that they want to hold on to, when they start to get stressed, you want to just remind them to breathe in and tell themselves that. And when they breathe out, feel the stress kind of leaving their body, because stress is a lot of heat and energy. Taking another step further, imagine inhaling a cooling, calming blue air and exhaling the stresses, which could be red, black, or gray. So if somebody is more visual in nature, obviously the second one that talks about the blue versus the red can give them something to really visualize when they're doing this activity. Read the inscription. Pay attention to what your body is trying to tell you. Last year, this actually has been a little more than a year now, I was having a lot of heart problems, and I would start feeling a tightness in my chest, and it just kind of wouldn't go away. And I ended up naming it Lenny from Of Mice and Men. And Lenny would just sit on my chest, and I couldn't get rid of him. So what was my body trying to tell me at that point in time? Was it a physiological heart issue? Was it stress? Was it panic? What was going on that I needed to read on the inscription to figure it out? Because it was a symptom. When you pay attention to what your body's telling you, you're going to be living more in harmony with your values. You're going to be getting closer to where you want to go. And or you may be able to tell yourself, you know, I feel really stressed about this right now. Positive affirmation, I can get through this, or this is what I need to do to cope with it. It's important to practice noticing points of tension, tightness, or heaviness and feel them relax or loosen as you exhale. So these are all still breathing exercises, but we want to encourage people to become more in tune with their bodies. As Americans, especially, we tend to somaticize a lot of our stress and anger and anxiety and dysphoria. So if we pay attention to what our body is telling us, we can identify when we are starting to have emotional turmoil and address it from there. If we're having emotional turmoil, then we want to go back to the self-esteem and say, I'm good enough, I'm smart enough, and gosh darn it, people like me, and what is it that is this burr under my saddle right now? Because as you feel strong, as you feel capable, as you feel more resilient, you're able to handle life's stresses as they come along. Thinking in the mind. One activity that I kind of like is the fly on the wall or an impartial witness. If you were sitting in a situation that was, maybe you were in a meeting and it wasn't going so well, and you took a break from the meeting, and generally what we're thinking at that point is what we are thinking, what we are feeling. Oftentimes when we're in an emotionally charged situation or state, it's hard for us to take multiple perspectives and take a time out and go, okay, what might be going on? So this activity can kind of help sometimes, because you can say, what would that fly on the wall tell me was happening? If that fly had to describe what they're seeing, what would they see? Stop sorting things into good and bad. Go through the day just to kind of get a clue about how often we do it, because, everybody does it. Some people do it more or less. Instead of sorting things into good and bad, they just are. It was raining today. Is that good or is that bad? Well, why do you need to put that into a pile? I didn't go to the gym today. Is that good or is that bad? You can argue both sides of the coin, but why argue about it? That's what happened. Too many times people spend so much time sorting and they focus or pay more attention to the bad stuff. A lot of times they'll artificially elevate the number of bad things. So we want to have people just stop it. Instead of looking at things as bad or good, they just are. Encourage them to see the whole elephant. Back to Lenny again. We want them to look at the issue. What's going on at that point in time? But what are the strengths? Because every situation has good and bad. So what are the problems and what are the strengths? If the person is not feeling very good about themselves because they lost their job, they may feel like they failed. They may feel like a failure. And we want to say, are you a failure at everything? Because that's kind of a global statement. So you got fired from your job. Good or bad, it's what it is. So what are the strengths that you have that can help you overcome this? And what are the positives of this situation? Maybe they didn't like that job. Maybe they can find another job. Encouraging people to not take one situation or one event and take it in and have it reflect who they are as a whole person. If they're walking down the street and they trip and they wipe out and fall on their face, and gosh knows I've done that. I am not the most graceful person in the world, but does that mean I am a complete klutz? No, it just was not one of my better days. I didn't take it as a stable, global, internal attribution. Spin the wheel of paradox. What is the opposite? If you're feeling like something is going against you, then encourage yourself to look for all the positives in it. So maybe you hate your job, and because obviously if you loved your job, you wouldn't be trying to have an intervention. But if you hated your job, it's like, okay, I really hate my job. I don't want to go to work today. Let's spin the wheel of paradox and say, what are the positives I can get out of this? Why are we looking for positives, and what does that have to do with self-esteem? Because as we find successes, as we find peace, we will feel more confident in our own abilities to handle distress. You're driving to work and traffic. Oh my gosh, traffic is backed up. You're going to be 45 minutes late. Well, yeah, that may kind of stink. What are the positives? Well, you weren't the one that was in the accident that caused the traffic jam. Maybe you can start making phone calls or checking your email if you're at a complete standstill. Finding both sides is basically where thinking in the mind comes. And in one of our prior classes, we talked about walking the middle ground and finding where both things can happen. Yes, we can be in a traffic jam and it can really suck, but we can also make use of that time doing other things. And it may just be doing breathing exercises, but okay, so cool. You have time to do some of your breathing exercises. And encouraging the no blame game. Yeah, not the blame game, but the no blame game. Not blaming yourself for everything, not blaming other people for everything, because generally everybody has a little part in it. So instead of using the energy to blame anybody, figure out how to fix it. Figure out what the positives are, figure out what the issues are, figure out how you got to this point, and figure out how to make it not happen again. When people experience successes, when they're able to fix things that go wrong, when they're able to see things as not catastrophic, they will start seeing themselves as stronger people. Emotions in the heart. You know, I told you we were going to talk about head, heart, and gut honesty. Now we're moving on to the heart. And our heart's kind of small. It's about the size of our fist, but it's bigger on the inside. Encouraging people to recognize all the emotions contained within their heart. There's love, there's empathy, there's compassion, there's curiosity. There are a lot of emotions that are contained within the heart. And no matter how much you love somebody, there's always room to love somebody else. It's not like there's a finite amount of love you have to give. And encourage people to cultivate warm-heartedness, not just towards others, but again, we're talking about self-esteem here, toward themselves. What would they tell themselves or tell other people? And whatever they would tell other people, they need to turn around and tell themselves. Plant your garden. And I like this one. Around my house, when we first moved in, I ripped out the majority of the shrubbery because my feeling, whether it's right or wrong, it just is, if I'm going to put that much effort into taking care of something, it darn well better produce something for me. So I replaced everything with edibles. When you plant your garden, you've got to choose. You only have so much time to cultivate a good garden. You can't just plant 150 things and tend to 6 of them. So when you plant it, choose what you're going to care about. There are a ton of things you would love to do, but what is going to be your focus? When we focus on too many things, a lot of things tend to wither and die. So encourage your clients to figure out which plants they're going to cultivate. And sometimes, you know, you can take this metaphor out and talk about companion planting and all kinds of stuff if gardening's your thing. But sometimes it's helpful to actually do sort of a visual representation of the garden so they can see what they want to care about, but then they can also focus on, are they giving it water? Are they making sure it's getting sunlight? Are they taking care of it? Tend and befriend themselves. They need to tend to their own needs. They need to become aware of what's important to them, and then they need to be their own best friend. You know, some days you wake up and you're like, you know, I would really, well, I do. I would really love to just sit around in my jammies all morning and drink hot chocolate and watch cartoons because that's where I am today. And that's okay. I'm like, all right, well, let's do it. So myself and my dog and cats and whoever else wants to does. But being kind to yourself and not saying, well, you shouldn't, you know, you're almost 50 years old. You shouldn't be watching cartoons. Well, the heck with that. I will be my own best friend. It doesn't, people don't need someone else to take them out to dinner. People don't need someone else to constantly provide rewards. We need to learn how to provide rewards for ourselves. Now, is it cool to have somebody else to take us out every once in a while? Sure. But it's important that people can provide their own rewards. Encourage them to count their blessings, or do a gratitude list, however they want to phrase it. What is going right in your life? And what part did you have in that? Because guess what? You probably had a big part in that. Life doesn't just happen, and especially if everything is going, relatively well, that means there was probably some hard work and dedication, and it wasn't just luck. So let's look at what's going really good and how you've cultivated that. And delight for others. Sometimes we can get the greatest amount of joy in being happy for someone else instead of being jealous or envious and thinking, well, I should have that. We can be happy for them. Yeah, they have it. Wonderful. Awesome. Does it make us any less worthy or any less of a person because we don't have that? No. Looking at other people's successes in terms of great for them is a lot better on our self-esteem than looking at their successes and going, well, I should have been able to do that. And being in the world. Claim your emotional baggage, please. Don't let it stay on the conveyor belt. How many times have we been guilty, or have we had clients come in who've had the same baggage that just keeps coming back? Maybe it's the same basic dysfunctional relationship that comes over and over and over again. A part of that as clinicians is for us to say, okay, clearly there's something that's not getting resolved here, so we need to do something a little bit different. But as clients or people who have baggage on the conveyor belt, it's also up to that person to go, I need to figure out how to get this baggage off. And don't give it to somebody else when you take it off. Don't say, okay, this is your problem now. Don't blame other people for your situation. It's important to claim it and go, this is my stuff. I'm sorry. I'm having a really bad day today. I'm not going to blame you for making me feel X, Y, and Z. It gives people a sense of personal power to go, yeah, it's my stuff. But you know what happens when we say that, yeah, that's my stuff? We can say, and I am going to let it go. If we give it to somebody else, then we've got to wait to figure out what they're going to do with it. So when we claim it, we take power over it and we can choose what to do with it. Listen, just listen. Listen to hear and understand, but that means listen to yourself as well as others. We talk a lot in counseling about how we spend too much time talking and not enough time listening. When the other person's talking, we're already formulating our response. Well, that's true for ourselves too. So we need to stop and be quiet and tell ourselves to just hush and listen to what is it we need and what is it we want. That also means silencing, going back to the very beginning, silencing all that chatter. You've got to get up and make dinner. You've got to do laundry. You've got to do this. You've got to make sure this gets, hush all that so you can listen to yourself. It's kind of like the difference between trying to have a conversation in a noisy restaurant versus on a park bench. We need to be in the world on the park bench. Speak with compassion to yourself and others. Try to take the compassionate viewpoint of what's going on with that person right now that might be contributing to them feeling angry, feeling hostile, feeling down, being just grumpy. Went to get chicken feed at the feed store the other day, and the young man who was at the desk is usually just all kinds of bubbly and all about customer service, and he was so flat that day. And I didn't take it personally because we all have bad days, but I felt that it was important to go the extra mile to make sure that I smiled and spoke with compassion, because he was clearly having a bad day. But we need to do that with ourselves. When we're having a bad day, say, you know what? I'm just going to do what I can do today and be okay with that. I love this next activity. Write your job description. What is your job description for being you? What are your goals and what are your duties? You know, at work, every year we write our job goals and whatever else in our performance plan. I don't remember what I used to call it when I was supervising people. And then at the end of the year, you had a performance evaluation based on the goals that you set forth and the duties you were expected to accomplish. So why don't you sit down and write those out and figure out what's important to you to get a good job evaluation on being you. This is the time when, as you start writing it down, you start realizing, you know, maybe I'm putting too many goals here. Maybe I'm putting too many duties here. I wouldn't do this if it were my actual job because I know there's no way I can accomplish it. Once you start writing it down and seeing it visually, you're like, yeah, maybe I'm being a little too demanding. So writing your job description is an excellent activity. And adolescents tend to do this pretty well too. They haven't had as much experience with performance appraisals and things like that, but they can get an idea about how to write a job description, especially if you give them a template. So ultimately, the goal is to realize that self-esteem begins in childhood. And we want to start teaching children to be mindful. We want to teach them to stay in contact with how they're feeling and learn how to calm their breath from the very early age. When they start feeling all hyped up, when they start feeling tense, help them figure out how to diffuse that. We want to help them figure out what their values are and what's important to them. We want to help them be aware of themselves so they can identify their strengths and develop their me identity. So, you know, who are you as an individual? In our society, we tend to want to be part of a group. We want to be interdependent, and that's great. But interdependent does not mean having the same identity as everybody else. We're not the Borg. Interdependent means taking our own individual identities and strengths and combining them to make sort of a greater good. Part of self-esteem development includes values identification, and this can start early. We can talk about honesty, we can talk about compassion, we can talk about trustworthiness. Kids get that. They know some of the basic values, and they can start learning why those are important and making decisions about some of the other ones, about what's important in their life. What do they see as an important value? We can help them start separating their wants versus their needs. You know, a need is something that's going to keep their body, mind, and spirit going. A want is something that, you know, they may really want in their heart, you know, like a new bike for Christmas, but is it something that they need? And we can also start helping them address those cognitive distortions, the all or none thinking. We can start helping them address the sorting into the good or bad piles and learn how to accept that some things just are. And we can encourage them to be aware of sensations, feelings, and thoughts. Why? Because it helps choose behaviors which are in unison with your values. Not all of us notice sensations first. Not all of us notice feelings first, and not all of us notice thoughts first. That depends on you. You know, I may notice that I'm being a negative Nelly as my first clue that I might be under stress. On the other hand, other people may feel a knot in their stomach and go, oh, I think something's going on. Or I've got food poisoning, but I digress. Probably something's going on. And still other people may hone in on those feelings and they know they're angry. They don't know what they're angry about right now, but they know there is something that is ticking them off. Whatever it is that they're most in tune to, helping them integrate those will help them figure out how they're feeling, thinking, and choose behaviors that can help them feel happy. Being aware of these sensations can help support people through the difficult moments, knowing that this tightness in your stomach before you go out and do a speech in front of 100 people, this is your anxiety. strong self-esteem and a sense of self-awareness, acknowledging that anxiety and saying, all right, it is what it is, can help people learn that they can move through the difficult moments. They can experience distress and succeed. Being aware of all these things also silences the critics, because a lot of times the critics are the ones that are bringing on some of these thoughts and sensations. They're heckling you. Silencing the critics, you can say, no, that's not how I feel about that, or that's really not how I think, if the critic is saying you should feel this way. And it helps you clarify who you are and what you want, because ultimately self-esteem is feeling good about you, not what your mother thinks about you, not what the woman down the street thinks about you, not what your boss thinks about you, but how you feel about you. Because once you have that, then you are going to start attracting other people who have a strong sense of self and can say, you know what, we can have differences, but we can be friends. We can have different experiences, but we can share those to make something that's a stronger something. So kind of to tie it all up in a bow, mindfulness is really just a tool to help people get in touch with what's important to them and to silence the critics and the negativity that often dashes a lot of self-esteem. So people realize and become more aware when they're being unjustly negative and critical of themselves, and holding them to a standard that they wouldn't hold their child or their best friend, or for that matter, anybody else to. We want people to feel good about themselves. Until they do, they're going to experience dysphoria at some point or another. If you enjoy this podcast, please like and subscribe either in your podcast player or on YouTube. You can attend and participate in our live webinars with Dr. Snipes by subscribing at allceus.com/counselor toolbox. This episode has been brought to you in part by allceus.com, providing 24/7 multimedia continuing education and pre-certification training to counselors, therapists, and nurses since 2006. Use coupon code Counselor Toolbox.
tell you a little bit about my story. I'm not an activist. I haven't changed the world or led a campaign. I'm here to just tell you my path so that you hopefully can take something away from it, because I don't like being honest with, this is the truth, I don't like being honest with press and interviews. I like being honest with you directly, which is each and every one of you. I feel like I can, and I'm just gonna start with the basics. So I'm 21. My mom had me when she was 16, and I'm from Grand Prairie, Texas, and she worked 4 jobs and completely dedicated her life into making mine better. So to me, she is the definition of a strong woman. And I love her so much because she's taught me those values so much. I have been acting my entire life, and I have known since I was first on Barney, you know, that purple dinosaur that I hung out with. When I was 11, the point being is when I was 7, I wanted to be an actress, and I wanted to live my dream. And when I was 11, I had a casting director tell me that I wasn't strong enough to carry my own show. And I'm sure all of you have been told that you don't have what it takes and that you may not be good enough and you don't have enough people supporting you, and you're being told all of these things when deep down it's all you want to do. You want to be a part of something great. You want to make something great. And it does more than knock the wind out of you. It crushes you when people try to tell you that you're not good enough. And it almost did for me, but there was my mom next to me, stronger than ever. And she said, the most important thing is to always trust in myself. If I'm doing something because I love it, I should do it because I love it, and I believe I can do it. So she told me to keep going. She told me and she taught me to turn the other cheek and let the critics be critics. And let us just trust ourselves. So for me, 2 years later, I got my own show, and the first thought wasn't, oh man, that girl when I was 11 said I wouldn't carry my own show, and I did. I mean, I thought about that for a little bit, but I thought about what my mom said. My mom was like, you have to trust yourself, and I realized if I didn't believe that I could do it, I wouldn't be able to be here. And I'm gonna say I live a very blessed life. I have so much to be thankful for. And a lot of you are a big part of inspiring me, because I don't think you get it, and maybe you're not told enough, but you inspire me to be better. And we should inspire each other to be better. I'm surrounded by people who are supposed to guide me, and some of them have, and others haven't. They pressure me. There's so much pressure. You gotta be sexy, you gotta be cute, you gotta be nice, you gotta be all these things. And I'm sure you can all relate. You all have pressure that you have to deal with every day. I'm sure with school, with work, with friends, with parents, with family, with parents. I know sometimes with mine. They tell me what to wear, how to look, what I should say, how I should be. Until recently, I had given into that pressure. I lost sight of who I was. I listened to opinions of people, and I tried to change who I am because I thought that others would accept me for it. And I realized I don't know how to be anything but myself. And all I really want you to know is that you are changing the world. I'm not changing the world, you're changing the world, and that's amazing. Please just be kind to each other and love and inspire people, because let's do it. Let's change the game. Let's change the game. The most important thing is that we learn, and we continue to learn from each other. Please stay true to yourself. Please just remain who you are, and know that we have each other's back. All of us have each other's back. I'd be lying if I said that I've never tried to make myself better by giving in, because I have. But I've learned from my actions, and for all the things I've done, I'm proudest of that. I've learned from my mistakes. I want you to know what it's like, that I know what it's like. Figuring out what types of friends you have, you are who you surround yourself with. So I just want to say, I hope I can inspire each and every one of you to just trust yourselves and to love and to be loved. And thank you for allowing me to come up and ramble and talk to you guys, because this is such a beautiful thing you're doing. Be proud of yourselves. This is great.
and welcome to another episode of Confidence According to. I'm so excited for today's episode because I have the gorgeous and inspiring Andrea Vessels with me. Welcome.
Thank you. I'm just so grateful that you're having me.
Thank you. I'm so excited to get stuck into it. We were already talking and I'm like, oh no, wait, we need to save this for the video. So Andrea is a life and wellness coach. She is Canadian, you will hear, and she's been living here in Cape Town for the last year. And so how is it that you landed up being here in Cape Town of all places?
Well, so my husband and I both met in Vegas.
Ah.
Yeah, we were both competing in 2013 and we started talking, started dating in 2014, and then we went to Canada for a couple months, and then we moved here. We moved to Durban in end of 2015, lived there for a year and a bit. Then Durban wasn't for me, so we decided to move to Cape Town instead of going to Canada or do another overseas move, which is really, really difficult. So
yeah, it's a big thing.
So we chose Cape Town because we came here on holiday just for a weekend, and I was like, this place is amazing.
It's
awesome.
I
love it here.
So glad to have you here in our beautiful city.
I love it.
And so you said that you met competing. What are you talking about there?
We did both fitness competing. So there are different organizations in bodybuilding, I guess you could say. There's bikini, and in my organization, there's bikini, fitness, and figure. So there's WBFF, there's IFBB. This is Lacey, by the way.
Oh yeah, we didn't introduce Lacey. This is Lacey. She's our guest appearance.
Yeah.
You might see a cameo now and then.
Yeah. So there's WBFF, IFBB. There's a bunch of different organizations around the world. So a lot of people do compete. We met, and we both were pros at the time. So in order to become a pro, you have to win an amateur show.
Okay.
And it's different for different organizations. So I think in South Africa, for example, you have to there's levels. You win an amateur, then you go to provincials, and then you go to nationals, and then you have to win first overall, and then you get your pro card. So it's a process.
Yeah.
With the WBFF, you just have to win your pro card, and you can win it at any amateur show, and you can be first or second. It depends if they deem you pro worthy.
Okay.
So Dan and I both did WBFF, and we were both pros. And then 2013, I think Dan got top 10 in the world. The years before that, I got top 10 in the world. And then 2014, we both competed again. We weren't dating at this period. We were just friends. And he got 4th in the world.
Wow.
And I didn't place that year.
Okay.
But that was my last show and his last show.
Yeah.
And yeah, so Dan and I both did pretty well. Dan did incredibly well. He is actually still the highest ranked in the country.
Okay.
So he got 4th, and the 3 people below him eventually all got world championship status.
Wow.
And no one in South Africa has gotten 4th in the world.
Oh my goodness.
Yet. So
wow.
Still, yeah.
Sure. And how long were you doing that? I mean, it sounds like quite an intense career. Is it a career? Like people do this for a living, or is it a hobby thing?
That's a loaded question.
Okay.
Because yes, I think a lot of people want it to be their career, but it's very difficult to actually make an income from it. So a lot of people don't know this, but you don't get paid to compete. Okay. You pay money, lots.
Yeah.
I think a lot of people get sponsorships, they get endorsements, they get free bikinis, free supplements, but they don't get an income.
Okay,
Only
I
the
see.
top athletes get income.
Sure.
I would say maybe the top 2%.
Yeah.
And those are the big names, that have 1 million followers, or I'm not exact, 1 million followers, or over 100,000 followers, but also lots of interaction, lots of pull. You can tell when someone has lots of interaction on their page, lots of comments, lots of likes. So companies look at those things. And so you were saying that it takes a long time to get a career. Yes, it depends what you want to get from the industry. Okay. So I realized that it was more of, for me and Daniel, it was our career because we're personal trainers. But if you're an accountant or you're a doctor or you're whatever, this has to be a hobby. Because it's a kind of a 24-hour thing. You're doing your meals every 2 hours, your everything like that. It's not impossible to make a career of it, but I would say you kind of have to be in this industry or you dedicate full time to being an influencer or a model or a competitor. And this is just my opinion. In South Africa, I don't think so. So I really don't see it being a career here. I don't see you being paid enough. Like, let's say the minimum to get by is like a salary of 20K or something. Never. That would never happen. Unless your sponsors actually pay you that. And unless you have 1 million followers, I can only think of one South African who is at that place. So, and he's amazing.
And so how long were you doing this for?
I started competing when I was 19.
Wow.
So I started training when I was 19. I did my first show when I was 20. I'm 30 now. And then I was 26 when I did my last show. So I did it for a solid 7-8 years.
And what made you decide to call it quits? I mean, because that's a drastic change in your reality, your experience of life. So going from that level of commitment, it sounds, to like normal, like the rest of us. So what made that happen?
Well, I'll tell you that it was kind of forced on us because we kind of had to choose relationship, getting married, moving, and moving around the world, number one, not easy. Number two, we had to focus on us and the move. And I was in South Africa, and it's expensive to eat like that, and it's expensive to compete. So we couldn't justify the amount that it is to do a Worlds show. So the Worlds is in Vegas. And that was the show. They're in Vegas or Toronto or London. It depends where the Worlds will be. But it's a huge amount, and it's either, and those, the first, so we've been together, I think it's 4 years now, almost. Crazy. 4 years.
Yeah, it flies by.
We, the first year was, okay, do we move or do we go to Worlds? Well, life took over. And we actually never really decide, and this is what's interesting, a lot of people will decide to not compete anymore and kind of make this big thing of it. And they'll announce, I'm not competing anymore. We didn't. We didn't see it coming until like a year ago. So what happened is we, like I said, the first year was like, do we move and put that into moving, or do we stay doing long distance, which we did for the whole first year of our relationship, which sucks.
It was hard.
We do long distance, or we compete, or we move, and that was like kind of a no-brainer. And then the year after that was, do we get married and start our life together and move out together, or compete? And again, it was kind of a no-brainer. And then last year it was moving to Cape Town. So we, moving, we've moved every year, more than that. It was move to Cape Town or compete. And again, no-brainer. And then when I moved here, we were actually involved in a show that was supposed to be planned here and stuff. It fell through, it didn't happen. But that was actually the turning point for me, was I was involved in the back end of it. And I decided, while I was planning it, I was like, you know what, this is actually it for me, because I hadn't been in it for 2-3 years, and then I was involved with all these athletes and all these people and planning it, and all these people asking me these questions like, oh, if I get a boob job, will I do better?
Wow.
And I was like, are you really basing this big of a decision on my opinion?
Sure.
So
it changed themselves.
It changed. It kind of brought back when I was 20 and I got my boob job for that reason. And I was like, I can't believe that. Because when you're older, and you see these 21-year-olds, and you're like, I want to save you for making the same mistakes I made. That was me. So I was this 29-year-old being like, oh my gosh, I can't believe these people. And it just kind of, I think I was just reintroduced and reminded of the kind of sad side of it, the not so nice side of it, So that's when I was like, ooh, I don't think I want to do this anymore. I don't think I'm gonna, because I never made the decision to not compete anymore. And another thing that I should mention is those 3 years that it took for me to get to that point were brutal. My body hadn't had a break in 7 years. So I gained, I honestly don't even know, I didn't weigh myself. I didn't want to put myself through that kind of torture. But I actually don't like weighing myself either.
Yeah.
And I'm a naturally curvy girl. For me
Yeah.
to diet like that for those 7 years was really difficult.
Sure.
I ate fish and broccoli 6 times a day for months, and I'm not exaggerating, for months. And I don't miss it, I'm not gonna lie. But I know that there are healthy ways to do it.
Yeah.
But I just think that it's one of those things that you have to have the genetics for it.
Yeah.
And I really don't. My husband does. He eats anything and everything all the time.
Yeah.
Looks amazing.
Yeah.
Good for him.
Yeah.
Not me.
Yeah.
So I actually would love for him to do it again one day.
Okay.
I think he has the potential. I think he should. For me, it just wasn't. And it just wasn't, it's not feasible for me.
Yeah.
And like now I'm thinking maybe family
Yeah.
and those things. And I just don't want to have that in the back of my mind
No.
to put myself back into that. I'd probably have to lose like at least 15 kgs
It's insane.
minimum to compete again. And I just don't want to.
No, absolutely.
Another thing I actually wanted to mention too, when you stop competing and it's been a part of your life for so long, you go through a major identity crisis.
I was gonna say.
I was a shape cover model, top 10 in the world, personal trainer, fitness model, bikini model. And then the hardest thing for me and my self-esteem, my self-worth, everything when we moved to Durban, I had spent, those years in Canada building up my reputation. I was well known.
Yeah.
I would go out to bars or go out and people would be like, oh my gosh, I know you,
Yeah.
blah, blah, blah.
Yeah.
And in Durban, it's like, oh, that's Dan's girlfriend.
Ah.
So you go from this,
Yeah.
and you try not to let it
Affect you.
but it did a lot.
Yeah.
Because I'd go out and I'd be like, oh, that's all I am. Yeah, I'm his girlfriend.
Yeah.
So I was like,
Yeah.
and I also had a company in Canada that I actually only closed down last year.
Okay.
It lasted the whole
Duration.
Yeah, it was called Get Ready Girls, and it was about women's empowerment and confidence through
Okay.
fitness. I had employees working for me and
Wow.
everything, and it was a huge decision for me when I moved. I let it run still for another year, but businesses, when you're not there,
Yeah.
I mean,
If you don't
it's a
have
matter
your
of
finger on the pulse,
time
yeah.
before they
implode.
And that actually, so my two biggest identities, and I guess my two biggest accomplishments by then, before I was married or anything like
Yeah.
that, was my business
Yeah.
and the
Competing.
body and who I was.
Yeah.
And then I lost both of those.
Wow.
So that was a huge knock for me.
Yeah, I can imagine.
Yeah. So that was, I would say, the hardest part.
Yeah.
And to go from one extreme to the other and not compete anymore, it takes work like every single day. And because I was new here, you
Yeah.
can't work.
Yeah, okay. Yeah.
Right? You can't
Yeah.
work. You're working on visas. You're working on
Yeah.
all these things.
Yeah.
You can't work, and you're just Dan's girlfriend, then
Yeah.
Dan's fiance, then Dan's wife.
Yeah.
And he's such a great person. That's great. But like,
Yeah.
I'm such an ambitious person
Yeah.
that it killed me.
Yeah.
It killed me. So that was very, very tough. Getting out of that industry was the hardest and the best thing ever for me. And the funny thing is when that show dissolved and it didn't end up happening here and all these things. And by here I mean Cape Town. The show is happening in Johannesburg.
Okay.
Then is when I was like, okay, I think I'm not going to be involved in this industry anymore. And it took 3 years of me just back and forth. Oh, do I? No, I don't. Yes, I do. Yes, I'm a trainer. I did everything on one day. I remember I was like, okay, I can't do this anymore.
Yeah.
And I called all my clients that are competitive athletes and I said, no more. I'm not
Yeah.
doing this anymore. And I referred a coach that I love to them.
Yeah.
And I said, I'm not doing this anymore.
Wow.
And I said, I had a few clients who are halfway through their show prep. And I said, I'll train you to the end, but after the show, you have to look for a new coach. Because I found that, and the turning point for me was I was sitting down to do this diet plan. And it was for a girl that I have trained for a long time. And we had just spent so long kind of fixing her from the competitive industry.
Oh.
And I was going to make a diet plan now for her to compete again.
Oh gosh.
And
so
I was
you're
like,
sending her back into the
yes,
back to
felt
the
like,
wolves.
Yes, that's what I felt like. And although I'm sure she'll do amazing, and the coach she has now is incredible, an amazing coach. It didn't sit well with my soul. I couldn't do it.
Yeah.
And I sat there and I was crying and I was like, I can't do this.
Yeah.
I can't do this.
Yeah.
So my husband was like, you've been checked out mentally for a long time. Just admit it. Make these two match.
Yeah, exactly.
My heart was wanting so badly to still be involved.
Yeah.
In that
Yeah.
industry, but then my
because
brain
your
was like,
identity was tied up in it for so long and it's all that you knew.
exactly.
And your ego is like, no, but that's us. That's who we are. That's
exactly.
what we do.
And it was like, you spend so much money and so much time, and
you've invested
and
a
another
decade
thing-
of your life.
Exactly. And but even with my Instagram and stuff,
Yeah.
I lost followers and everything
really?
because you're switching from
one focus.
well, they're used to
now.
seeing you in a bikini and half naked all the time and talking about superficial stuff.
Yeah.
And then all of a sudden you're making these deep posts.
Yeah.
They're like, show me your bum. I don't want to
Yeah.
see this. And I get it. You can
Oh my
go
goodness.
followers.
Yeah.
Like you guys are obviously
Yeah.
not my target market anymore.
Exactly.
But
growth. There
Yeah.
we go. That's what that's called.
yes. So yeah, it was a hectic period. But
So I mean, that as a woman and as a young beautiful woman, that you kind of your journey has been the extreme of
Yeah.
what everyday women go through in terms of
Yeah.
you know they've tried things, yo-yo dieting and
Yeah.
all, you hear about it all the time,
Invest
and
in
obviously
something and it
that
fails.
and that obviously impacts their confidence, their self-esteem, their self-worth, their identity.
Yeah.
Now, how did you, when you're going through, like coming out of such a strict regime, is that the right word? Regime?
Yeah.
And then
Regimen?
Regimen?
I'm Canadian. I say
Okay,
regimen.
there we go. And then coming into a normal
Right.
way of life, and then starting to see your body go back to balance, because obviously our bodies always are
Wanna be
aiming
in
for balance.
homeostasis.
Like
Yeah.
that is just
That's all they want.
That's all it wants.
Yeah.
You mentioned as well about body shapes,
Right.
And that if you are a certain shape, you can't wish you were a different shape.
No.
You are that shape.
If you're like, for me, for example, I know my genetics since young. My body gets chunky easy. I get curvy easy. I get chubby easy. Soon as I hit puberty, it was like. Plus, I like to eat.
Yeah. Well, who doesn't?
Right. So
Yeah.
my downfall.
Yeah.
But you can't, like, I have girls who will come up to me and be like, I want to look like this Victoria's Secret model. And I'm like, well, you're going to have to grow 2 feet, which is a lot. And you're going to have to completely change your genetics from the inside out. And if you find that pill, please give it to me.
Yeah.
But otherwise,
Yeah.
we can only make you the best version of you.
Yes.
And that's the only thing anyone can ever
Yeah.
hope for. And one of the weird things for me over this last year that I've been in Cape Town and deciding not to train athletes anymore and kind of stepping out of that industry and just being more wellness focused and life coaching focused was I realized that the last 4 years that I was hiding in my little bit of excess weight. So I've started losing, but it was weird. It was a weird realization for me. It was only a few weeks ago, actually.
Oh, wow.
Yeah, that I was never taken seriously when I was a model at all.
Oh,
and
interesting.
I know that the women respected me because of the way I carry myself and the confidence that I have. But even just friends, long-term people and stuff, if I would show up somewhere, people would say things like, oh, sorry, we didn't recognize you with clothes on. Or if I would give my opinion and stuff, people would just be like, yeah, okay, you're here to just be pretty.
You just go and,
So I think when I got out of that industry, and it's a thing that you don't think, like, you don't know you're breathing poison air until you breathe clean air.
Yes.
And I didn't know how people saw me or anything until I was out. So once I was in Durban, it was a weird thing because not a lot of people get to start their lives over with people who don't know them, don't know the mistakes they've made, clean slate, which for me sucked because I worked so hard before. I kind of wish that I had messed up the whole first part of my life and I could have just started fresh here, ran away from killing someone, you'd never know. But I started with a clean slate, but I didn't really know who this person was. So I wasn't unhealthy. I still always train. But I was drinking more because I didn't drink like my whole, I was drinking more. I was not like I went from being extreme to being like, let's say this is healthy.
Yeah.
Whatever your definition of healthy is, I was a little bit here.
Yeah.
So I realized a few weeks ago that like I was sitting in this because I was so comfortable with the fact that people saw me for me and not for just my body. And I didn't realize that. So I kind of have had to go back now this way to be like, no, actually, like I do deserve to look the way I want to.
Yeah.
I felt like I didn't deserve it anymore because that's not who I am anymore.
Yeah.
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 And I didn't realize until someone kind of, when someone says something that is about themselves, but you obviously make it about yourself, and you're like,
Yeah.
ooh, me too.
Yeah,
I do that too.
yeah.
So, so that everything comes around and came around recently.
Wow.
And so now back to being healthy and back to being motivated again. But yeah,
it took that process of, and maybe it's like redefining who you are.
100%.
Actually, who am I? Who am
And
I?
I find
until
that,
you know.
And I find that if you're constantly progressing,
Yeah.
you're gonna have to do this all the time.
Constantly. I know it's there's never an absolute
Yeah.
point of, okay, now I get it. Now
Yeah.
I know who I am.
Never.
Constantly evolving, constantly
Never.
growing. And earlier you mentioned about then those different body shapes, and that, so then women are setting themselves up for failure because they have expectations that
Right.
are beyond what is physically possible for them. So can you explain what the different shapes are that women would be able to then identify, and then for them to be able to accept and then do what's best for them?
So you have ectomorphs, mesomorphs, and endomorphs. And generally, you can be one or a mixture of two. And it goes ecto, meso, endo. And ectos are the naturally thin supermodels. I mean, I can't describe it other than they're tall, they're thin, long limbs,
Narrow.
very narrow, they're usually straight like this.
Yeah, like boy.
Yeah. Yes.
Shapes.
Yeah. And then you have the mesos, who are usually bodybuilders. They put on muscle easily. They're more average height, average size, average limbs. They're not usually taller or longer.
Yeah.
Because you can be short and be an ectomorph, but you will have long looking limbs for your height, if that
They need
makes sense.
to like be petite looking.
Yeah.
Yeah.
Ectos usually are those people who forget to eat.
Okay.
Yeah. Not me.
Yeah.
And then endos are people who are they hold a lot of weight. They have usually wider hips.
Yeah.
Hips and waist is usually bigger.
Yeah.
And
like bigger bone structure.
Yeah. So for me, I'm a mixture of meso endo, kind of a mixture. I put muscle on easily and I can lose it. It's just, it is difficult for me. I do tend to lean a bit towards the endo side. So it really depends on who you are, and also on your genetics and what you eat every day, your physical activity, everything. You can combat your genetics 100%.
Okay.
You can.
Okay.
It's just for some people it's going to be more difficult than others.
Okay.
Basically.
Yeah. And so their commitment to both nutrition and exercise is going to
Exactly.
vary depending on where they are.
And for me, it was worth it. Then it was worth it, and I was willing to do anything and everything to fight my genetics and to become what I wanted, which was a pro and cover model and all these things. But who I was then is like a stranger compared to who I am now.
Yeah.
So I, right now, knowing everything I know, wouldn't do that again.
Okay.
But then it was so worth it. You know?
You felt at the time it was
Yes,
worth it.
at the time it was worth it, and
Okay.
I actually obviously wouldn't know my husband. I would
Yeah. All the dots had
no
to
regrets
connect.
whatsoever.
Yeah.
Clearly.
Yeah.
But
yeah,
the havoc that I'm more like the fact that I gained weight. I'm at peace with that, and I think I could have gotten over that quick.
Yeah.
It's the identity crisis and the losing my self-confidence and my self-worth and everything and starting from scratch
Yeah.
is what really that I could have
Hit
done
you.
without.
And so how did you start to heal that? How did you start to get to that point of rebuilding now your self-identity, your confidence and your worth?
Yeah. Work every day.
Yeah.
So a lot of people, my close friends know this, and I would talk to them about this a lot. But the funny thing is honestly, because I had the last 2 years kind of off and the last year and a half without my business, I listened to podcasts all day, every day. And I would get up and just do some form of exercise, even if it was just walking or literally 50 squat jumps or sit-ups in my house, just to feel productive.
Yeah.
Okay. And I would listen to podcasts. I've read a lot.
Yeah.
Self-help books and Girl Squad books and all of that.
Yeah.
I did online courses that were free. I got free booklets for stuff like what you do.
Yeah.
Stuff like that.
Yeah.
But I don't think anyone, even those closest to me or even my husband, can fully comprehend how much work I had to do.
Yeah.
Because it looks like me sitting on my phone.
Yeah.
And I am very much it's taken me a lot of work to be a vulnerable person. I'm really not. My dad is like old school, comes from an Irish background. Like you no.
Don't show anything.
Yeah, do not show weakness, I would say, is like kind of his motto. Yeah. So and because of my job, I can't ever, like, as a life coach and as a health coach, you can't really have a breakdown, because then it's like she don't know what she's doing.
Yeah.
So
she needs to get her shit together before she gets mine done.
Yeah. So I really played down a lot what I was actually going through, and dealt with it myself.
Okay.
But reading
Yeah.
YouTube videos, actually I can't believe I forgot that one.
Yeah.
You know those like ridiculously cheesy motivational ones?
Yeah.
Those.
Yeah. No, I get that.
Because
I get that. Totally.
But I actually remember being in a place, and I'm sure some women can relate to this, where you listen to it and you can't even listen to it because you're so far away from that. You listen to it and you're like, this is so dumb.
Yeah.
Who feels this way?
Yeah.
Like, who actually is this motivated?
Yeah.
Like, I remember listening to that. It's kind of like the same feeling that you get when you're in like a really toxic relationship with your partner.
Yeah.
Like when you're with the really wrong person, and then you watch, you listen to love songs, or you watch a movie,
Yeah.
and you're like, this is so not real.
Yeah.
Love like this doesn't exist.
Yeah, exactly.
It's the same thing, but
Yeah.
with anything happy. Someone has something happy going on in their life, and you're like,
it's fake.
This is fake. It's not real.
Yeah.
How
can it possibly?
Yeah.
Yeah.
So I went through that first.
Wow.
And again, because I do so many exercises with my clients and I write programs for a living, I had to do more work on myself than anything. And I don't know how women do it who never even just sit down and have to do these things. I don't know how they progress, because you have to sit and look at yourself every once in a while and be like, whoops.
Yeah.
Let's fix this.
Yeah, absolutely.
Like, I think the reason why I am a good coach and why I am a good life coach is because I do that every day.
Yeah.
Every day I'm like,
yeah.
Oh, you suck at that.
You're doing this introspective work.
But not in like a
derogatory.
Like, it's like I would say that to like a girlfriend. Like, you screw that up, hey?
Yeah.
Like, ooh, better tomorrow.
Yeah, absolutely.
So,
well, that's the awareness, having that self-awareness and recognizing opportunities.
Exactly.
In yourself
and that's why it's so important to, like, you have to be strict with yourself, but also really easy on yourself.
Yeah.
You have to be disciplined in some ways. And then
compassionate.
when you, and finding that balance, changes all the time.
Yeah.
So when I was in that very vulnerable place that I just told you about, where I was like, I can't even watch these YouTube videos, and listening to these podcasts of all these amazing women that I listen to, it was torture.
Yeah.
I was like, I can't even listen to this.
Yeah.
But I persisted.
Yeah.
Because of my background in fitness, I know that you might diet for 30 days straight, but it's that 31st day where you actually see
what
change.
you're looking for.
So I would listen to these podcasts that were grading me, because I was like, I can't even listen to this, but I would just listen.
Yeah.
While I walk, or while I do the dishes or clean or do laundry, I would listen to these podcasts, and my husband would come home and be like, because it sounds almost like, like those like rah podcasts.
Yes,
like,
yeah, absolutely.
What do you do? So that phase was the hardest, because pushing through when you don't even, and I had no direction either. I was like, who the heck am I now?
Yeah.
And you're listening to these podcasts like, you're amazing, and you're like, yeah. Totally, yeah.
Yeah. And all you're really identifying is the gap between where they are, where you are, and like it's just there.
So
where is the connection?
one thing I tell, and so the funny thing is what I used to tell my clients, and then what I ended up having to tell myself, was you bridge the gap by saying, I'm working on it.
Yes.
All the time.
Yeah.
So if someone's like, because affirmations is a big part of the courses that I do, and I am beautiful and I am wonderful was so hard for me to say. So I would say, I'm working on being.
Yeah.
I'm working on.
Yeah. It is. It's that belief. Like affirmations are great.
Yes.
If you believe them.
Yeah. If you don't believe them,
you're just repeating
you're-
nonsensically to yourself.
You're saying like, this lamp is nice.
Yeah.
It's the
Yeah,
same
exactly.
thing.
The sky is blue.
Yeah. Yes. Mhm.
Yeah.
So
Yeah.
so that phase I think was the hardest, and the work you have to do. I don't think people understand. It's like, I always compare it to dieting because that's just what I was good at.
Yeah.
And it's the same. It's due diligence every day, even when you don't want to, even when you're crying as you eat your fish that you don't want to eat, even as you're doing the cardio you don't want to do. You have to do it.
Yeah.
And so, like I said, I would listen to the podcast, cry, watch the YouTube videos, cry, and then talk to a client and tell them
What
how
you've
to
just
be
learned.
happy, what
Yeah.
I've just learned.
Yeah.
And they would be like, oh my gosh, this is amazing. And then I'd be like, I feel like a hypocrite.
Yes.
Because
Imposter syndrome.
yes, big time.
Yeah.
Big time. And that was a whole year.
Sure.
And I actually took on less clients the whole last year up until recently. I just took in a bunch around the new year.
Yeah.
But because of that,
Yeah.
because they'd be like, I want you to help me with this. And I'd be like,
Well, I'm still sorting
Me
that out
first.
for
Yeah.
myself. Yeah.
so work. And it's different for each person, I think. I think every person has a different aspect of confidence. But I think because of my history, it is a bit easier for me to do it daily because of the discipline that I had to have.
Yeah.
A lot of people just don't have that. They wake up to go to work
Yeah.
because they're getting paid.
Yeah.
That's the only discipline they have, but
Motivation,
it's monetary motivation.
Yeah,
They don't have
A deeper
things
why.
they need to
Yeah.
do.
Yeah.
Sometimes, some women who are mothers, they'll do things they don't want to do, obviously, all day, all the time, but it's got to keep the kid alive,
Yeah.
and you love it. It's
Yeah.
your heart outside your body. So
Yeah.
a lot of people don't have to do that
Yeah.
thing they hate all the time.
Yeah.
And we're in a culture that's just like, do what you love all the time.
Yeah.
And, if you don't love your job, then quit.
Yeah.
That's not life. That's
Yeah.
not life. If you don't love doing your affirmations, nobody does when you start. So
Yeah.
it's hard to
Yeah.
find that balance, because you should love your job.
Yeah.
But you might have to go through growing pains like the rest of us.
Yeah. It might be a stepping stone to the next thing.
Yeah,
That's it.
100%.
And I just love the message that you've really drummed home here now, because within the context of your physical history of
Right.
that commitment, now this mental and it starts out as a mental process,
Yeah.
and without realizing it becomes a spiritual process in the same
Always.
time,
Mhm.
because of this opening and this awareness and awakening.
Mm-hmm.
But I love how you emphasize that, because I agree completely that
Yeah.
I think most people think, well, that you just somehow
born with
magically, or osmosis, you have to actually do the
People
work.
think you're born with good bodies.
Yeah.
People think you're born with confidence.
Yeah.
And
it's
neither
not.
are true.
Yeah.
Yes, some women are born with more confidence than others.
Yeah.
And some women are born with better bodies than others
Or
by
better
society
yeah,
standards.
Exactly.
But
it can be changed.
Yeah.
It can be.
Yeah.
It's just how much you put into it, and it
At the
comes
end of-
down to what you put
yeah.
in, you get out.
100%. At the end of the day, we're all people.
Yeah.
And some of us are going to be scientists, and some of us, like myself, can't do math.
Yeah.
Same
here.
at the end of the day, we all serve a purpose, but
Yeah.
intertwined with each other. And
Yeah.
we're here to help each other. And I think that my life was like, I've been through so much just at 30.
Yeah.
And that's why I realized, because I had this thing that I wasn't going to be a life coach until I was 40.
Okay.
Because for me, that was the age of a woman who has experienced life.
Who
you
has
know,
something to share.
Who has something to share, because I just pictured myself as a coach at 30 dealing with women who are in their 50s. And I made up the conversation in my head that was like, you're 30, what do you know? And I literally made up this whole scenario, and I was like, oh, okay, well, 10 years, I'll work on it till then and everything. And then one day, I don't know what it was or what I was listening to, but someone said these words that was, your experience is enough.
Yeah.
And I was like, I have been through a lot. Long distance relationships, marriage, moving around the world, living everywhere, all these things that a lot of people, they go through one of them.
Yeah. And
you
they
know?
think they've done something huge.
Yeah.
Meanwhile, you've got a whole list of them.
So what I mean is I can relate to so many people, and that's actually always been my skill. It's what I'm good at. So I realized, you know what, I can do this now, and I know I'm good at it. Because one of the reasons why I was such a good coach when I was just a wellness coach is because I knew that your weight had absolutely nothing to do with actually your food. It was your mind. I would say, they say like it's 80% nutrition, 20% diet. I think it's 100% mind. I don't think it has anything to do with other things, because if your mind is in order, you'll sort everything out. Everything.
Completely.
Your confidence, everything will come from the strength in your mind. And it doesn't come from confidence. Confidence is a piece of it, a very big piece, but it's your, like I said, it's your discipline, it's your mental strength, your physical strength, like to go through, to deal with some of the haters that you're going to get when you're in a position of authority, or you put yourself out there to be judged. Guess what? You're going to be judged. And
exactly.
it sucks. So I think that was a huge, again, another thing for me was realizing, like, actually,
why wait 10 years? You've got enough of a story, and I think there's so much power in just sharing your story. I mean, it's phenomenal to think that you've actually lived through what you've just described, you know, in these few minutes.
And I think some women go through years to kind of realize what I realized in a year.
Absolutely. And so now on a scale of 1 to 10, you know, 1 being completely, you have zero confidence, 10 being take over the world, where are you?
Okay, so 1 was last year.
Okay.
And then I would say I'm at a 9 now.
Awesome.
Yeah, I again, for me, this is just my personality type. I'm impulsive. I make decisions like this. When I made the decision, okay, I'm doing this. It was it. Game over. It was in March.
Okay.
When I was like, I'm not in the fitness industry anymore, and I'm not going to compete again, and da-da-da-da-da. And then it was like, I cried, and then it felt like someone had taken a boulder and just lifted it off of me. And I was like, and from then, so I didn't close the door. Like a lot of people in the fitness industry will karate chop that door shut. They'll like kick it shut and then bolt it closed because they have such pain attached to it. I just closed it. But as soon as I closed it, it was like other doors just flew open, and I knew exactly where I was going, and I have such clarity with where I want to be in my life. Even if I have a bad day in any respect with side jobs I do or anything, it's like if I'm having a bad day and someone's like, or any criticism or anything like that, it doesn't affect me now because I have direction. And I think that's what a lot of people are missing, is that direction. Because what happens is, and what happened to me, when you don't have your identity kind of solidified, or you don't have your direction solidified, things like the job that I described to you where I was planning this show or whatever, they come, and because you're in a vulnerable state, you veer off course. And you're not meant to do those things, and that's why they'll shut in your face. They'll be karate chopped closed in your face.
Exactly.
And you'll think, oh, what's wrong with me? It's something to do with me. But it's because it's not on your path. It's not
aligned.
If you keep making, if your path is here and you keep going like this, that's fine. You're always going to come back. And it's going to 99% of the time be painful.
Exactly.
Because
until you've learned that, and then you stay on course.
Your dharma. It's there.
It's guiding you.
So you can't I feel now that I have this direction, it's so different. But again, like I said, when you're breathing toxic air, you don't know until. So I feel that's why you go this way, because you're like, well, I could use this and I need it, and maybe it's a stepping stone, and then nope, and nope. So that's life. It's not going to be like this. But once you kind of know where your direction is, like for me, when I made that decision, nope, none of this anymore. My attention was gone from that. It was like life coaching, and now I have a podcast coming. I have all these things coming that I've always wanted to do. But I was like, oh, when I'm 40. Oh, and 10 years from now, when I'm a real woman, when I'm like real mature and have, some validity behind me. Guess what? I have validity behind me, and I can do it if I want to.
Absolutely. And so you mentioned, all the podcasts and the books and the the YouTube, all these things that you consumed in order to help you with your own personal development. So do you still do all of that in your day-to-day life? Do you have a daily routine that you implement to make sure that you're staying on that track? What does that look like?
You have to, or you fall off. It's so I listen to a few podcasts still, and they always give me good ideas and help propel me forward.
Which ones in particular?
I really love the Champagne Diet.
Okay.
Kara Alwaleba, I love her. I love Angie Lee.
Yes,
I love
Rich Bitch,
her.
yeah.
We used to talk when I used to do fitness and stuff.
Oh,
and I reached out to her the other day, and then I saw like all this conversation, and I was like, oh my gosh, I forgot that I had.
Yeah.
So I fangirled a little bit.
Oh, awesome.
I love the Precision Nutrition podcast, just for my nutrition stuff.
Yeah.
I love Lori Harder's podcast. She also was in the fitness industry when I was. So it's weird because these are all people I kind of knew or like have known as a creeper for years.
Yeah.
So it's inspiring because they all have similar stories to me.
And they've all left the industry same as you?
Yeah.
Okay.
They all have very similar stories to me where they were like just these now liberated women helping other women. And my whole thing, like, so my purpose has always, I've actually always known my purpose. You know, like when people will sometimes be like, what's your like someone as in those exercises you do online and stuff like that. I'm sure you know what I'm talking about. One of them will be like, what brings you great happiness? And since 19, when I started Get Ready Girls, it was my mantra that was on the website was to educate women about nutrition and fitness in a positive female environment. But it was always about body, mind, and soul. Even when I was 19, I would make them do affirmations, all these things. And so I've always had that direction. And even when I was what I described last year, even when I was at my worst, I never lost sight of that.
Yeah.
I would help the women around me in the best capacity that I could. Some of my friends were going through some really hectic stuff, and I was the pillar for them. And that was a great
mirror reflection.
Yes.
This is what you're doing.
Yes, because they were going through some crazy things, and I was being so there for them.
Yeah.
And then I would be like, but that's because of the person that I am. I don't recommend it for other people who are in a very vulnerable position. For me, it brings me strength to be there for other people. So I was kind of like being this strong person for them, being like,
while you're going through your own shit.
Because it's a nice distraction.
Yeah.
Number
and
one.
it's a win-win, really.
Yeah, but number two, it makes you feel good.
Yeah, absolutely.
Yeah.
Gosh. And so then your daily routine, have you like a morning routine or something like that? Do you
I
kind of do these
am
things?
so type B.
Okay.
I do not plan anything.
Interesting.
I know. It's weird but here's the thing. I am type B, but very disciplined.
Okay.
I'm type A personality, but I'm very type B with the way I run my life.
Okay.
So like I will kind of do whatever
you feel like.
Yeah. But every morning it's podcast.
Yeah.
And then I'll either do my workout in the morning or in the evening. And then while I do cardio is another podcast. And only when I'm feeling like really needing that little push is the YouTube.
Okay.
But podcast every day.
Yeah. Awesome.
And different ones, different people, but the three women I mentioned in particular are ones that I really like. And yeah.
And so now you're doing the life coaching and wellness coaching, and you've actually combined the two, worlds really, as the physicality of it and then the mental side of it. And so if your clients, are they generally still women who can relate to that previous, the fitness industry, or are they everyday women who just with their everyday?
Mostly everyday women.
Okay.
And you attract what you put out.
Yeah.
So when I was in the industry, it was all girls who want to be that. Because I think we kind of are attracted to who we kind of want to be. So now it's a lot of women who are my age, who have kids, who they are tired of, I want abs, and they're like, I just want to be happy.
Yeah.
And that's mainly the women that I train now.
Yeah.
Is women who they're tired of all this information, they're tired of trying this, they're tired of trying that. And they're like, I just want something that works.
Yeah.
And my approach is, you gotta work.
Yeah. And so what's your advice if a woman comes to you and so she's feeling, like, where do you start? If she's feeling all of this overwhelm, this pressure, she's not happy with her body, she's kind of she's all over the place and is questioning, what's the point? What's your kind of starting point? How do you start and ease people? Because it is, like you say, it's a lot of work and most people are not aware or prepared for it. So where do you start?
I think it's a decision. And I think most people who have been through this will agree. It's a decision. And everyone is different. Some people need to slowly make a decision, but you have to make the decision. And if you're even thinking about it, I think you should start researching coaches.
Yeah.
Whether it be like a confidence coach or a wellness coach. It doesn't have to be just a diet.
Yeah.
You can start with a coach that's like, okay, let's help you get your life on track. Full stop.
Yeah.
So I think that it starts with a decision, and then you have to find someone that you trust. And some people they need a psychiatrist because they want that doctorate behind it, and they only trust their brains in the hands of doctors. And you know what? Do that.
Yeah.
But go.
Yeah.
Or like me, that wasn't an option for me financially. So free stuff online it is.
Yeah.
You wouldn't believe what you find when you look for it.
Yeah.
Free this, free that. I even have so much free stuff on my website.
Yeah. Okay.
And podcasts are free.
Yeah, exactly.
And they're amazing.
Yeah.
So that's why I'm doing my podcast now, is kind of like payback to the universe.
Totally.
For what it got me out of, and I'm hoping to help other women that way too.
And this process of getting into a good relationship with your body, are you saying then you start with the mind and then the body, or you start working on the body and then the mind? What's the chicken or the egg?
It depends where you are.
Okay.
So for me, I had to go backwards because I started with the body. Or not backwards. So for me, the steps in the Awaken program the chapters are called Nourish Me, Move Me, Know Me, Love Me, Connect Me, Awaken Me.
Awesome.
So those are the 6 steps that so for me, I think if you get to know your body types, you get to know how to move your body.
Yeah.
You get to know how to feed it.
Yeah.
You get to know how to, know me is like, you get to know your personality, and you do these personality tests, and you do all these things to kind of see how you react. Like I just said, so for me, I know I'm not a schedule person. And when people give me spreadsheets and schedules, it freaks me out. I can't do it. So I know that about myself. So if you can kind of let people know up front, like, hey, by the way, this is how I roll.
Yeah.
They kind of have to respect that.
Yeah.
Because if someone says to me, I'm an introvert, I'm like, okay, I'll talk a little softer around you, because I really understand introverts. I've gone out of my way to understand introverts. A lot of my friends are introverts, and you can't take it personally when they're like, I don't want to come out tonight, I'm introverting. You're like, good for you.
Yeah.
Like you can't take things personally. So the Know Me, I think, is so important. And then Love Me comes after Know Me, because you can't love yourself if you don't know yourself. Connect Me is how you connect with others, because I think it's one of the biggest bases of who we are as humans, is connecting with other people. And Awaken, I just discussed karma, dharma, your purpose. And I approach it from kind of a faraway perspective, because I'm not there yet. But I introduce it as like, this is the goal.
Yeah,
this is what we want to do.
The meaning of life.
Yes, this is what we are all hoping to do.
Yeah.
And good luck.
And if we were all aiming in that direction, the whole world, the ripple effect, would be amazing.
So, to answer your question, you can start with the nutrition, because I think it requires the least amount of introspection.
Okay.
Unless you have eating issues and stuff, which most of us do.
Yeah.
But if you are just one of those people that just wants to kind of get started on this journey, and you don't have massive weight issues, you don't have former eating disorders, start with your food.
Yeah.
And eat more fruits and vegetables. How hard is that?
Yeah, exactly.
You know, just get started, then move your body a bit more. And then you can start
easing into the whole. progress.
Yeah, you can then get to know yourself a little bit better, and then you can start to love yourself. Yeah, so those are the steps that I take. You can do it backwards. Some people are like they know themselves so well, but they just can't get their eating right. It is because of lack of knowledge. It's just that you can sort that.
Yeah, absolutely.
Yeah.
And so where can people find out if you know this is resonating with somebody watching this? Where is best for them to get hold of you if they want to find out more?
You can message me on Instagram. I have a Facebook fan page. There's an Ambition Online Instagram and Facebook. And then I have my personal Drea Vessels, DREIA WESSELS Instagram, and Andrea Vessels Facebook fan page as well. But the website that you can check out is ambitiononline.fitness.
Okay. Awesome.
So if anyone wants to check it out.
Awesome.
Yeah.
Was there ever a time when you were starting out in your fitness side of things, and now you're wearing like the skimpiest of bikinis and walking out on stage in front of
hooker heels.
In hooker heels.
Yeah, not a
in
joke.
front of my goodness, in front of an audience of, I presume, mostly men.
Yeah.
Or,
Lots
okay,
of women
whatever,
too.
whoever, complete strangers.
Right.
And like, was there ever this like, how do you even? I can't even fathom like how. I struggled to just walk down on Camps Bay Beach in my bikini, let alone up on a stage. And presumably you started somewhere where you were not at world-class level.
Right.
How did you do that? Like, what was that like?
Well, I can tell you it was really hard.
Was it?
Yes. But the thing is, when you've worked so hard for so long, you actually are excited to get on stage and kind of showcase the hard work. The hard part comes after, when you hear the judgments. Oh, you weren't as lean. Oh, you weren't as good as you thought you should be. That was my experience, was getting on stage and being like, oh my gosh, I worked so hard for this. And then you get off stage and then the judges go, 10th place.
Yeah.
You're like comparing yourself to the girl beside you, and then it makes you ugly. Because you're like, I'm better than her.
Yeah.
And I'm so against that now.
Yeah.
I'm like, you all win.
Yeah, absolutely.
Yeah, so that's the hard part, is after.
Yeah.
And obviously the hard work all before, but I'm talking about
exactly.
being in a bikini on stage, that's not super fun.
Okay. And now, like, bikinis,
I struggled with that.
Yeah.
Again, last year, I struggled with that. I was sitting at a heavy weight and but again, I worked so hard at loving myself at that weight. And I'm very lucky I have an amazing husband too. He helped me a lot to get through that.
Yeah.
But I like my shape. I think I still carry my shape well. I still have a small waist. I still train every single day. I just am not obsessed with it anymore.
Awesome.
And it's really liberating.
That's like, I can feel like this global sigh of relief almost, you know, and that's what you want to get to, that you can just, whatever it is you are wearing, if you're wearing nothing, just
and I think
love where you are.
I think as long as you're healthy, and I think only a doctor can tell you if you're healthy. Yeah. Because I know some women who are very overweight, but they're healthy.
Yeah, absolutely. And there's not just a one definition of beautiful and ideal.
You define it for yourself.
Yeah, totally. Mm-hmm. That's awesome. Thank you so much.
Thank you. Yeah.
And then lastly, what does confidence mean to you?
Confidence to me means accepting who you are, and not just accepting who you are, but loving who that person is, and loving that person even when you feel like that person's not worthy. So it's acceptance and love of who you are, and we are a sum of our actions. So being cautious and conscious of that, and every decision we make, making it from a place of love, full on love for others, love for ourselves, and then I think it will resonate and come across as confidence.
Thank you so much for joining us and sharing your insights and your story, which is phenomenally powerful. And I know that everybody watching this is going to really take something special away and some big learnings.
So. And anyone can contact me anytime.
Awesome. Thank you.
Thank you.
Well, there you go. I hope you enjoyed this episode. Please do reach out to Andrea. She's got some fantastic offerings and programs, and come and sit next to this woman and learn from her firsthand how you can become a more confident version of you. So until next episode, see you then.